Hello, good morning. Welcome, and I'm going to call to order the March 9th, 2021 Board of Supervisors meeting. And could we please have the roll call?
Supervisor Levere.
Here.
Supervisor Long.
Here.
Supervisor Huber.
Here.
Supervisor Ramirez.
Yes, I'm here.
Chair Parks.
Here. And would you all please join me in the Pledge of Allegiance? To the flag of the United States of America, republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. And let's go to the minutes of our meeting of both February 23rd and February 25th. Do we have a motion?
Huber, move approval.
Thank you.
Long will second.
All right, we have a motion and a second. Can we have roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And thank you for taking those minutes so well. Our next item on the agenda is our agenda review, and I will turn it over to our CEO, Mr. Michael Powers.
Good morning, Chair Parks, board members. Item 38, Resource Management Agency, public hearing regarding adoption of an ordinance to update landscaping requirements within the unincorporated non-coastal zone. PowerPoint's been submitted. Item 39, Resource Management Agency, de novo hearing to consider a conditional use permit to authorize the installation of a wireless communication facility near the Muscle Shoals community by AT&T. 14 comment letters, PowerPoint from staff and from the applicant have been submitted. And finally, items 43 through 52, closed session, conference with legal counsel, existing litigation. A comment letter from Matt Wickersham has been submitted. And that's it. Thank you.
Thank you very much. With that, do we have a motion to accept the agenda as revised?
Huber, so moved.
Thank you.
Second. Well,
Go ahead, Supervisor Ramirez.
I second it. Thank you so much, Supervisor.
We have a motion and a second. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And then we're going to go right now to our moment of inspiration. And as everyone knows, this is Women's History Month. And today we have for us Lori Peters. We know that Women's History Month offers us a chance to reflect on the courage, the strength, the passion of trailblazing women who have overcome discrimination and hardships to stand up for justice, equal rights, freedom, and inclusion in America and really all over the world. This year is particularly special because we recently celebrated America's election of the first woman vice president. And soon, someday, we will also have a first woman president. During this pandemic, we thank the many heroines and the front lines, and we know that we have so many out there fighting against COVID-19. These women make up a large share of our essential workers, from childcare providers to grocery store and farm workers. Women make up a large share of the essential workforce, and also particularly women of color who are ensuring our country safe and healthy, well-fed, educated, and looked after. Today, we will hear from Lori, Ms. Peters, who has worked with the Thousand Oaks branch of the American Association of University Women's History Committee for over 20 years. Their program educates Ventura County students in honor of Women's History Month by bringing to life the amazing women of history who have helped shape our nation, our world for the better. And I would not be surprised if all the women here on our Board of Supervisors have participated in these women history events, going out to the classrooms, right? It's so wonderful to do that. I learned from reading about these women and also being able to portray them. Really a wonderful experience for the students that I think they will always remember. So at this time, let's bring forward Ms. Peters, and I believe there's also a PowerPoint. If IT could please put it on. And Lori?
Good morning. So glad to be here with you. Thank you very much, Supervisor Parks, for the introduction, and thank you very much for inviting me to this moment of inspiration for Women's History Month. My name is Lori Peters, as you said, and I've been a member of the AAUW branch in Thousand Oaks for over 20 years, and this branch in Thousand Oaks has the notoriety of having created first-person narrative scripts. We've done that for more than 40 years. The scripts initially were presented by adults, members of the program, but about 20 years ago, we started working with students, coaches that were in the schools, mostly Ventura County area schools, Conejo Valley schools, and so the students could learn to present a first-person narrative of these groundbreaking women. And, I used to always go into the classrooms to recruit students to be a part of this program. And sometimes I would have to remind them why we need a program like this. I would ask them to list some of the famous people that they knew from history, and they would bring up Albert Einstein or Abraham Lincoln or Thomas Edison. Sometimes they would say Rosa Parks, but very rarely would they be able to come up with a list of 10 famous women that they had read about in their history books. So these scripts have been really important. Oftentimes the girls end up presenting women that they would have never heard of. So the pictures you see here in this short PowerPoint are just students that I have worked with personally, but understand that this program has been going on in other schools. This is repeated. It's the remarkable work happening with many of these programs is terrific. I don't know if you can see in this slide here, in the picture in the upper left-hand corner, if you recognize the student wearing the blue shirt, that is Haley Steinfeld, a famous actress. She was in our program in 2007. We presented our public performances at Barnes & Noble, at the Thousand Oaks Library, at the schools, but also in the classrooms where the kids would get involved. The National Women's History Project is something that was started in Santa Rosa, California, but it's not something that has necessarily driven the Thousand Oaks branch of AAUW to create these scripts. Our scripts have been put into 3 different books. I don't know if you can see that there. This is the Profiles of Women Past and Present. We also have these scripts available online. We donate some of these books to area schools. They're really motivating. So the students you see here, it's obvious how proud they feel. I can't begin to tell you how much this program benefits these students positively. Not only do they learn about new role models, but they realize what's possible for any young person. And they shine as public speakers. They shine as representatives of history. And so a couple of little facts that some people might not realize is that, and I wish I could tell you this program is no longer needed, but we have a long way to go. If any of you follow the World Economic Forum, they rank countries in a variety of areas, and the United States has been dropping in the global gender gap over the last 5 years. In 2020, out of 153 countries ranked, we were ranked 53rd. In 2017, we were ranked 49th. In 2000,
I'm so sorry to interrupt you. I've been told that the audio has come down off of our Facebook, and they would like us to just pause for a moment. Is that correct, Ms. Lori, is that correct? Lori Key?
I can pause the meeting, yes.
And that is correct, Chair Parks.
Thank you.
I understand there's lots of static.
Yeah.
as well. Thank you.
Thank you.
So I'm ready to pause it for a few.
Where
Yes,
would you like me to
I
pick
think
back
so.
up? I don't know. Did you want me to go back over that or just pick up where I had left off?
All right, Peters, what?
Or-
I'm ready.
Okay, we're good.
We are back from our brief recess with a little adjustments to our IT. We did receive the regrets of Lori Peters, who could not continue because she had another appointment. So our Women in History Month, she did do a wonderful PowerPoint, and so much appreciate the program that the AAUW, the American Association of University Women, bring to our schools. And I know I was mentioned at the beginning that all the women on our Board of Supervisors have participated in this, where they do, they have portrayals of really important women trailblazers, truly. And Supervisor Ramirez, I know that you wanted to make some comment, and Supervisor Long, and even Supervisor Levier.
Just very quickly, thank you, and so important to recognize this. I wanted to just clarify, I've watched the presentation. I've never had the opportunity to present, but if I could, I'd present probably somebody in my family who heroically supported their family through very tough times. But I did also want to just say it's so important to recognize that we women have gained rights to help our entire families by voting, by having equal access to work. We have a long ways to go. And I always like to say, if we don't use our rights, we'll lose them. And we know what's happening in other parts of the world where women cannot participate in the careers of journalism or teaching or medicine and many other things. And so while we will continue to protect our rights here in the United States, really need to think about helping women all over the world because I think that will create a better world for all of us. Thank you.
Thank you. Supervisor Long, did you want to comment?
Yes, I did. I've been involved with the AAUW, especially on the historical, bringing famous women to our classrooms. And the last one I did was Jane Goodwill, and she was an amazing scientist. And it was such a great opportunity to have young women be presented to our classrooms and to give the girls in the class an inspiration of what they can be and who they can be. And so it's always been such a pleasure to do it. It's hard to do it remote, but I do know that so many programs are going on still with the teachers and the students. So just thank you for bringing this inspiration and reminding all of us about this. So thank you.
Thank you. And Supervisor Levier?
Madam Chair, and I guess Ms. Peters is gone, but I just wanted to thank her. And I was curious about those books she mentioned. I think those are great books to give, young girls. I know my daughters would love to read those books. And I was curious, maybe she can send out information on their website or ways that the public can buy those books, because I know I'd like to buy a couple. I think that would be great.
Thank you. And it is nice that part of the Association of University Women helped put together the little profiles that are then presented to the classrooms throughout all the school districts in our county. It is a wonderful way of really kind of that hands-on learning where they actually see the individual and they portray it. So I will certainly ask Ms. Peters to see if we can get at the source for those books, and you can share them with your daughters too. Well, thank you all for this moment of recognition of Women's History Month. And let's go ahead to our next agenda item. And this will be consent items 12 through 29. And unless there are any questions, do we have a motion on these?
I just wanted to talk briefly about item 23. It's in regards to the Workforce Development Board submission of collaboration grant application. And just want to state I really support the apprenticeship program, and it's designed to serve 125 participants throughout the region. It is a collaborative force with our other counties, and just want to make sure that people know that this program is going on, that we are doing this grant, and it's not just in training, but digital outreach campaign, work site visits for apprentices, and then also supply of laptops and also additional supportive services. So I wanted to make sure that that was mentioned, even though it's in our consent. So appreciate our staff working on this, and I want to say thank you. I think it's important that it's really focused on the high road construction careers and climate investments, low in carbon economy workforce program. So the regional partnership is really great, and wanted to highlight that. Thank you.
And it was
that all motion.
Was that item 21?
Item 21.
21, yeah. I wanted to also call out item 29, which is one that also works with workforce development in bringing broadband. And that broadband to disadvantaged communities will help people be able to do a better outreach for job searching. And that is one of the aspects of this broadband grant. That's item 29. It's in collaboration with our Ventura County Library, the Workforce Development Board, and the America Jobs Center of California. So we are, I know as a county, very focused on being able to ensure that everyone has broadband. It's like a utility. Everyone should have that right. So real happy to see us going for that grant opportunity too.
Agreed.
Supervisor Ramirez, did you also want to comment?
No, I love the comments. Thank you very much.
Okay, thank you. All right, so with that, we do have a motion to approve the consent agenda items 12 through 29. And can we please have the roll call?
I think. Sorry, do we have a second?
Who seconded it?
Yeah. I'll second.
Moved by Supervisor Long, seconded by Supervisor Levere?
Yes.
Supervisor Levere?
Yes.
Supervisor Long?
Yes.
Supervisor Huber?
Yes.
Supervisor Ramirez?
Yes.
Chair Parks?
Yes, thank you. And now that time in the meeting that everyone it really tunes in on, because it's such an essential part of our daily lives, and that's being able to understand and get rid of COVID out of our society and move forward. And towards that end, we have our total COVID overall report coming from all our departments on what the county is doing to respond to it, and how that is all working out. So at this time, I'm going to turn it over to Mr. Powers and let him lead this item.
Thank you, Chair Parks, board members, county team, and community members. Yes, so we'll give you a comprehensive report this morning, and wanted to just highlight that this is about 1 year out from the first member of our community who was identified as having COVID. And wanted to just take this moment to just reflect a bit with your board and the community on where we've been. You can also see all the areas we're going to touch on in the presentation today, including health updates, school reopening, rental assistance and business assistance program updates. But so we'll just take a moment. So it is 1 year later, and just in that time, we've seen over 1.1 million tests performed. Right now, over 233,000 vaccines administered, 3.5 million meals delivered, 5 million units of PPE, 16,000 business ambassador visits, 550 at-risk homeless individuals housed, over 11 million in rental assistance, over 40 million in business assistance provided, 3.5 million in county farm worker household assistance provided, 838 county employees reassigned from their jobs to serve as disaster service workers, over 78,000 COVID cases, and of course, we must never forget, 895 deaths. So we can see what the experience our community has been through. We just want to take a moment just to reflect on that. We, all of these things that happened up here were the result of your board support and our community support. And we couldn't do it without it. Relationships matter, particularly in our county, with 2 degrees of separation. That's how we get things done. and with schools, with community organizations, with nonprofits, with our business community in our cities. It's really important that we had those relationships beforehand, because we've been able to leverage them in our response this whole year, and been innovative as well, whether it's telehealth or remote working. A lot of adaptation has happened, and now we're heading in a good direction, right? And so there's a comeback, right? And so it's exciting to see that we're heading in a positive direction, and we know there's so much pent up demand, and our businesses are ready to get rolling, and we need to support that. But at the same time, we have to be mindful and never forget the people who have felt the impact, lost loved ones, those who've become ill, those who've lost jobs or businesses, or have been struggling to sustain during this very challenging time. And so one of our goals, and we know one of your board's goals, is to make sure that this comeback applies to everyone in our community, that we don't leave anyone behind, any individual, any family, any business. And we appreciate the role of the communities play. That's the difference maker, right? It's a resilient community that continues to step up for others in their community. And that compassion has helped put us on this positive direction. I did want to take a moment and just highlight, I mentioned disaster service workers. We're getting a lot of comments back on our vaccine clinics, very positive comments about the efficiency and just the way people are treated as it should be. But just want to give you a sense of how many employees of your county employees have been reassigned from their busy jobs to stop doing what they're doing to work on these different feeding seniors, business support, OES, test site support. About 86% of our county departments have participated. Over 838 employees have been reassigned in order to make this effort go. Currently, there's 382. And just to give you a sense, here's what our departments look like. And you can see it has taken a significant percentage of the staff of many of our departments, most of these over 15%, some up to 35%. And that's as it should be, right? These employees know when they sign on to work at the county that they're all disaster service workers, and we have to stop what we're doing elsewhere to focus on our priorities. And this is just a few examples of agencies that are doing that. And as I say, they're helping run the test sites, and they're doing a great job of running these the vaccination clinics. So with that, I will turn it next over to Mr. Zimmerman to give us an update on vaccines. Thank you.
Sure. Thank you, Mike. And I'm just going to give you a brief status. You've seen these slides before, so we'll update the numbers. To date, as of March 8th, I guess, we've administered 233,000 doses of the vaccines. As you see, there's 164,000 individuals that have received their first dose. That is significant, about 24% of our total population. You see the growth here on the ages and what we're targeting. As you know, our target was first 75-year-olds, then we expanded to 65-year-olds. So of the senior population, we've done just over 90,000 individuals. That's about 64% of the total senior population we have in the county. Wanted to recognize we've seen from the last report I gave you of the under 65, we're around 45,000 individuals. We've almost doubled that up to nearly 80,000, which shows our impact in the essential worker population that we are targeting now. There is receiving vaccines at a high rate. Next slide, please. So this is to give you an idea of where we are and where we're headed. The current phase is, as I said, senior 65 and older, and we see a very good, significant penetration in that. We've seen significant growth in our ag and food industry, as well as education, childcare, and emergency service workers. That's the current eligible population that we're working with. And we are reaching out to entities and groups in order to assure that they know they're eligible. The next phase coming up is this coming Monday. We'll be opening on March 15th, individuals at the ages 16 to 64 with certain medical conditions that they have high risk for morbidity and other conditions that where COVID would be critical if they contracted the disease. And so these are the targeted individuals that we will be working with and opening the eligibility for the vaccine. We have been working with the medical community in educating them on this, and what is known as hot tips is a bulletin that goes out to medical providers, providing them with these criteria as well as a potential form letter that they can issue and sign that would help the patient qualify for the vaccine. We will require documentation at the appointment time when they come in to receive the vaccine, that they show evidence that they meet these conditions. We're not asking for diagnosis and those type things. What we're asking for is that individuals receive a note from their doctor saying that they are one of these high risk patients and are eligible. So we hope that that will come with some adjustments as we move forward, but we feel it's the most organized approach to open up to this population at this time. Next slide, please. All right, thank you. So with our efforts there, as I just described, our current phase, we estimate about 280,000 individuals are within that population. We've served first dose at 164,000 throughout the group. We know not everyone will accept the vaccine, but we do measure it on the total eligible population there. I wanted to highlight, though, that we have mobile teams out working in particular in the ag industry that have gone out to multiple farms. We've been at 20 locations and worked with other 46 different employers and have vaccinated over 4,000 farm workers in their working environment, which has received tremendous positive feedback there. That doesn't mean that's the only arena by which agricultural workers are accessing. Many are going to our community sites that we have, as well as we've run special clinics, in particular at the El Rio site, at the John Flynn Clinic that the Ambulatory Cares run a weekend ago, and this weekend we'll also be doing special targeted events. As you know, educators have been a target. We've opened it up, and in the first week have vaccinated over 10,000 educators in our first week of operations, and have more dedicated appointments and a special event planned for this weekend for the Conejo Valley School District with Los Robles as our partner. Next slide.
Control it. Click on it sometimes it makes it go. If you click on the screen.
Thank you. I just wanted to highlight again our current network that we have operating and why this is important. So we have capacity to deliver more vaccines than what we receive. Right now, we have received an increase about 2 weeks ago that gave us a new level where we're just around 30,000 vaccines received a week. We have capacity to go higher than that. We are in a plateau right now for this week and next week. It is projected will be flat, and hopefully by the end of March, we will see that increase as the state receives a higher allotment of vaccines as well. We are receiving the J&J vaccine this week, and we will be using that both in our mobile teams as well as offering it to the public. It is a rather small allotment, and we will
control it, but I cannot
offer it to the community, and do not expect replenishing that until the end of the month, according to the state's supply of that vaccine. I wanted to note that we have built up a broad network here and are working with the third-party administrator, and the sites that we have located throughout the county, as well as our partnerships with pharmacies and other entities. We cover the county at 90 to 99% of all the health equity areas have access to a vaccination location. That is one of the requirements of the third-party administrator, and we already meet that requirement. And so as they come on board and have also their networks, we will have a very good coverage throughout the county for access and for individuals to get vaccines within a location that's close to where they live. As future sites expand as part of this strategy, we anticipate that the Santa Paula site will be open this coming Monday. Many staff members are working to prepare that building and to get it ready so we can launch on this Monday. We have walked through several sites as of yesterday in the Simi Valley and continue to work on additional locations throughout the county. Next slide, please. So I just wanted to make aware this is how individuals will access their appointments is by going to our webpage, VenturaCountyRecovers.com. And we do have our phone bank. I wanted to make aware that under the state's direction and where we're moving is that we are transitioning our sites over to the My Turn application. We have already done so for the Thousand Oaks site this week. The transition has gone well without significant challenges there. So that bodes well as we are over the next week to 2 weeks, we are going to transition all sites to the My Turn application. Individuals still can go to our county website. We will link it to the My Turn application directly, so they will be able to also access it through multiple avenues. Our help desk will continue to operate. The My Turn application also has a phone assistance line that individuals can access as well. I wanted to make note that right now the My Turn does not limit individuals from out of the county to make appointments. We are still under the policy that if individuals from Los Angeles or Santa Barbara County make appointments for our locations here, we will turn them away, and we are only serving residents and those that work within Ventura County. Also, to make aware that we do have a mobile team and that individuals can call. We will publish a number in which individuals are sending emails to us that we're able to schedule the mobile team to go out to their homes as we work throughout their neighborhoods. So that's a quick update of where we're at and where we're headed associated with the vaccination efforts. We anticipate our efforts to grow as vaccines grow, and as we work through the populations, the state is setting the guidelines associated with what eligible individuals and populations will be next in the tiers. We are waiting for guidance there and have not received recent guidance to know which is the next tier besides those with significant health conditions. So I'll leave it there just as a quick update, and Mike, you can direct it as appropriate.
Thank you so much, Barry. I'll pause in case there's any questions. All right.
Yes, there are questions. Sorry, I was waiting for Madam Chair to ask.
Yeah, I know both Supervisor Ramirez and Supervisor Long have questions. Go ahead, you can go first, Supervisor Long, and then we'll follow up with Supervisor Ramirez.
Thank you very much. First of all, I would like to just I know that Governor Newsom was here last week in regards to getting our teachers, our educators vaccinated, really just saying what a great job the work of our vaccination team. So Barry Zimmerman, thank you very much for spearheading that, along with Mike Powers and all the others, and Dr. Cesar Morales, to ensure that Ventura County Office of Education, all those teachers can get vaccinated by the end of March. That was a big step, which I really do appreciate. I would like to advocate very strongly that we open up the 16 to 64 age with the severe conditions as soon as tomorrow. From what I hear, you state that the notes have to come from the doctor. And so that is going to take some time, I believe. And so opening it up sooner is better for all the other agencies, along with the federal and state programs. I think that we should be considering opening it up sooner than March 15th, and I would advocate for as soon as tomorrow. The other question I have, or comment I have, is I understand there's a farm worker program email so that our farm workers or our farms can contact to get a mobile site out. Could you reiterate that email, and if there's a phone number that they can contact?
I don't have that. I'll get the phone number to you. I know they've been working through the Farm Worker Resource Program, is a major hub in which they coordinate those efforts there. And Mike, if you have the number.
Yeah, Chair Parks will be, Chair Parks, Supervisor Long, we will be getting to that in our equity presentation.
Okay.
But now I just let you know that there's a dedicated health equity vaccine appointment line in the evening from 5 to 7. It's 805-371-8321. 371-8321. And Rosie will be giving a presentation on our equity efforts in just a moment.
Thank you. And the reason also is I've had some businesses contact me where they've had a couple COVID cases come to their business. And so they are wondering if the company could have a mobile site that's not a farm workers, but that a manufacturing site where a mobile unit can come and vaccinate one and done type of scenarios, and wanted to know if we are building that capability or if we reserve certain blocks at a vaccination site. I wanted to get an understanding of how we would work with businesses that are essential workers to get them vaccinated.
We, right now, those that are qualified essential workers, the appointment availability is not by company per se. It is open to the individuals to schedule as appropriate there. We are not anticipating to build a mobile team for individual companies, other than that we are targeting the industry as a whole in the agricultural environment, and we are working through that due to access issues and those type things there. We can always discuss offline larger employers and those type things to see if we can accommodate, but at this point we don't have any special program built around that type of scenario.
Okay, thanks. Then maybe we can follow up later. Appreciate it. Thank you, Madam Chair.
Thank you, and certainly also doing a emphasis on teachers, so that industry also, as well as farm workers, in terms of getting our schools open. Supervisor Ramirez, and also Supervisor Long, yes, thank you for your comments, and I think that's something that our board would like to see, is to expedite certainly the 16 to 64 also with comorbidities. Supervisor Ramirez.
Thank you. And I wanted to first just preface it by saying I want to really thank our IT people. I'm so grateful we have this technology so that we can keep people more safe. And so it just takes a little patience to get it going. I saw Mr. Lynn back there working with Mr. Powers to get things straightened out. So do appreciate our IT team. I think it's really important to not let our guard down now, because the national conversation is we are getting more vaccine, different kind, the one shot from Johnson & Johnson, but still we see what's going on in other countries like Brazil and even Italy, where there's there's a surge, and it's anticipated these variants are going to be more contagious. One thing I, of course, concerned about is farm workers, because we're going to have an influx of farm workers who are coming to Ventura County for harvest, different harvests. And we've been doing a really good start here, but I want to see if we can focus on the folks coming in. And they're a little bit harder to track because they're migrants. That's what our agriculture industry requires, that people travel, and it's a hardship on them and their families, but it's a benefit to the rest of us and to our agricultural industry. And there's so many people who need this vaccine. I totally agree about the comorbidities, people who are very ill, who may be even younger than 16, and there's just a lot of anxiety about them. One thing I would like to ask is about the homebound people, either people who are disabled in some way, or seniors who can't get out, that we have some, maybe that's happening, I just didn't hear about it. Maybe you could have a little bit of a discussion about that, Mr. Zimmerman. Thank you very much.
Yeah, so multiple things there. Just real quick on the homebound individuals, that is part of the goals and the mission of the 15 mobile teams. They're both working in a combination of the ag industry as well as through the homebound disabled population as well as seniors. That is through public health. We do reach out to individuals that have contact with these individuals. We have worked through our IHSS caseload, as well as AAA has been a partner in that and scheduling those out. We also have the ability that individuals are contacting public health and setting up appointments that we can go visit individuals that are homebound. So we are catering to that population as a need. The 16 to 64 comorbidity population will start on Monday. That doesn't preclude them from now getting the required paperwork in order so they can schedule that appointment there. We are aware of the influx of migrant farm workers that do come into our area. We do have contacts through the Farm Worker Resource Program, as well as public health is working with the ag industry, where we can coordinate larger events and have employer-sponsored activities where we can capture more and more of the individuals that may otherwise not have access. So we are cognizant of that, and we'll be working on methods to outreach, as well as to have the best access possible so they can get the vaccine.
Does that answer your question, Supervisor Reyes? Thank you. And with that, Supervisor Levere, you had one too?
Yeah, just one follow-up. Thank you, Madam Chair. And Barry, thanks for this presentation. I always look forward to getting the vaccination updates, and wanted to point out for the public how complimentary the governor was of the system you would put in place, and how effective it's been in terms of, if we get a vaccine here, we administer it. And so I really appreciate everything you're doing. I do think it would be good just for the public to hear again. I know we've given out, close to 165,000 first doses. And just for the public to hear what the procedure is for getting the second dose for those individuals, how that system works, and how they're going to find out when they're eligible, notification, timing, how that works.
Yeah, thank you. So individuals that have received their first vaccine is in our system, and there's a contact information there. About a week to 10 days prior to their eligibility to receive the second vaccine, they will receive a notification, and it will direct them to our website to schedule the second appointment. They can also, if they're within the window of it, 21 days and 20 days after, they can just go to our website and click the second appointment button, and then it will screen them to make sure that they're eligible on their timing, and then they'll be able to schedule an appointment on their convenience. We recognize that, the 21st day or 28th day is important, but it's not vital that you get the second dose. There is a window of opportunity to get the second dose. Within 2 to 3 weeks after you're eligible, you can still safely receive the vaccine and it will be effective. So that will work with people's schedules and making appointments and getting the second vaccine. But most should get a notification that they're eligible for it. If for some reason you have not and the time approaches within the week, you can go to our website and do that. As we move forward into the My Turn system, at that point in time when you register for your first dose appointment, you will also be able to schedule your second dose appointment at that time. So that is one of the benefits that we will have from converting over to the My Turn system there. Hopefully that explained the process.
It really does. Thank you, Barry.
Not seeing other questions, turn it back over. Barry, you still had more to report or back to?
I think it's going to Rigo.
Okay.
If I may, just Chair Parks, board members, we will go to Rigo next, so maybe we can have the next slide. But just two things. One, thank you, Supervisor Ramirez, for acknowledging the IT effort. I understand from the team that there was a Zoom bug and they worked around it. And now we should be streaming pretty clearly, I understand, on both our county site and the Facebook site. And then also on the Supervisor Ramirez, your questions on farm workers, we'll have some additional information when Rosa comes to present the equity effort. So, all right, and now I'll turn it over to Rigo.
Thank you, Mr. Powers. Chair Parks, members of the board, good morning. Rigo Vargas, Public Health Director, with a brief report as an update with mainly focusing on our trends, our numbers, the tiers, and then a few words around schools and sports. So the slide before you, we're all familiar with this slide that captures our current metrics in alignment with the state. They were still being looked at in order for there to be movement within the tiers based on the case rate and then positivity rates as well. So first, with regard to case rate, the 9.1 is an improvement from last week at 10.6. We'll pause here and point out that this, while an improvement, it is a very modest improvement, I would say. So, our decrease is definitely as expected, not as sharp every week, but we're seeing quite a modest improvement now versus the larger improvement. So while we want and need this case rate to continue to improve so that we can get additional sectors open, it is, I think, a good reminder, as Supervisor Ramirez pointed out, that let's not let our guard down and let's all continue to work hard with masking, social distancing still, and good hand hygiene in order to bring these numbers further down. So again, 10.6 last week, now at 9.1. And that's the adjusted case rate. Part of the reason is that we're not getting as much of a favorable adjustment case factor into this based on our testing volume. Our testing volume is still great. Our capacity is certainly great in Ventura County, but not as many people are getting tested statewide and locally as well. And so that has allowed our county to receive a less favorable than usual adjustment factor. It still helps us out, but the improvement is, or the adjustment factor is a lot more modest, I would say, smaller. So moving over to the positivity rate, you see there that there is improvement with that positivity rate. We went from 4.3 last week to 3.5, as you see there now. So this is really great news in terms of the overall positivity rate is dropping in Ventura County. And in fact, with this metric, we would already be in the orange tier. So really good work there. The other one, testing positivity rate in our low-income, high-density health equity areas. That one, while also improving overall, and at already places us in the red tier, given that it's under 8. Last week, we were actually at 6.6. So, a modest increase in the direction we don't want to see it. We need to bring all our numbers down And so 6.6 last week, 6.8 this week. I think it's just, again, that number is a reminder, along with the modest improvements on the others, that, again, we still really need to work together as a community, individuals, business owners, everyone still, let's not let our guard down so that we can make further improvements. So next slide, please. All right, so
I'm sorry to interrupt. My apologies, if I may, Chair Parks. If we could go back to the previous slide real quick. I just want to say there's two ways of getting to red, right, Rigo? So there's one way, the tiers as they are, but the state has also told us that they're going to raise the benchmark for the case rate from 7 to 10 once they hit 2 million vaccines in the equity areas statewide. And a week or two ago, when they announced that they were at 1.6 million, yesterday, I believe, Rigo, you shared with me that they're at 1.87 million. So as soon as they hit 2 million, that the case rate thresholds will increase from 7 to 10. And as you can see, when right now we would meet that. So we're going to be looking at both of these parallel paths as we go forward.
Thank you, Mr. Powers, very much for reminding me to cover that. I thought I had a slide on that, but actually this is the right time to have done that. So yes, we, along with other counties that are under the 10 case rate, as soon as we hit the statewide mark of the 2 million that you mentioned, Mr. Powers, we are closer to that. And so there's some thought or expectation that by the end of the week, as a state, we will have administered the 2 million goal of vaccines in low-income, high-density health equity areas, and that then those counties that continue to stay under 10 could open. There is some discussion. We have multiple emails, multiple of us in the team here at Public Health, emails to the state to get a confirmation and clarification as to the effective date of when we can move into the red tier based on this alternative method. There is some indication that it would be on next Wednesday if we meet as a state again the 2 million goal, that then counties that have met the red this week or been under 10, which we are, and a few others, that then next Tuesday, if that stays, then on Wednesday we would be officially in the red tier. There's actually some indication, some confusion that it may be as soon as 48 hours after this, as a state, we reach the 2 million mark, that then counties could move into the red tier. So I know this is very important for our community and our schools, and so I'm trying to get clarification on the timing of it. But suffice it to say that yes, we have most likely we're going to reach the red tier with this alternative method that the state now allows.
Madam Chair, can I ask one question on that?
Absolutely. Go ahead.
Thank you. And thank you, Rigo. I was going to mention that. I was reading the LA Times this morning. They were one of the journals that mentioned this 48-hour potential, where they reported later this week the state should reach that 2 million threshold, and within 48 hours they were saying that LA County would become eligible to move into the red tier. And so I just appreciate you kind of following up and getting us an answer, because there wasn't a lot of clarity in the article. So I appreciate you following up and hopefully getting a concrete response to that.
Thank you, Supervisor. We'll, sure will.
Madam Chair, I had another question on that.
Go ahead.
Thank you. Appreciate all of the emails and the working with the kitchen cabinet, Mr. Powers and Rigo with the California Health Department. A question of mine, you said to open up to go to 10, and right now we're at 9.1, is a 2 million vaccinations. On the CSAC committee meetings that we've been having, we've been really urging to open up quickly. But where are we in regards to how many vaccines have been out now? You said we have to hit 2 million. I'm on their dashboard and I don't see the total vaccines that California has put out. Do you know where we are?
Yes, Supervisor Long. As of last night, it was 1.875, so almost 1.9 million. Last week it was at 1.6, and I'll share the link soon here as to where exactly it's found. It gets a little maneuvering into the different graphs and sites that the state has, but I did find it last night where that's the way to track the number. And again, as a state, we're very close to the 2 million. It did improve from 1.6 to almost 1.9 since last week.
Okay, and I do want to let the other supervisors know as well, there's quite a few counties that are now moving into red and also into yellow and orange. I'm really disappointed that we weren't able to move into red today, but hopefully if we can get to that 2 million within the week, this will be good for our schools. I'll hold my other questions to later. Thank you.
Thank you. All right, next slide, please. All right, so in terms of our numbers today, I have some of those numbers. So this is as of yesterday, placeholder in case I didn't have today's preliminary numbers ready. So new cases today is 135. So good to see, on the lower side of numbers. Yesterday's 221 was really, really good, given that it's over 3 days. So our numbers are coming down, but again, they seem to be plateauing a little bit. New tests, we're going to be reporting 2,366. So that continues to go well. The team is reviewing 5 death records to make sure all the information is complete and accurate and clear as to COVID being an underlying or a contributing factor. So unfortunately, we will be reporting additional deaths today, bringing us ever so closer to 900,000 lives lost in Ventura County residents due to COVID. Our hospital numbers also are today are going to be very, very good. Today is 71 in the hospital that are COVID positive, dropped from 82 yesterday. So it's really good to see that continuing trend in our hospital numbers. And then yesterday was the 24 in the ICU. Today it's 20. So good to see that occurring. Next slide, please. So these slides, I think you're all familiar with them. I just highlight a few things where we are now. So again, this slide on the right-hand side is the testing volume, and you see there that statewide, locally as well, our testing volume has decreased. It corresponds to when there's a surge, people want to get tested, and so now that we've flattened or continue to flatten our curve, it's it's down, but it's still very good access in Ventura County, and I urge everyone from those that are looking to get into sports, teachers and staff returning to schools, everyone and anyone that wants to get tested, to please do go ahead and avail yourselves of that resource that we have at Ventura County. The other 2 graphs or lines is the case rate, and we look at that on the bar on the left. The purple one indicates our unadjusted case rate. You see a nice drop, and also for an adjusted case rate. But if we were able to zero in on those 2 lines, the purple and the blue on the right-hand side, as of latest, you kind of start to see that there is a flattening of those curves. It's no longer a downward trend of significance. So again, that's why our numbers, while as in the last couple of weeks we dropped both unadjusted and adjusted case rates, almost in a double-digit fashion. Now it's very modest decreases, and so again, we really need everyone in Ventura County to continue to work hard to bring these numbers further down, so that additional business sectors and additional schools can reopen. Next slide, please. So these are our hospitalizations. This graph shows you the dramatic, impact that our hospitals had to deal with in terms of hospitalizations, and just the nice decrease. Again, there's still 71 families that have a loved one in the hospital. Those can be for serious conditions, and certainly those 20 that are in the ICU are in serious conditions. So it's still a serious situation, and we need everyone's continued efforts and support to bring these numbers further down. Next, please. And so this is numbers of deaths, and you see also the continuing trend downward. And the last couple of days, it shows perhaps oversimplified, reflection that a drop there too, but death records at times get up to 10 days to be filed and for us to review them thoroughly. So we could have, additional deaths corresponding to the last 2 weeks. But overall, you see the pattern that that deaths are also dropping in our county that count. Next, please. Okay, so we're going to go to the screen so I can see this better. Oh, all right. So now we're going to switch a little bit to the schools reopening and then sports. So just a reminder that when on February 22nd, K through 6 schools were able to open once we dropped into the case rate below, I believe that was a 14. And then now schools, secondary schools and middle schools need to wait. So K7 through 12 need to wait till we hit the red tier, which again, it could be very soon if we reach that 2 million vaccination goal. And so that's the status of K7 through 12 schools. As soon as we reach the red tier, they can also open as well. So, we encourage schools to submit their safety plans. Several of them have submitted their safety plans. And as soon as we hit the mark, they'll be ready to announce a opening date for their families, their students. And again, we just want to encourage, everyone to examine the options and opportunities to return to in-person instruction. If there is a strong adherence to the safety protocols and plans that are required, the risk is very much reduced for, school-based transmission of the virus. We've seen in many other schools, including high schools, that the numbers do not spike with school reopenings. And so we support and encourage schools to open up in a safe manner, and that is by submitting their safety plans if they haven't already. Next, please. This is just a summary of the schools that are open, those that have submitted safety plans. And so we're happy to see that some of the Santa Paula, Oxnard area schools, certainly Winnie and Oak Park, submitted their plans early on. And now we have several others, and a few others are in the works. And so again, we are really looking forward to having additional schools open and open in a safe manner, especially those K7 through 12 that will be available or able to open once we reach as a state the 2 million mark. Okay, next, please. This slide we showed last time is just a reminder or a highlight of which outdoor sports are allowed now that we are under a case rate of 14. And so these are the outdoor sports. We urge you to look at the actual guidance. There's some specific requirements, whether testing or otherwise, for these outdoor sports. And so nothing's changed for that. But on the next slide, there is an update on sports related to indoor sports. So I think most everyone in Ventura County now knows that indoor sports are allowed, so both competition and contact practice, but there needs to be strict adherence to higher education guidance for sports. And so we really encourage everyone to look up that specific guidance that asks for specific testing and type of testing for the players and for coaches and for everyone involved with the sports competition and operation. So as an example, the higher risk contact sports like basketball and football would have additional testing requirements. And I believe there's one more slide that may outline that a little bit more. Next, please. Okay, that was it. Go back, please. Thank you. Okay. So that concludes my presentation. See if there's any questions. Otherwise, we can proceed with the presentation.
Thank you for the presentation, Mr. Vargas. And it is so delightful to see the schools opening. And I know out in my district to see the Canea Valley Unified School District open to all grades now, and the high schoolers, and just realizing how important it is to the students, the quality of life their ability to have socialization, and then it definitely enhances learning. So we're really happy to see that. And I know that's starting to happen throughout the whole county. I know Moore Park also has all the grades open, and so that's great to see. I know Supervisor Long, you had a question too.
Yes, thank you very much for the opportunity, Madam Chair. I have been asked by constituents in regards to our reporting on the COVID death rates and wondering what our death rates without COVID 2019, 2020, what they are, and just wanted to make sure that we're able to provide that information for people. I know there are questions in regards to the amount of COVID in our population and so forth. We had a presentation on flus and how that's really died out with the COVID vaccines. And so I wanted to make sure that I am asking for our constituents that question as well. And maybe you can get that for me later, or.
Yeah, we'll get you that soon. We have that available information, and we'll make it available to you, and perhaps also share with the board at a future board meeting. Yes.
Thank you. The second question is clarification. The understanding of many of my constituents is that the waivers for opening up schools was K-6 only. And we are seeing many of the school districts are now open K-12. And how is it that some districts can open to 12 and others like Oxnard Union High School, 9 through 12 can't open? How do we pick and choose? I know the public health department said equality and making sure we're getting the education, but now the high schools is not able to open until we get into the red, which might be another week of delay of education out that way. So I wanted to ask for those constituents in my district.
Sure. Thank you, Supervisor Long, for that question. It seems a while back, but we were in the red tier before the last surge. I believe it was around October. And so around that time, then schools were all K through 12 had the ability to open. And so several did and that way. And then others had some classes open that also then allowed them to continue to open even after the regional stay-at-home order was lifted. So it all ties back to when we were in the red tier and what grades and schools opened back at that point to then what was allowed currently. So it's that if you did not open a grade or a school while we were in the red back then, we now have to wait till we're back in the red.
So Oxnard Union High School District did not submit a safety plan to reopen back in October, and therefore they have to wait now, even though their plan is set in place.
That's right.
Okay. I greatly appreciate that. When we hear all the different teachers getting vaccinated and all these schools opening, it's very hard to see certain schools not be open. And I know their own school boards have that choice in what to do and their superintendent. And I wanted to make sure that the county specifically was not slowing them down to reopen. So appreciate that information. Thank you.
Very welcome.
And I know the California Department of Public Health were the ones that gave the final okay to allow for the school district out here too. So it really does fall on the state. Back to you, Mr. Powers.
Hey, thanks, Chair Parks. Yes, and next we'll hear from Rosa Gonzalez, our community liaison, on our health equity update.
Good morning, Board of Supervisors, Chair Parks, and CEO Powers. Rosa Gonzalez, community liaison.
Could you speak just a little bit louder, Ms.?
Sure. Rosa Gonzalez with the County Executive Office, and this morning I'm very happy to share some of our health equity efforts that we have had in place. We would like to start with some of the information that Mr. Zimmerman already shared, which has to do with our farm worker mobile vaccine program, which started as a pilot on February 11th and pretty much has had a scheduled event or events daily since it started last month. We have about 4,499 vaccines within our farm worker and agriculture industry that have been provided. This number, it does not include farm workers that would have visited our local clinics or also maybe some of our vaccine sites. So we feel that this is a great number, seeing just how effective the mobile units going out to the various 20 locations, as you can see that they have gone to. Again, what's so wonderful about the program, not only is it that we're making the vaccine accessible to our farm workers in a very comfortable area and location where they feel comfortable at being work and, you know, amongst friends and coworkers, but also the additional resource and support that the county is providing with having our farm worker resource program also help with these efforts and attend these clinics. They provide very important county resource and service information. Also, they distribute COVID prevention information and also vaccine education information of what to expect and the importance of continuing to also still social distance even while they're in between maybe their first and second shot, but also to the continuing of practicing safe and social distancing afterwards. They also are providing them with masks and hand sanitizer, but also connect with them so that they know that the county does have this farm worker resource program available. Supervisor Ramirez, as you commented earlier, we do see a large number of farm workers that have migrated to the county, especially we're in the peak of strawberry season. And some other counties might not necessarily have the available resources we do, so we feel it's a great time to really share with them not only, you know, this COVID and vaccine information, but also the services and the assistance that we are able to help provide and support them when they are in Ventura County. And we also, county staff, including Farm Worker Resource Program, myself, and other members from our Ag Commissioner and healthcare agency, we are in various meetings, which also include other county representatives that have a large ag industry. And it's wonderful for us to partner and share a lot of this information. We feel that having that line of communication also just helps support our farm workers as they move around the counties with the various seasons. The great thing about the mobile clinic too, at the various 20 locations, are the public health team has included some small and larger farms into these sites. So even though we've had 20 locations, we've had employees from 46 different employers attend, and that's something that we're also incorporating as we're still planning and scheduling these future vaccine locations. Additionally, Ambulatory Care hosted the John Flynn Community Center vaccination clinic in El Rio, which conducted 452 vaccines about 2 weeks ago. And they also have an upcoming event this Saturday, hoping to provide at least 450 additional vaccines. And again, our public health team is working with them to connect them to local farms to help ensure that we could get some more farms and their employees there to get vaccinated. This week, the mobile team will also return to the first 2 ranches that we vaccinated our farm workers back on February 11th, which is Kimball Ranch and Rancho Simpatica in Fillmore. This is pretty exciting that these farm workers will now receive their second dose and, you know, have finished that and will be fully vaccinated. So we're really excited about that we're at this point. And then also our in-home vaccination for seniors. Our county mobile team, in addition to the farm worker mobile program, they're also working with, as Mr. Zimmerman shared, with our area agency on aging and our human services staff for in-home supported services on identifying seniors and reaching out and contacting those that are homebound. To date, they have vaccinated 342 seniors and pretty much daily are reaching out and trying to connect with these seniors and provide them the vaccine at home. For those at home that might have questions, if they have a senior that they feel that might that is also homebound, they could also call our vaccine line, which is 477-7161. That number again is 477-7161, and speak with a representative and see if that is something that they're eligible for having the mobile team go out to their home also. On our outreach and education, we know how important this is, especially within some of the areas where we see some of the higher COVID numbers. So what we have done is the county has partnered with community members, promotoras, to help get COVID and also vaccine information out in the community. These are individuals work within these communities and specifically some of these neighborhoods and are recognized not only their name, but them as individuals, as trusted messengers. The county has partnered with Líderes Campesinas, Poder Popular, Southwinds Council, One Step a la Vez, and also a little over a week ago, MyCOP has also joined the efforts. And it's wonderful. They are going out to various food distributions, but also to multi-unit housing, laundromats, and retail stores where we know community and individuals would be at, where they could engage and provide them and connect with them and provide them this information. To date, they've connected with over 36,000 individuals, and we're also just seeing how beneficial that partnership is, because we are also in various meetings and just in communication with them are hearing, well, what are the community's needs? What are we seeing? What do we need to do as we continue with our COVID and vaccine efforts? And one thing we kept listening is there's a lot of mystery around the registration process. And yesterday, the county team, we met and discussed on hosting a My Turn vaccine registration workshop where we will invite not only these promotoras, but other community members that within the last few months and weeks we've worked with, but also individuals that have reached out and asked, how can I help? How can I help with assisting these individuals with getting the vaccine? And one of the biggest things that we know that is a hurdle for this population is the registration process, which is why going back to our mobile vaccine program has been also so successful, is the registration is done in advance working with the employer for them. So we want to also offer this now with working within communities and neighborhoods, and also helping our community partners with assisting those that contact them with assistance on how they could access the vaccine. The county does again also have a phone number that they could call, which is the 477-7161 number, but also the evening line that Mr. Powers, CEO Powers, shared, which is 371-8321, and that's from the hours from 5 to 7 p.m. But we feel that also now working with our community partners and having them see how they could also help register individuals, and also for the county to help answer some of the frequently asked questions or concerns that they might have, just to make the whole process a lot easier for everyone. So that will be coming up soon, and we'll share that information with your offices also and report back on just how that workshop went. Additionally, and finally, wanted to share that Pinza Panya, our Diversity, Equity, and Inclusion Officer, started about a little over 2.5 months ago, I believe. Came and we all worked together along with members of our Diversity, Equity, and Inclusion Committee. We also created this COVID-19 Equity Rapid Response Tool Guidebook. And this is just a great guidebook that just helps county staff as we are having discussions and making decisions, but also, how our services are for our populations, to ensure that we really are looking at it from an equitable lens. And it just helps have some very, simple questions asking, to ensure, if they're thinking about language access, is there internet access, maybe some of the cultural components to make the services a little bit more receptive. And also another one is working with community. We have seen just how valuable our community partners are, and just encouraging working with community is just very beneficial for all of Ventura County residents. And also all of these great efforts have been happening, but these are all in addition with the great outreach that has been continued from various county departments and agencies, on social media with videos, flyer distribution, and just on all the various community meetings that various county employees have been on, pretty much every single day. We just want to make sure that everyone knows that the county's here. We're working together with our community partners, and we're always looking at new ways to definitely assist our residents during this time. And I'm happy to answer any questions.
I love the photos too, and to see the great turnout that we were getting for the vaccines. And I know that there's some concern in the communities about sort of getting vaccinated. So it's good to see that certainly it's popular with the farm workers too. Let's see, we have questions from both Supervisor Ramirez and then Supervisor Long. Go ahead, Supervisor Ramirez.
Thank you very much. I really appreciate the efforts of Ms. Gonzalez and the team to get out there. And this weekend, I did have a chance to stop in very quickly to the United Farm Workers Foundation vaccine setup with public health in Oxnard. And they were going to give out 500 doses, 500 shots. That's great. At the same time, I was hearing from some of the organizers there that we have probably 40,000 farm workers in our community working in our industry, and of course their families. And I'm really concerned about getting ahead of any potential surge that might happen. So I'm wondering, I didn't see United Farm Workers as one foundation as one of the organizations that public health had worked with, and I hope that there's more of that. They do definitely have, along with these other groups, a connection with our farm worker community, just also trusted messengers, and would really like to see that continue.
Yeah, yes, absolutely. Rigo Vargas and myself have also spoken with the UFW Foundation and also the UFW offices here in Oxnard. And last week they did host the public health with the UFW Foundation, was out in Moore Park at one of the farms with providing vaccines there, in addition to this Sunday's event, which actually is a little picture at the very bottom there is from Sunday's event with UFW. And we are continuing our conversations. We've had some great discussions, and we'll continue these partnerships because, again, we do recognize that UFW is a great partner and trusted with our farm worker community. And yes, we recognize there's over 41,000 farm workers, and during this peak season, say right now with strawberries, we could have an additional 6,000 to 8,000 farm workers coming into the county. So again, and those are farm workers that might not know, so much about the county or just how much we're doing, but we know that they will know UFW, they will know MyCop, they will know some Líderes Campesinas, some of these other community partners, which is why it's been very beneficial for us to have these partnerships and continue to grow and expand, which is, we were really excited with MyCop, partnering officially with the county as of last week. And that's an area that we'll continue to look at in growing. And actually, there is one other thing from earlier I forgot to share. Supervisor Long, you asked about the contact information for the Farm Worker Mobile Clinic, and there is an email that Public Health has set up for farms to contact and inquire and, to put themselves essentially on a list so that the mobile team could go out there or include them in any of the close by clinics. And that email is farmworkermobileclinic@ventura.org. Again, that email is farmworkermobileclinic@ventura.org, or the phone number to call would be the public health offices at 981-5101, but we would recommend that an email be sent, just because our public health team is not only in the office, but they're also working hard on site at these mobile clinics. Like I mentioned, they're having pretty much daily.
Just to follow up on that, it seems, I'm no expert obviously, but it seems that if the Johnson & Johnson vaccine could be utilized for farm workers where they don't have to come back and get a second dose. We don't have it yet, I understand, but it's coming. That just seems more efficient way to do it. So just a thought.
Yes, we actually, the healthcare agency team, we've had few discussions about the consideration for that vaccine and this population, considering that especially with some of the workers that come in and out of the county, and that's something that we'll definitely be discussing. But also, we want to make sure that we message and let our farm workers know that if that was the vaccine, that would be something that would be provided not only within these mobile clinics, but maybe also at site locations. I think there's a lot of individuals that would like to know, well, what vaccine are we receiving, or are we signing up for, and that type of information. So we have had these discussions on how to make sure that we provide this vaccine for those, and also to make sure that they understand which vaccine they are also getting.
It seems like a really good suggestion, because you do have that migratory aspect, and they'll be here for most of the time, but spend some time outside the county and not having to worry so much about how to connect with that second shot. It sounds like a great idea. Supervisor Long, you had a question too?
Yes, it was in regards to the Johnson & Johnson shot and advocating for our farm workers to get that one shot. My understanding is that what Dr. Levin was stating at the press conference on Friday was that it is very effective, and that it is something that would be very beneficial for those that we can only get an appointment once. I think that they were stating also the Rose Clinic, that was also going to be a location for the Johnson & Johnson, but I would advocate for our farm workers to have that as well. And want to say thank you so much. I was chairing the EDC meeting, Economic Development Collaboration meeting, and Harold Edwards from Limonera was just saying accolades to the public health organization of getting over 500 vaccines over the weekend to that location. I know that Mission Produce was getting it, Kimball Farms, which you mentioned in it, and every single farmer that I have been talking to and farm worker has stated just how wonderful it was, how easy it was, and that they didn't really lose time working, which was really the goal, to make sure that they can keep working to feed their families and everything. So I wanted to say thank you. Bottom of my heart, I was told, Kelly Long, I don't know what fairy dust you twinkled, but we were able to get those vaccines out. And I do not want to take all that credit, because it was the team that did it and that is really on the phone and making sure this is all set up. You're doing this 24 hours a day, 7 days a week, and I really appreciate it. So I wanted to publicly state that, and thank you very much.
Yes, thank you. I mean, it is definitely a team. There's a public health, the SNAP nurses, farm worker resource program, and a variety of others that come together to make these events happen and really try to do this, especially with having space, to also allow for social distancing while waiting, and, especially not only to get the shot, but also afterwards, the 15 minutes, but also the education component and the information. We definitely want our farm workers to know also, again, what the vaccine is, which vaccine, with the option, the different types. And so we really appreciate it. And we feel pretty great to have that opportunity here at the county to have this mobile program available to us. And the team has been just amazing.
Well, and it just goes along with our healthcare to the most vulnerable populations, and the great work that we're doing with the Santa Paula Hospital and our clinics, along with VCMC. It is just one more way we can make sure that our healthcare to our community is really there. And so I appreciate it. Thank you.
And I also want to extend my thanks to our CEO, Mr. Powers, and understanding the really important aspect of making sure we don't have these disparities in getting vaccinated. And certainly we do have hot spots in our county, and being able to go to those areas and make sure that we increase the vaccines in those areas is not only, as I said in the press conference too, the moral thing to do, but also it does affect our countywide numbers. And people in the East County have to use the same number as people in the West County when it comes to the distribution and the ability to get more vaccines, and then also really important, being able to open up. So by going to those areas hardest hit, we all benefit that way too. So good outreach. I'm glad to see also that the Johnson & Johnson is something that is popular, not only with the concept of the farm workers, but I'm hearing it with teachers and others that's their preferred go-to. So it's good to know that, there isn't a concern about it, but actually just the opposite, that people want to get that one more than the other two. So that's good to know. And now back to you, Mr. Powers.
Okay, thank you so much, Chair Parks and board members. And yeah, as I said, it is a great team effort. Our vaccine task force, our steering committee, which includes public health, HCA, OES, sheriff, RMA, council, our office. It's a good group, making sure we get all those perspectives, including our new diversity officer, Ken Zapani, who's on there. So yes, thank you. I do want to respond to Supervisor Ramirez. Good question about the number of vaccines for the mobile program. Roughly 4,500. That is just for the mobile program. We have asked the very question that you have asked, Supervisor, as to what about the other sites, the other regular sites where farm workers and ag professionals are getting vaccinated. The system is down apparently right now, so we can't get that, but we will get that number because we want to watch that as well. Also, I'm about to turn it over to Dr. Levin, but just wanted to get back to your boards. Chair Parks and Supervisor Long had asked about moving to the 16 to 64 with comorbidities earlier than Monday, and certainly understand that sentiment. It's something that we've discussed a lot in our team, so where we're at. They look at it every day in terms of the current volume and demand that we have. Right now, in checking with the team, I think that the situation is such that there's only a few more appointments available this week for the current tier that's open. That's ag community educators and 65 and over. And so we get the allocations on a weekly basis, so there wouldn't be that many appointments open up. And the population roughly in this next segment that's going to open on the 15th, March 15th on Monday, is around 100,000. So it's a big group of people we'd be adding in. And so we want to make sure when we open the appointments on Monday, there'll be appointments for people to sign up. And one thing that we would encourage people to do, though, now that we have this teed up, is to get ready. And being ready means getting a note from your doctor. Any kind of note from your doctor, if it's on a prescription pad or otherwise. And as Mr. Zimmerman mentioned, we also sent form letters to make it easy for the doctors to verify the conditions so that folks would be eligible for the vaccine. So that's our current thought. We're again happy to continue to discuss it with your board as we do.
Mr. Powers, Madam Chair, thank you for that input. I really do appreciate it. I know it's only a few days, but every day to me really matters. I know it matters to you, Mr. Powers. We have this conversation on a daily basis as to where our numbers are and how we can get to red. So I do appreciate that comment, because we have had our community push back to say, you opened up and yet I can't get appointments, and how frustrating that can be. But if there is any way that we can do it a day earlier or something, I just would appreciate being fluid on that. And you're right, our community needs to start getting their doctor notes, because this is going to really help them and appreciate it. I even had people ask me if they could move to our county just for this next step. So I appreciate that. The other question I did have is, someone asked me in regards to age 65, if our clinics were available to take anyone that is going to be turning 65 this year versus just have their birthday. I just so that you're aware, I believe LA County, you're able to get 65 if you turn 65 throughout 2021 versus you have to wait for your birthday. And that might open it up for a few other people as well.
Yeah, well, I'll get back to you on that before the meeting ends.
Mike?
Thank you. Oh, there we go. See, I told you. Barry, go ahead.
Yeah, just a clarification. It is age 65 that you're currently at the time of registration. I just want to make a little bit of difference, because we've had multiple comments come in. Well, LA allows us to vaccinate X, Y, and Z. Los Angeles County has their own distinct guidelines and plans with the state, and they do not follow the state guidelines. And that was an agreement early on between the state and Los Angeles County. So that causes some confusion up here. We are following the state guidelines and have been instructed to do so in order to maintain our relationship and vaccines from them. I just wanted to highlight there is some nuances there. And we do get a lot of questions why they may be vaccinating a certain population and we are not, and so forth. So I just wanted to make you aware of that.
Thank you, Barry. I did want to speak to the issue too. I don't think we've touched on of vaccine tourism. And we try to make sure, we work very hard on multiple fronts to make sure that the vaccines we have in our county are for our people who live here or work here. And that is a constant effort in terms of messaging, the website, and at the vaccine sites. We let people know that if you can't show that, and there's multiple ways of showing it. It's not just driver's license; could be a utility bill, for example, library card. We try to be very flexible about that, but you have to show that evidence because we want to preserve the vaccines for our folks here. Okay, thank you very much. Maybe we can go to the next slide. And Dr. Levin.
Hi, good morning. Chair Parks, members of the board, Mr. Powers. The subject of Janssen vaccine came up, and it was pointed out that I talked about this at the end of last week. I think it's worth talking about it again. The vaccine arrived in our county yesterday. And so it's going to be put in use very soon. I want to start by saying that, and recognizing the fact that there have been those that have expressed some concern about the Janssen vaccine. The number that they point to is that it's 66% effective. But I just thought that looking at some more numbers and looking at it in a different way would put this in perspective. The number 66% is from really the worldwide study that Janssen did, and I need to correct myself because it's not Johnson & Johnson, and it's not Janssen. It's pronounced Janssen. So if you hear Janssen, that's a synonym of J&J, Johnson & Johnson. So I'll try to stick with Janssen. So the Janssen vaccine was studied in 8 different countries across the world, and that could cause some disadvantages and some with the data and advantages with learning about the Janssen vaccine. First, I would love to just have people imagine for just a moment, this is make-believe, that the first vaccine to arrive on the scene was the Janssen vaccine. Let's forget about the other 2 vaccines. And it was the first vaccine, the COVID vaccine. And in the United States, just one of those 8 countries, that number is not 66%, but it's 72%. And what that means is the 72% means that it's effective against all disease, which is to say any symptoms whatsoever. And I'm not sure that that's the only goal that we want to judge a vaccine by. We have to think about the disease and how serious the disease is. And that's, of course, why we're in this whole pandemic, because this disease is a killer and a disabler. We know that this vaccine from one of those 8 countries, South Africa, which was seeing the South African variant, and we're all interested in and concerned about the variants and how well the vaccines we have work against the variant. We know that this vaccine, looking at South Africa, was 95% effective against the South African variant. We have test tube data that shows that it was also effective against the United Kingdom, the UK, and the Brazil variants. Next slide, please. This Janssen vaccine was 14 days after receiving it, because you need to give the body some chance to react to the vaccine and build up an immune response, it was 92% effective in preventing hospitalization. And this is what we're looking for, not no symptoms, not mild symptoms. We want to prevent death and we want to prevent hospitalization. After 14 days, after 28 days from the date of vaccination, people were 100%, the vaccine was 100% effective in preventing hospitalization and 100% effective in preventing deaths. Next slide, please. Next slide. There we go. Thank you. No, I think we want to go back. There we go. Perfect. So, and there are other attributes to the Janssen vaccine. First of all, as pointed out a few moments ago, it's a single shot. It's not two shots. Secondly, it is easy and safe to transport. There are not going to be issues or concerns about the cold chain. So let me explain what a cold chain is. Any vaccine has to be maintained in between its manufacture and going into a person's arm in a range of temperatures. We don't want to see that range exceeded. We don't want to see that range fall below that range, all because it could alter how useful, how effective the vaccine is. This vaccine has very reasonable cold chain requirements, and it can be kept in a standard freezer. When I say standard, I mean the kind of freezer you've got in your refrigerator at home and that doctors have in their offices. It can be kept in a standard freezer for 2 years and at refrigerator temperatures for 3 months. It has mild side effects comparable to many of the other vaccines that we're used to taking over our entire lives. And the study that was done on this looked at a lot of people, 44,000 people across the world. Next slide, please. So again, let's say, I want to remind you that this was the first vaccine. We're making believe here. And now 2 new vaccines come along, these 2 mRNA vaccines, of course, the vaccines we've been using and that we have become very comfortable with. But these 2 vaccines that are coming along, now there's 2 shots with them. There are more limited cold storage requirements that these vaccines have. And while there are acceptable side effects, these are slightly greater side effects. We don't have any on-the-ground experience with these vaccines against any of these variants. None, but we do have test tube evidence that shows that they're effective to varying degrees against the variants. And it's based on a new technology, mRNA vaccines. So let's look at the, so do you think you might have some reluctance about these 2 new vaccines that came along? So some of it has to do with the order in which this was presented. Next slide, please. Now, as you know, and as I just pointed out, both of these mRNA vaccines are very solid and very good. And we have a tremendous amount of experience now in our nation, in our state, and in our county. And we know that they're incredibly protective, they're very safe, and they have tolerable and accepted side effects. And so if we lump them all together, all 3 vaccines have met the same FDA safety standards. They're very effective, they're very safe, and they all prevent the most serious consequence of disease. And any differences between them in terms of how effective they are, in terms of their numbers, they could be explained by the fact that they weren't studied on a head-to-head basis, but individual studies on their own. And we know those kinds of studies can vary, and they're hard to compare one to another. So which vaccine would I get? And which vaccine should you get? You should get, and I would get, whatever vaccine is available to me. We have 3 great vaccines in front of us right now. Next slide, please. So changing the subject, new CDC guidance came out yesterday for fully vaccinated people. And let me go into what that's about and the implications for us in our county. First of all, if you are fully vaccinated, you can visit with other fully vaccinated people indoors without wearing a mask and without concern about 6 foot of social distancing. These are new guidelines from the CDC. Now, before I go any further, I want to say these are from the CDC, and sometimes the state guidelines vary from CDC guidelines, but these are pretty compelling guidelines, and it's, I think, going to be difficult for the state not to adopt them as written. And we'll know that in the next day or two. So I think we can pretty much assume that we're going to see these same guidelines applied here in our county. If you have been fully vaccinated, you can visit with unvaccinated people from one other household indoors without wearing a mask and without 6 feet of social distancing if everyone in that household is at low risk for having serious complications from COVID. So if people don't have serious comorbidities, but they're unvaccinated, you can visit one household of people like that without any restrictions. And then thirdly, you should refrain from, you may refrain from being quarantined and from being tested if you do not have symptoms of COVID or any kind of symptoms of illness in the 2 weeks following exposure to a known COVID case. So let's look at this and what it means for our county. We have recent data from the state that shows us what our level of herd immunity is so far. We want to get to a level of herd immunity that's, it's arguable, between 70 and 85%. Once we have that, it's difficult for a COVID virus to spread in a population because it's often going to bump into someone who already has immunity. There's 2 ways of getting immunity. One is either from having had the disease, which we've seen a lot of recently, and which has affected the number of immune people in our county, and from the increasing numbers of vaccination. And we've seen increasing amounts of vaccination every week. The numbers from the state show that as of February 20th, that was 17 days ago, on the Central Coast, San Luis Obispo, Santa Barbara, and Ventura County, average across the coast, we had immunity achieved in our population of 32%. Remember, the goal's 70 to 85. We're at 32% on February 20th. And just something that could influence the Ventura part of that number of 32% is our next door neighbor is Los Angeles. And that number in Los Angeles 17 days ago was 45%. So I think that the 32% would have to be ratcheted up in reality if we did just a Ventura number to maybe 35, 36%. Also, 17 days have gone by with that many more cases of COVID and that many more vaccinations. I wouldn't be surprised if we were at 38% immunity in our county or halfway towards herd immunity. So I think the fact that you can get vaccinated is not a light at the end of the tunnel. I think it is a spotlight at the end of the tunnel. It's I think exciting for us, and it shows us the future that we are going to be able to return to normal within a few months if all goes well, if the vaccine supply continues, if the variants don't become a problem. So that's my presentation. Any questions?
Thank you, Dr. Levin. It is kind of a race to get the vaccines in the arms before the variants get more prevalent in our county for sure. And I appreciate the effort towards that and the great advice I think we can all accept, which is that you have an opportunity to get it. Doesn't matter which of the three get the vaccine, and that is going to help a lot. So I know we have a couple of questions. I'll go to Supervisor Ramirez.
Very quickly, thank you, Dr. Levin. This idea that we may have 32% immunity in the community, that my concern is that somebody might think, well, I can't get it now. I don't have to wear a mask. I don't have to be safe. I can kind of just comment on that, because I think it could be misinterpreted.
That's a really good point, Supervisor. I don't think we can afford to rest on our laurels. 32%, or even if it is up to 38%, is not herd immunity. And this virus still is in our community. There was a time when I estimated that maybe 1 out of 800 people in our county, this was early on in the pandemic, might have COVID, might be carrying COVID. We are at a point right now where 3 or 4 out of 100 of people in our county have COVID. That's what this test positivity rate of, I think, 3.4% tells us. 3 or 4 out of 100 people. And so it's still around. You can still run into somebody with COVID. And going back to Supervisor Chair Parks' comment, what's important about vaccination and the level of immunity and keeping the variants from becoming a problem? Well, if we get our level of immunity up there, the variants will be affected by that and cannot spread to other people. And we can limit the variants. And if the variants are limited, even if the vaccines are only partially effective against them, and we have evidence that they are probably more than partially effective, that will make the vaccination effort to have been worthwhile. So please, let's, when we can, when the opportunity affords itself to get vaccinated, let's do that. And going back to Supervisor Ramirez's comment, even if you've been vaccinated, except under those circumstances, which are on the screen now about CDC guidelines, please wear your masks in all the ways that you were doing so before, and honoring social distancing in all the ways that you were before, because it's an important part of keeping this at bay.
Did you say that you wouldn't be surprised if it was 38%, or was it 32? I thought I heard 38.
The numbers from February 20th were 32, but by the fact that we're close to LA, which was significantly higher, 44 or so percent, 45, and the passage of more immunity time, because 17 days have gone by, there's been a few more cases of COVID in our county, and there have been significant more vaccination, we're probably at around 38. That's just shooting from the hip.
You know, and it seems like there are more ways to get the vaccine than we may know of. You know, you hear about others who may have gotten it through the naval base because they're a veteran, or they got it from their doctor at a clinic, or pharmacists, you know, had extras, so they were giving them to, you know, others because they didn't want that extra, you know, to go to waste. So we may have underestimated in some cases the amount of people who have actually got vaccinated. And it's great to see, you know, certainly when we open up 25,000 on a Monday that they fill up, but then we're also finding sometimes there's actually some more capacity there. And I think that's what Supervisor Long was getting to too. And when we have that ability, we absolutely want to expedite and move to the next tier. Speaking of Supervisor Long, you have a question?
Yes, thank you. And I really appreciate it. I know that our CEO's office and everyone is working on getting as many vaccines out as possible. It still is a supply issue. It's not us getting the vaccines out. It is the amount of supplies that we get into our hands to provide to the community. So I wanted to make sure people understood that from my comments earlier. But I also wanted to make sure when you're saying that you may visit with others that are fully vaccinated indoors without masks, I have concerns on our businesses. We are holding them accountable to follow certain rules and regulations. I'm hoping we are going to get to red and we can actually work out indoors and go to a restaurant indoors. And I don't want to put our businesses at risk of being operating because of these new rules. So how do we work with that to make sure our businesses keep open if someone says, well, I'm vaccinated, I'm fine, I don't need a mask? What do we do? I want to keep our businesses open.
That's a great question. And I'll divide businesses into two. One, the average business, not the non-restaurant business. And in that case, you still need to wear a mask when you go inside. No one's changed that rule. And if your business owner expects you to wear a mask in order to come into the business, you've got to honor that. As far as restaurants go, it's open, wide open for restaurant employees right now to be vaccinated. And we're encouraging that. And I hope restaurant employees take advantage of that. And just because restaurant employees are vaccinated and a customer's employee that comes in is vaccinated doesn't mean that they can walk in without a mask. They still need to wear a mask until they start to put food in their mouths or food or drink in their mouths.
Thank you. I appreciate that. So just like no shoes, no shirt, no service, it's no mask, no service. And really do appreciate those getting vaccinated as quickly as we can. But I want to make sure that just like the rules of business, we still have to follow those as well. So thank you.
Thank you.
All right. With that, if I may, Chair Parks, we'll keep moving. And I did want to take a moment here, I'll transition, the word red was used. So we want to try to give you and the community information as soon as we get it. So we do have an update on this, which I thought was important to share. So I will turn it over to our Public Health Director, Rigo Vargas, to give you a further update. Thank you.
Thank you, Mr. Powers. Board members, the email we were expecting to get clarification and confirmation of the situation with regard to a case rate of 10 just came in. And so CDPH has confirmed that a county needs to be under 10 for 2 weeks. So if on Tuesday, this coming Tuesday, we stay under 10, then on Wednesday is when we would enter the red tier. Now, the only other caveat to this is that we still need to reach the 2 million. So I think all expectation and hope is that we will certainly reach the 2 million definitely by Monday, Tuesday, but maybe even on Friday. But that 2-day, 48-hour reference was for those counties that this week have been under 10 already. And for us, our 2 weeks under 10 will be next Tuesday. And so that's when it would go into effect until Wednesday for our situation. So I know it's a little bit, probably still a little bit confusing. So I could just pause here if there's, some questions on that.
You're looking then at Wednesday, March 17th, St. Patrick's Day. Might say that we'll have the next tier available, correct?
Yep.
And that would be the 16 to 65 with or to 64 with comorbidities.
No, apologize, Chair Parks. This isn't about the vaccine eligibility. It's about the red tier, the business.
Okay.
I switched to that. Yeah, sorry. A lot of data flying around. Yeah, this is about getting to the red tier. And we had mentioned the other approach to getting there was if the state hits 2 million vaccines in the equity areas statewide, they'll increase the case rate metric from 7 to 10. And right now, as I say, they're at 1.875 million. So it's very likely they're going to hit that 2 million mark pretty soon. So what Rigo was saying, if they do by Tuesday, and if we stay under 10 for the second week, effective Wednesday, we could move into the red. There's a couple of caveats. We have to stay under 10. State has to hit that 2 million milestone. But if those two things do happen, then we could be.
So the earliest would be on Wednesday, the 17th is what we're saying. Actually, exactly. Go to the red tier and open up more businesses. Yep. And does that also allow for indoor dining, or we're still going to have just outdoor dining in restaurants? Do we know that?
Yes. Go ahead, Rigo.
Yeah, no, so we would now go by the red tier business openings. And so indoor dining, I believe it's at 25% capacity would go into effect. And then there's other businesses that could also open up. I believe movie theaters also, and others with reduced capacity. And so this is a great time for all of us to look back at what businesses at what capacity can open in the red tier, because again, we on Wednesday of the 17th, we could be there, and those businesses should prepare to go into the red tier and open up indoor businesses included.
Great, that's right. The 15th is when we open up the next tier of vaccines, the 17th going to red. All right.
Yeah.
Supervisor Long, comment?
Yes, thank you so much for this excellent news. I just want to appreciate, I am ecstatic to hear that, to have our businesses start preparing, because they are going to have to hire people, get supplies, all that kind of stuff. It takes a couple days to get it going. So I appreciate this. And I saw the list of the schools. I hope those schools that have not put in their safety plans, put their safety plans in, so that those school districts can open up as well. This is great news. I really appreciate it. Thank you.
And then it all comes down to it's our public that's helping us to get our case rate down. So continue that good work, and we will be opening up our economy soon.
That's right. And we'll keep you posted regularly as we're watching these two metrics, our case rate and and the state vaccination in the equity areas.
Right.
Thank you. Okay, next we will go to our rental assistance program update, and Melissa Livingston, if we could have the next slide, please. Thank you.
So at this point, we're not able to hear Melissa, even though I see that her microphone is on.
Okay, what we can do is maybe let's do this. If we can move to business assistance and come back to rental assistance. If Paul Stamper is available, we can go to the next.
Paul is ready, and we can get the PowerPoint up for Paul.
Yeah, it's all one. Should we just go to the next slide? I think we'll.
All right, I think one more slide, please.
Two more slides. Yeah, there we go.
There we go.
Thank you.
Excellent. Good morning, Chair Parks, board members, CEO Powers. I'm Paul Stamper with the County Executive Office. Very pleased to give you an update today on some business assistance. Another way to give a shot in the arm, so to speak, to our businesses as we're hoping that we're on this path of reopening and giving aid to them to help that process. So as you're well aware, your board approved $20 million to support our small businesses and nonprofit organizations in Ventura County. And that will be in the form of $5,000 grants for up to 4,000 organizations. So we've been hard at work on that program with our focus on speed to get this money out in the hands of businesses as soon as possible. So I'm excited to give you an update on that today. And I also, at the end, will touch on some state and federal assistance as well. For this second county business assistance grant program, we're going to have a pre-registration window and an application window for applicants to take advantage of. So our pre-registration will be from March 24th to March 30th. So what this means is applicants can log into the portal, create their account, and they can actually also begin uploading documents. We've learned from not only our program, but from others, that one of the most challenging aspects of these type of assistance programs is getting documents uploaded correctly. So we've created some aids for that, made some free apps available, and we're extending this pre-registration window to allow for that to start happening even earlier. And then we'll come to the actual application window on March 31st. That will be open through April 6th. And this is the time when applicants can actually complete the application questions, finish uploading their documents, and submit. And so after that period of time, we're going to be having 2 grant award periods. The first group of payments will go out by the end of April. And that group will focus around applicants that are eligible, that meet one of the priority factors or more, which includes minority, women, and veteran-owned businesses, as well as low and moderate income communities and businesses that have employees. So those that are eligible and meet one of those will be considered for that first grant award. And then at the end of May, we'll have a second period of payments that go out, which will be those that did not meet one of the priority factors, or some of those businesses that maybe met a priority factor but needed some extra time and work to complete and move into eligibility based on perhaps some information that was missing. And again, these timelines are based on our estimate of around 5,000 applications as they come in. We'll monitor those closely and return to you if we need to make any adjustments, but we're pretty confident we can get there. Next slide, please. Thank you. So our guiding principle as we went about this task was we want to make it as easy as possible to apply for this. And so to that end, we want to give our applicants and businesses and nonprofit organizations information now about what can they do to get ready. So first of all, they can go to our website. So we've created a robust website with all the program information, all the details that can be found at www.vcbusinessgrants.org. So we encourage everyone to go to that website that's interested. Also, we're asking them now to start the process of gathering the documents that they would need for the application process. Those documents include a photo ID, a tax return from either 2019 or 2020, proof of physical address in Ventura County, signed and dated IRS Form W-9, and for nonprofits, they will need an IRS determination letter. And so very often we'll get questions around, these types of documents and what specifically qualifies. And so all of those details are included on the website. We also on the website have a place where applicants can sign up for a webinar. And so we'll talk a little bit more about those in a second, but we encourage applicants to sign up now and also to click the button that says sign up for updates. So as the program is rolled out, as new information and dates are coming upon us, they will get regular updates through that. And again, we are already sending those updates to the over 15,000 businesses that are registered at VC Reopens. Next slide, please. So I want to talk a little bit about what people will find on the website. So first of all, it will go over in detail the eligibility requirements. Here on the slide, you'll see the basics of that, which are that you need to be a small business or nonprofit located in the county of Ventura and need to have been in business prior to 2021. To be eligible, you need to be have been impacted by COVID-19 and an annual revenue of between 25,000 and 2.5 million. And again, recipients of our first grant program are not eligible to apply for this second round. The website also includes a detailed listing of the required documentation, how to scan documents, a listing of the priority factors your board has identified, eligible uses of funding, FAQs, which we'll certainly be adding to as the program continues to roll out. And we, once the application itself has been finalized, and again, this website is the program information, it's not the actual application yet. But once we have that final application, the website will contain a full listing of every application question with a kind of a detailed description of the scope and context around that and common questions that might come up related to those different application questions. So the website also lists the webinars, and folks can sign up now to attend those. We will have hosting those webinars in English and Spanish. We have a call center that's lined up, and that will begin taking calls at the beginning of the pre-registration period. That will continue through the application period and extend through the application review process so that folks can have an easy means to get status updates on their applications. We certainly recognize that outreach is a key priority for us and for your board. And so we already held a partners meeting last week, and we invited stakeholders, local chambers, cities, some of our ongoing partners in the business community, EDC, WEAVE, our VCCF partners, and connections to nonprofits in our community. And so we provided them the full program information, displayed the website, walked through there, gave opportunity for question and answers, and perhaps most importantly, reached out and asked for their support to do the outreach process to our different communities. And so we'll be sharing the program flyers and marketing materials with all of those partners, asking them to take advantage of the trusted relationships they have within their own communities to make sure that the message is getting out to the businesses and nonprofits. And of course, our PIO's office is going to do a press release and robust set of ads and social media campaign around this as we proceed forward. I have, if we can go to the next slide, please. I want to give an update on some state and federal resources as well, and then be happy to take questions here. The California Relief Grant Program was given a little over $2 billion in additional funding. And so folks can go to careliefgrant.com to get program updates, and they have identified 4 additional rounds of funding that they will be using that $2 billion for. This next round coming up, they are not taking applications, they are using waitlisted. That is those that already applied in the first and second rounds of this program. And they'll be designating awards for them. And that's happening right now as we speak. Then the next round that's been identified is specifically for nonprofit cultural institutions, and applications for that round will be accepted between March 16th and March 23rd. And then a 5th and a 6th round has been identified as coming up, and that is for both waitlisted, those that have already applied but have not been designated a recipient yet, as well as new applications that will be accepted. And so the first application period for that will begin March 25th and go through the 31st. And it's anticipated there'll be another application period following, but that's has not been published yet. So we're encouraging all of our local businesses, if they haven't yet, to take advantage of the California Relief Grant application in addition to our county relief grants, which they're separate programs, and you can be a recipient of both if you meet the eligibility requirements. I wanted to touch also on the state fee relief that was announced. Some of the implementation guidance has come out, so we have a little better understanding now of how that's going to work. So this is for, first of all, restaurants and bars that are licensed through ABC, which is approximately 59,000 in California. For Ventura, it's a little over 1,000 that meet the criteria that's been identified by ABC. And typically those licenses are anywhere from about 450 to 1,200 annually. And for this, the eligible businesses will annually receive their renewal for the fees. And so those renewals that come in between the time periods of March 1st of 2021 and February 28th of 2023, in other words, a 2-year period starting March 1st, as those renewals come in, they will have the opportunity to file a waiver request to eliminate the fees associated with that renewal. This one we call out specifically because the implementation of this is different than the other one, which is for barbering and cosmetology. So our restaurants and bars, they do need to file a waiver to get that relief. Barbering and cosmetology, on the other hand, this is an automatic fee waiver. And so every 2 years, establishments and individuals in barbering and cosmetology pay a fee, and they do not have to apply. This will be automatically exempted from the fee when they renew. Lastly, I want to touch on the PPP. The Small Business Administration has released new guidance, which is intended to give additional funding to increase the amounts of funding that's going out to sole proprietor applicants. And so what they've done is the calculation for how much you're eligible to receive has been moved from net profit to gross revenue. And so as a result, applicants that come in as sole proprietors through the PPP system will have the opportunity to get more greater size loans through that process. So I know I gave you a lot of information there. I'm happy to take questions. Thank you.
Great information for our businesses. Not seeing any questions. I do see a question. Supervisor Long.
Thank you very much, Madam Chair. Paul Stamper, the website looks great for this application for the business grant for 20 million. I think you guys are doing a great job. I was wondering, we had a conversation at the EDC in regards to maybe the EDC being used as a call center. I know we used Weave in the past, and just wanting to know if there's been any confirmation on any of that.
Yes, thank you, Supervisor. Absolutely. EDC is going to be the first level call center for the program, which is great because they've already got experience from our first grant program, as well as they've provided the call center services for the California Relief Grant. And so it makes a lot of sense to leverage that knowledge and experience. And we're actually going to have 2 levels of a call center so that our EDC can hopefully not only help with this program, but where suitable, connect them to local resources. And our Ernst & Young partners working on this program is going to have a second level call center, which will serve 2 purposes. First of all, if we have peak volumes at different times, the phone system can roll over so that we want to reduce or eliminate, if possible, any calls going to voicemail. And secondly, they will be the experts on the technology piece of it. And so if administrative issues come up related to the website itself for the application, they'll be able to service that immediately.
Thank you very much. I've signed up for the update emails, so I look forward to those. Also, thank you for following up on the actual eligibility dates for the state relief program. I've been talking with Mike Powers in regards to what our Board of Supervisors and county can do for our businesses similar to the state. I know we have done some, and so I've asked to look into any other additional fees or penalty waivers for our local companies that have been struggling, and wanted to let the community know that as well. I know our board has been very supportive of that in the past, and so I'm excited to see if there's anything. I know our CEO's office and Paul and everybody's really been looking into it, but if there's anything else that we can do based on what state and federal has done as well, I'd really like that. So thank you.
Mr. Powers.
Just real quick, thank you, Chair Parks, Supervisor Long. Yes, so yes, your board has approved already this fiscal year about 1.7 million in fee waivers and reductions and penalty waivers. So those remain in place to the end of this fiscal year, but we are exploring other options going forward, and we'll report back to your board on that.
I really appreciate understanding how much we have been able to do for our businesses. I think sometimes that isn't promoted as much. We go so fast to help that we move on to the next item, and I think that that's part of this slide too, is to make sure that they know that on the county side we're doing things for them as well. So thank you.
Right, thank you.
And maybe there will also be some benefits, long-term benefits from trying new, for example, outdoor dining, that they'll want to continue those types of ways of serving.
Definitely, very popular. I think people really love it. Okay, with that, thank you, Paul. Maybe we can go back to our rental assistance program with Melissa Livingston, our HSA director. And if we could go back to, I believe, slide 30, please. There we go. Thank you.
Good morning. Can you hear me now?
We sure can. Thank you.
Awesome. When life gives you challenges, just reboot. So tech team came up and rebooted me. So thank you for being patient with me. In January of this year, our governor signed the COVID Tenant Relief Act, also known as Senate Bill 91, which established the state's California Emergency Rental Assistance Program, which was actually funded by $2.65 billion that came from the last December 2020 stimulus package that directed $1.5 billion to the state and $1.1 billion to local jurisdictions. And so this program has allowed us to direct not quite about $52 million for rental assistance relief for tenants and property owners, leveraging a state centralized system. This morning, item 12 on your consent item agenda approved a standard agreement between the county and the state to leverage the state's centrally administered program. The city of Oxnard has also taken advantage of that same opportunity to put a standard agreement in place. And so collectively, we are working in partnership with the city of Oxnard to ensure the $52 million that has come to Ventura County meets the needs of our most disadvantaged communities. And so the focus of this program is to look at those most disadvantaged communities, those groups that have inequities to access. And to give you a sense, the program focuses on its highest priority of any individual or household that has income at 50% of the average median income as the highest priority. And just for context, a household of one, that income level would be $39,500. For a household of three, that would be just a little over $50,000. It also, as a second priority, recognizes that anyone at or below 80% of AMI is also eligible for funding. And for context there, one person household would be up to $63,000 of income, and for a three-person household, that would be $81,350. And so the program also is recognizing that more than 90% of these funds are required to go out into direct assistance, with some of the funds supporting the administrative support that's required from a centralized perspective as well as the local perspective to administer the program. The COVID Tenant Relief Act also extends the rental eviction protections through June of this year. Next slide, please. So the period of eligibility for this program, there's a potential of individuals or households that apply of being eligible for up to 12 months of rental arrearages. And that period of eligibility is from April 1st of 2020 through March 30th of 2021. There is also a potential for eligibility for 3 additional prospective months of rent. Tenants can apply and receive up to 25% of unpaid rent. Landlords may apply and be reimbursed up to 80% of unpaid tenant rent. The application portal is going to go live next week on March the 15th. Information is now available for tenants as well as landlords that are interested in learning more about the program at housingiskey.com. There is also a large communications and outreach initiative underway. The vendor that's administering this program on behalf of the state, the third-party vendor, is a well-established organization that is referred to, the acronym is LISH of the organization, and it's in a local initiative that's involved in community development financing, and they have extensive experience working with disadvantaged communities with a focus on equity and access, as well as a focus on managing and supporting multiple languages. And so the central hub where people will apply, this group will be administering it, and they will be providing a hotline. They will be providing case managers to work with tenants and landlords. They have committed to providing over 19 different languages in support of the portal. They have also provided registration for our local businesses, organizations, nonprofit partners to register with them to assist in the outreach in 3 different areas, whether it be promotion, outreach and education, or actually assisting with technical assistance. To date, we know of 2 local groups that have signed up. The program continues to market availability for locals to sign up to assist. The focus is really to ensure that those community-based organizations that are the most trusted, that are embedded in our community, are the ones that we connect up with this initiative. So in addition to those that have applied and registered through the portal, we're also working with our local groups to engage them in this process through a broad and robust community campaign. And a lot of the focus is to also leverage the same groups that helped us with the Census 2020, and recognition that a lot of the groups that we are wanting to connect through this program are those were those hard to count and most difficult to serve and provide access to the offering. So this is going to be a rolling program. There'll be multiple rounds to it. We will be receiving much more information this week to solidify the program. We're sitting on an advisory group that's allowing us to have input into the program, including helping to identify ways to relax and create flexibility for the documentation requirements for the program. So I am happy to answer any questions that you might have.
Supervisor Ramirez, do you have a question?
Yes, I'm just letting people know at the City of Oxnard about this. I think they already do, but I think that the key thing is how to get people informed of this within the timelines. And sometimes just going to a website, it might look simple, but sometimes it overwhelms people. So I'm hoping that we can figure out how to, and I heard you talk about it. Thank you, Ms. Livingston, how we can get more people to sign up, get aware, get their documents together for both the business grant program and the rental assistance. Is just such a great opportunity for people who are really worried about keeping a roof over their head. Thank you.
Absolutely, Supervisor Ramirez. We appreciate the partnership with the City of Oxnard in looking at how we can come together, and some of the ideas have actually been boots on the ground to have individuals out in the community that are well known and trusted in the community, actually doing face-to-face outreach and not just relying upon social media and such, but those trusted relationships and networks. And so appreciate your comments and recognition of the importance of that more extended type of outreach.
Thank you for the report, Melissa.
Welcome.
All right. Thank you, Mel. And maybe we can go to slide 36. So we are, this is pretty much our report. Two final comments. One, it is our nature, of course, to just look forward. What's the next challenge we want to overcome? And that makes sense. But also just a quick look back. We thought we knew what a surge was in the summer when the hospitals hit 110 plus COVID patients. Then a few months ago, we really found out what a real surge was. Over 455 COVID patients in our hospital. And I just want to take a moment to reflect and appreciate our healthcare providers, public and private, in our county, who that was an extraordinary effort that they undertook with great compassion for each patient and family one by one. So we appreciate their work. And then also appreciate the work of the community. Yes, our numbers are looking better. That's why we're so close to going into red, but that's you getting tested and following guidelines, our great compliant businesses. And one interesting note, I think anyway, that our numbers got high at some point, our case rate, one of the highest, but we also had the highest testing. And so what that happened, because everybody was getting tested, when the numbers came down, we came down at a faster rate than the state did on average. And that's what we would hope would have happened. And that's a direct result of the community's good efforts. So with that, thank you for the time, board and the community. I know it's a lot we covered, but that's our report for today. Thank you.
Thank you very much. And at this time, then, our next item on our agenda, I guess we're going to our time certains.
Supervisor Parks, we have a comment letter to read on this item.
And
Okay.
I also have a comment as well. Thank you.
Okay, well then, Supervisor Long, why don't you go first and then we'll read the comment letter.
I just wanted to take the moment, the very beginning slide of stating that we have been in this pandemic almost 1 year. I wanted to end with saying thank you to Mr. Powers, as I was chair last year and we were on our way back from Sacramento to talk about homeless efforts and our hospital system and how we can really work together to get housing and all that at the state level. We were also on the plane talking about, oh no, this pandemic might hit and what are we gonna do? And it's been over 365 days of this pandemic as being top of mind for our county. And I cannot leave this conversation without saying thank you for the vision and planning and just heart effort, Mr. Powers, in working on this, and our board in our support with all of our team and our directors and every single employee that we have and volunteers in private sector. It brings me to tears, actually, the amount of work that has been done. My questions today is just as we work together to just keep going. But I just have to say thank you so much. It has been one really long year. And to be able to think that maybe on Tuesday we can get to red again and kind of see the light at the end of the tunnel is just very, very emotionally exciting for me, because we have just been having to do things that we don't want to do. And the work has not always been easy with the state or the federal. We have not all agreed on things, but we've ended up working together for the greater good. And I just wanted to say thank you to everyone who's even watching, all our constituents that have been having to follow the rules and things that we don't want to do, and just really appreciate it. It has been a lot. And Supervisor Parks, thank you for continuing as we go through this as chair. It is a lot of work, and I just really wanted to say thank you very much.
Well said. Thank you for acknowledging that. It has been a very, very long year, and we talk about how our county is always one of the best because we have so much experience in dealing with crisis that we are really good at it. But really 3 years, or actually 4 years of wildfires, mass shootings, and now the pandemic. It would be nice to get a breather, and it looks like it is coming. Supervisor Huber, you wanted to comment?
Yes, thank you very much. I just wanted to say kudos to our CEO, Mike Powers, for an excellent job in managing this whole COVID process. I really appreciate it. I know it had to be stressful at times, but he did an outstanding job, and I very much appreciate it. Thank you.
Thank you. Well deserved.
I'm sorry, we are a team, and as your board knows that it's all about our team, our leadership. Many of whom you heard from today are all of our county employees, and your board's support unwavering in our community. Thank you.
All right, good ending, and it managed to get us to 11:30. Oh, Supervisor Ramirez, do you want to comment too?
Yeah, I agree with my colleagues here on the great work that's been done. I just want to have us always remember what it has cost our community. So many families devastated, including mine. And we have to find a way to remember them and go forward to do always improve. And vast holes have been left in our community and our country because of the virus. And it's going to take some time for us to acknowledge that, and for those families that are really devastated and have financial problems and mental health problems. I want us to also be thinking about that as we go forward. This is going to leave a long train of trauma for for the nation and maybe the world. And it's not going to be over for a while. Thank you.
Good point too. This is worldwide, and you can also see in some places they are just getting into the surge, right? So just so thankful when you think how they got the vaccine out and in record time, historically record time. And that really is, as Dr. Levin was saying, that is our light. It's the, what did he say, the spotlight at the end of the tunnel. So thankful for that, and absolutely recognizing the whole in so many people's lives and so many families as a result of this terrible pandemic. I think with that, unless anyone else wants to speak, we will go ahead and move on to our 11:30 time certain.
Supervisor Parks.
Yes.
We still have a comment letter that needs to be read.
Comment, yes.
Good morning, Chair Parks, board members, and CEO Powers. This email is from Robert Munoz Atkinsons, and it says, to the Honorable Ventura County Board of Supervisors, I respectfully ask supervisors to petition both California and congressional lawmakers to form a joint and multiple partisan legislative committees to reform public health responses to pandemics and transition from governance by executive orders to enacting laws. It'd be better to learn from costly mistakes now rather than repeat them again in the future. Joint committee hearings should facilitate cooperative and proactive dialogue between politicians, experts, and constituents to discover more effective and sustainable response to manage COVID-19 or more deadly COVID-19 variants or pathogens. Ideally, hearings will also help reduce societal polarization and pandemic fatigue. Questioning opinions, facilitating dialogue, and building consensus will save more lives and resources instead of blindly following Governor Newsom's COVID-19 executive orders or experts' opinions for another year. For instance, to protect vulnerable individuals, how can targeted COVID-19 testing save more lives and resources than community-wide contact tracing and testing? And there's a link provided. Congressional hearings should review why some counties had fewer cases and deaths per capita than the United States or California while protecting civil rights, such as Sweden, and that is a link, or by implementing border restrictions sooner than Taiwan, and that's also a link. The attached file contains 10 suggestions for creating proactive policies that balance competing objectives and protecting medical and emergency services and individuals' constitutional rights and saving lives, businesses, jobs, and the economy instead of flattening the curve to save lives. The following emails are examples of requests sent to politicians for public health experts since 3/21/20 about examining government response to COVID-19, and he provides a letter in prior emails. Thank you.
Thank you, and how important that is to rely on the experts. Thank you for that. This concludes item 8. Do we have a motion to receive the report?
I will motion to receive. Long.
Second, Huber.
Thank you. Motion and a second. Could we please have roll call?
Hi, sorry. Yes. Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, and congratulations to the clerk of the board who puts out the agenda and knew that we would be starting at the end of this at exactly 11:30. So really well done. Our next item then is our 11:30 time certain, and this is item 35, and this is regarding the Santa Ana Boulevard Bridge Replacement Project, and one of the better firms that we know of for doing this kind of work, which is Security Paving. And so with that, we do have our staff presentation.
Yes. Good morning, Chair Parks, members of the board, Mr. Powers. For the record, I'm Dave Fleisch with the Public Works Agency. Normally, we place contracts awards like this on a consent agenda, but for this particular project, we felt it important to highlight it, not only because of its role in the Mattelha Dam ecosystem restoration, but also for the full agency involvement in the project. As stated, I'm here today to request that you award a contract to Security Paving to construct the Santa Ana Bridge Boulevard improvements. And I'm going to try to forward these slides if I can. Oh, there it is.
If not, I bet someone could help you.
There we go. So for the past 20 years, the Public Works Agency and the Army Corps of Engineers have been working on the Matilaha Dam Ecosystem Restoration Project, as you see on this slide. The ultimate goal of the project is to restore the aquatic habitat of Matilaha Creek and the Ventura River to encourage fish passage and restore natural sediment transport. The removal of the dam is the key objective because that will increase peak flows and sediment loading. However, to assure downstream impacts are addressed or minimized, there are many project components that are required prior to the dam approval. That involves two bridge replacement projects, and the Santa Ana Boulevard Bridge is one of the bridges to be replaced. And if I can figure out. Although the existing bridge where the Santa Ana Boulevard crosses the Ventura River is sufficient for traffic needs and is in good condition, its insufficient width and height is what is the reason that the dam is being removed or being replaced. The bridge is being replaced in preparation for the dam removal. It needs to be able to carry a larger capacity than the current bridge can handle. So fortunately, the way the project is laid out, impacts during construction of the new bridge will be minimized. The existing bridge will remain in service while the new bridge is under construction. So no temporary road or culverts will be needed across the riverbed. Also, there won't be a need to detour local traffic, which will be much appreciated. Work in the riverbed will be done during this year's dry season, and the grading and arming of the channel banks will be done in next year's dry season. So working in the dry seasons minimizes the impacts to fish, frogs, or any other biological resources, and is a condition of our environmental permit. Note that when the bridge is completed, the space under the bridge will be about 50% wider, going from 150 feet to roughly 230 feet. Oop. It's important to note that this truly is a full agency effort. While Watershed Protection initially hired the engineering firm to design the bridge, Roads and Transportation did a lot of review on the project, on the design. And since the bridge will become a Roads and Transportation asset, and we've done several bridge construction projects, Roads and Transportation is going to be managing the construction of the bridge. In addition, Roads and Transportation is fronting the funding for the construction with reimbursement from the grant funds after the fact. Watershed will continue to be involved in dealing with the channel armoring efforts and also the environmental aspects of the project. Our Central Services Department handled all the real estate and right-of-way issues during the beginning process of this, and also is handling all the finances and funding. And our Engineering Services Department handled the bid advertising and award, and will be handling all the monthly progress payments to the contractor and the consultants that will be assisting throughout the construction. So just briefly, the construction schedule, the contract, pending your board's award. Today, the first day of the contract should be in early April. The intent is for the new bridge to be constructed this summer and into the fall, having it out of the waterway by the time we get into the wet season. About a year from now, we'll be able to shift the traffic onto the new bridge, and in the summer of 22, the channel grading and arming will be constructed so that in the fall of next year, the project should be completed. Okay. This completes the presentation, pending your questions in board direction.
Thank you very much for the presentation. Supervisor Huber and then Supervisor Ramirez.
I have no questions or comments at this point in time. Thank you.
Got it. Thank you. And then Supervisor Ramirez.
Yes, thank you very much. Great project, very important. Sorry about the dog. For the benefit of the public, can you just sort of give us a timeline on the dam restoration removal plan? Thank you.
Yes, ma'am. For that, I will turn that over to the Director of our Watershed Protection, Glenn Shepard.
Morning.
Morning.
question was regarding the dam removal.
Yeah, a time frame.
Our planning horizon takes us out to 2035 now.
I didn't hear that. Say again.
2035 is our planning horizon to have the dam removed.
And that's dependent on financing, et cetera?
Yes, financing and completion of the other projects that Mr. Fleisch showed at the beginning of this presentation.
Thank you.
You're welcome.
Madam Clerk, I have just one question. And I want to first thank you, Supervisor Parks, for mentioning security paving. It really is important that we hire contractors like this, employ hundreds of local skilled workers, and it really will be a strong local economic driver, which is exciting. And Mr. Fleisch, I appreciate you bringing up the kind of the overview of the entire ecosystem restoration project, which kind of maps out all of the various steps that we have to do to get to the end goal, which is the removal of the dam. And this project is a critical step in that process. And so I appreciate you showing that overview and just noting that this is a real progress we're making as we reach this goal, as you just mentioned, Mr. Shepherd, of 2035. My one question relates to the impacts of local residents, and I appreciate all of the work that's been undertaken to really minimize those impacts in terms of laying out the construction and building the new bridge before we demolish the old bridge. And the question is, it looks like there's only going to be 2 weeks during this 2-year process where there's going to be some sort of impact. Is that true, Mr. Fleisch?
Yes, as the schedule is currently laid out, there's just a couple of week period where there's going to be down to 1 lane of traffic on the existing bridge as we're making the transition from one bridge to the other. There still will be access for traffic, but it will be limited down to 1 lane, and there'll be some traffic control that will be involved at that time.
So no need for a detour, just bringing it down to 1 lane.
Yes, sir.
And that wouldn't be until 2022, is that correct?
Yes, sir, that's correct.
Okay, great. Thank you, Madam Chair.
Great, thank you. And now, not seeing any questions, would you like to make a motion, Supervisor LeVere?
I'll move staff's recommendation. Thank you.
Second.
Huber, second.
Okay, we have a couple of seconds. I'll let the clerk decide which. And
I'll defer to Supervisor.
Okay, we'll go to Supervisor Huber for the second. Supervisor Long, did you also have a comment or question?
Nope, I'm just ready to vote. It's a great program. I'm really excited to hear about the local hire and that we're getting this forward. So thank you.
Yes, and one of the real benefits also, in addition to the local hire, is also they're one of the few that I have seen that come in before, early, as well as at a lower cost. So it's great to have them in our region and be able to use them on this project. So with that, Lori, for the vote.
Supervisor LeVere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you. And with that, we'll go to our next item on the agenda, which is item 36. And this is a second public hearing. And so we have voted on this once before, and I'll turn it over to Sean Otten. And as he tees it up, the item is an ordinance amending section 1347 of our code. And this relates to our civil service system and classifications. And you are still...
My apologies, supervisors.
Oh, I just unmuted too, Sean. So you want to take it or you want me to?
Go ahead, Marjorie. Marjorie Deal, our class and compensation manager, will take the next 2 items.
Thank you, Ms. Deal.
Good morning, Supervisor Parks, Chair Parks, and Supervisors and CEO Powers. I'm here today to talk to you about the second hearing on the recommendation placing the new HCA ambulatory care clinic classifications in unclassified service due to the scope and complexity of these job classes. This was all detailed in the original board letter that was heard on February 23rd, and this is a second hearing. We are recommending that your board adopt the ordinance amending section 1347 of the Ventura County Ordinance Code to place these classifications in the unclassified service. This is the second hearing, and the ordinance would become effective 30 days from the conclusion of this second hearing, or April 9th, whichever occurs later in time. The five classifications are CEO, Medical Director of Ambulatory Care, Chief Medical Director, Ambulatory Care, Chief Medical Quality Officer, Clinic Medical Director, and Ambulatory Care Administrator. Do you have any questions?
And having had this before us before, I don't think we have any questions at this time. Is that Supervisor Long, your mic is on. Do you have a question?
No, thank you. I appreciate we have asked our questions at the first hearing, so thank you.
Okay, so I will go ahead and close the public hearing and entertain a motion.
Huber, so moved.
Long will second.
Thank you. We have a motion and a second, and this is all part of our getting all our ducks in a row, if you will, in terms of moving the clinics more under our county's umbrella. Could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. Thank you. And thank you for the presentation. Look forward to the outcomes of this. Item 37 is next on our agenda, and this also is a public hearing, so I'll go ahead and open the public hearing. And it also is similar in the sense that it is regarding classifications, and I'll turn it back. Margie will be doing this one too.
Yes. Again, good morning, Chair Parks, Supervisors, and CEO Powers. I'm Marjorie Deal, your Manager of Classification and Compensation. I'm here before you today for this second hearing, for this second item, with several recommendations, including the establishment of one hospital classification and amendments to the management resolution. Our first recommendation is to establish one classification to oversee the operations of the Ventura County hospitals. The recommended salary is based on external market surveys and on internal parity alignment. This new classification, Chief Operations Officer Hospital, will be the highest ranking leader of hospital operations and will report directly to the Medical Director, Hospitals and Administration. We also, secondly, are asking that the board adopt an ordinance to place this classification in the unclassified service. A second hearing has already been set for March 16th. Third, we recommend that this new classification be added to Exhibit 1 of the Ventura County Management Resolution. And lastly, we are recommending amendment to the management resolution to clarify sections 1207 to 1205 to 1207. These sections relate specifically to buy down eligibility or redemption vacation for management employees. The amendment clarifies the original intent and eliminates any confusion about the number of hours an unrepresented employee is eligible to redeem. With that, I opened any questions.
Thank you for the report. Are there questions? Not seeing any. Do we have a motion?
Huber, so moved.
I'll second.
Thank you. We have a motion and a second after I've closed the public hearing. And could we have the roll call?
Yes, Supervisor Parks, I would like to read this ordinance title into the record.
Thank you.
It's an amendment to the Ventura County Ordinance Code, Division 1, Chapter 3, Article 4, Civil Service System.
Lori, I'm sorry. I do note that I understand we have 2 public comments on Zoom on this one.
We had 2 public comments, and they said they were not going to speak on this item. They're waiting to speak on public comments number 9.
Okay.
Supervisor Levere.
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks. Chair Parks?
I think she's muted.
Thank you. Yes.
Is that a yes?
That would be a definite yes.
Thank you so much.
Thank you.
Thank you.
And now let us move on to item 30. And this is a recommendation of Supervisor Levier, so I will turn it over to him.
Great. Thank you, Madam Chair. I'll make this quick. This is just my recommendation that we reappoint Claudia Armand to a second term on the Behavioral Health Advisory Board. She just finished her first term. She's been a valuable member of that board. I think she's been a real asset to the discussions that have been had over the past 4 years, and I would love to continue her voice on this board. And so I would seek my colleagues' support of this item. Thank you. And I would make the motion.
I'll second it. I just want to say I know Claudia and she's terrific. Good choice.
And I also agree 100%. Claudia has been a wonderful asset. And as you know personally, Supervisor Levier, as you sit on the committee now too. So so glad that she's willing to continue her service. Roll call.
Supervisor Levier.
Yes.
Supervisor Long.
Yes.
Supervisor Huber. Supervisor Huber. Supervisor Ramirez.
Yes.
Chair Parks.
Yes, thank you very much. And we will call that a 4-0 at this time. And we'll go on to our next item. This is item 31. And this is an item that I'm bringing before the Board of Supervisors. And this is in combination with another action that we took just a couple of weeks ago. And it's in regards to Growing Works and the property that they have out in front, which is been as part of the plan for Growing Works are to be demonstration gardens. And Turning Point Foundation runs the Growing Works program. And part of the vision is that not only will the employees who are people that are recovering from mental illness and having the opportunity to get horticultural therapy and job training in the nursery, they will also be able to assist with the demonstration gardens out in front. And there are 2 acres in front that will that are to be the demonstration gardens. And actually work has started on that. But to have Turning Point Foundation, which has its mission to assist people with mental illness, also have to build the demonstration gardens was too much, really. So our county took those 2 acres back so that we could have the ability to get this project moving. If you could go to the next slide. This is a map of the area. The county owns 50 acres on Lewis Road, and that Lewis Road is at the top of the screen. The 2 orange parcels there is where the demonstration gardens would be. And the blue rectangles down below, those are the L shape. That is the Growing Works nursery itself. So the gardens already, as I had mentioned, have some work that has been done on them. And I think if you go to the next pic, there are actually a couple of photos that we have in this PowerPoint. If you can go to the next slide. So there is the property, and Lewis Road here is at the bottom of the slide. You can see the 2 acres in the middle. One has a very large oak tree. And this is actually an older photo because now we also have a labyrinth that many of the staff and several of the board members have seen already. The property, as we're looking at it in the left bottom corner, that is actually being looked at for the Many Mansions Rancho Sierra project, which is an apartment building for people with mental health challenges and possibly other vulnerable populations. And I mention that because they would also be able to have the enjoyment of the parks demonstration gardens next door. Already on site, on the right side of the picture is what we call the CASAs. These are housing for people with mental health challenges, housing run by Telecare and also Turning Points, Via Callejas rather. So you have a lot of people living here, as well as right in the middle of the picture, that large building with the red roof is the rain shelter, where we have people, and mostly families of people who are working out of their homeless situation. It's a shelter, and it's a transition back into getting their own homes. So the far left side of the picture has Casa Pacifica, and that's helps young youth, and sometimes these are foster youth, but it just shows you that we've taken these 50 acres of the county property and made them very useful for mostly residential for vulnerable populations. And so the concept of taking the 2 acres in front for demonstration gardens, to me, is a way to really get some synergy for the whole property that could be used by all these vulnerable populations. And not only that, and you can advance the slide too, you can see some of the progress that has been made. This is the Dr. Steve Sandifer has designed where he sees these gardens to go, and it's mostly native plants, but also for the types of native plants that we have, it includes an area of oak woodlands, an area for Channel Island native plants, and then something also very important is to have it's a demonstration garden, so demonstrating the types of drought-tolerant plants people can plant in their yards, as well as fire-resistant type of plantings, so we can get a good idea on what kind of planting we want to do in those high fire severity areas. It is also an opportunity to push forward on what all of our agencies that own land should be doing, which is assisting where we can, particularly in the coastal range, in terms of providing habitat for monarch butterflies, which is facing a real population extinction here. Unfortunately, the whole western monarch butterfly is down to just 2,000 now left in their species. So the idea that we can use this park to assist many goals, as well as the county's requirement now to plant 1,000 trees a year. So there's all those benefits. And if you move to the next slide, as I was saying, you can see I was out there this weekend and took some photos, so you can see where we are from the photographs. If we can advance the slide. There we go. So as you can see, work is already underway. Paths of decomposed granite are already out there on the properties, and I think we might have one more. So what the proposal we have before us is to take this property under our wing instead of the nonprofit Turning Point, and to get those demonstration gardens built with the help of the Growing Works employees, as well as other possible vulnerable populations. We have lots of volunteers that want to assist too, but to actually get them going by putting our General Services Agency, who oversees our parks, in charge of getting the project up and going. And working with our Parks Department, they have estimated that they would need $280,000 to get this planted, irrigated up, more decomposed granite, making it accessible for disabled, and then have it become one of our county's parks. And for all the 5 districts of supervisors, District 2 that I'm in has the fewest parks, so this is kind of an equitable thing too. But this is a disadvantaged community, and so I think it will be really well served. It's a very small park, and they're looking at an estimate of $51,000 annually to maintain it. And again, here's another shot on your right of where we are right now, what the land looks like. That's part of the labyrinth that you're seeing. On the left is the barn that we're also looking at repurposing for potentially even a park host now too, as we look at how to actually take that annual 51,000, see if we can cut into that a bit. So that's the presentation. That is my request. I'm available for questions, and then interested to hear your thoughts on this. Supervisor Long?
I was unmuted. Thank you very much. My understanding, we as a board, and I'm only saying this so that the other board members that are new know, we provided one-time money to Growing Grounds. Is that correct, Supervisor Parks?
We provided funds for Growing Works, and they went to Turning Point Foundation, the nonprofit that does the program.
Okay, so it was a great, with Supervisor Parks spearheading this, I think we had 150,000 go to the repair of the building so that they could lease the product for the building, and then an additional 35,000 for the garden, the 2 acres, and then we also provided them with volunteers, and I mean our public works was out there, and our parks and rec and other people were there, and the ribbon cutting was great. Everyone walked around that labyrinth and so forth. It concerned me that the park came back to us, the 2 acres, last year, I believe it is, because what you said was it was too much for Growing Grounds. And so I understand that. So to me, I didn't see from what was put into the agenda what the plan is. So the estimate of $280,000, I think is maybe I'd like to see more information before I was to grant any of the funding for this, because I think there's still some design, especially since you stated many mansions will be moving next door. How can they use that park too with my district that's there? I'm trying to understand the cost associated with how many people visit that park. What is the true value we're going to get out of these funds? And I know you look at that as well. But if we're talking about the 51,000 as the maintenance cost every year to be that much, I personally have Tolan Road and Kenny G Park that need to get rebuilt. And we need funding for that as well. And I've talked with, I've been to the fish hatchery location, which we have a garden like you're talking about, which is natural plants and the signs that say what works and what, all the beautifulness. That takes a lot of time and effort to maintain. So I'd like to see this plan a little bit more vetted before we're actually at this point. So I don't want to be putting funding to this when I know that the parks is an enterprise fund. And so I'm just questioning why we would be adding extra dollars and not utilizing our enterprise fund if this is actually in the parks district, because I want to make sure all people can utilize this and they're getting the same value out of as our other parks.
Thank you. And certainly the cost for this was actually all priced out by our parks department. And for example, I have the sheet in front of us and I can provide that for you. But they have it broken down to the irrigation system for $26,000, project management $16,000, construction of they've got the plants all listed, the security operating costs. So, I mean, it has all been broken down by the Parks Department for this. And to build a park for $280,000, Supervisor Long, this will no doubt be the cheapest park we've built in, the last 50 years, because it is just we're not talking about anything that, you're not mowing lawns every other day or, every few days. You're not doing the watering that you have to do because it's drought tolerant. You're not building ball fields or, having to do that kind of more extensive active park. This is a park for people to walk the trails. And that's basically it. And so when you have an apartment building of older adults, I think that will be such a great complement to it. But, I certainly want to make sure we use our monies well, but I know that this is something that, we certainly can afford. Supervisor.
Well, and I understand that, and I'd like to reply. I would like to see the plan for this, and I would like to make sure that Many Mansions is there. We were not provided that, and I think that some of the costs might be more than what's being said. And so if it's finalized, I'd like to see the final. I think that this should come back so that we can get more information and really understand what it is, because this is money that's coming from the general fund and not from the parks, from what I understand. And with everything going on, you might say that this is inexpensive, but I'd like to see the information and make sure from my standpoint, because people that I've talked to want fields that they can put a blanket out on and sit, or with seniors as a park. And so if we're going to be taking this back on, I value the guidelines that Growing Works would like to have it, but I would want to make sure that we're building it to what the community needs so that everyone in Ventura County could utilize it. And that's where my questions come from.
And I know supervisors want to speak, but our county is the only county in the state of California that requires our parks to be revenue generators. And we've kind of gotten away from that in our general plan too. But the fact is, this is something that has, and I can ask if Coulter is available. I think he is on standby, as is Mr. Sasick with GSA, who can, it is their numbers, so they can address that. But just the reason why I point out the fact that our parks are generally enterprise zones to make money is because they don't. And as a result, we take money out of our general fund to fund the parks. And so if we want to fund the parks, we can't take it out of their budget, because their budget is already not able to fund the parks they have. It is something like libraries, where we decide this is an important value to our public, so we will take general fund money and buy books in the library and put parks out there for our people and pay for sidewalks. And those are just kind of those core things that we have to decide as a body whether we want to fund these kind of things. And as I was saying, this compared to all the other parks is less. And let me go to the other supervisors, and then I'll ask our staff to address where they got their $280,000, where they got their costs for maintenance. Supervisor Ramirez.
Yes, thank you. And I will look forward to seeing more details as Supervisor Long's interested in, but I'll support this because I actually have been out there and I've seen the plan for what it's going to be, who it's going to serve. And so it's not going to be a soccer field like we have so much need for in my district because of the youth. This is more, I think, geared towards the folks that are going to be living near it and for them, vulnerable populations. I just love that it's native plants, because unless kids are going to play on, or adults are going to play on lawns and grass, so much better, I think, to have native plants and to be a demonstration garden for what those of us who can have in our yards instead of lawns, which are in many ways useless unless, again, someone's going to be playing on them. So I think because of the unique nature of this park and who it needs to serve, will serve, I will support this. And yes, I'm looking forward to hearing more details, but I support, and I would, at the appropriate time, move the agenda item.
Thank you. And I'll note that the rain shelter does have a little play area for the children in that facility, and I know Casa Pacifica has a ball field in their area. But the connection with Growing Works is important because it helps the job training abilities of the clients who work there, so that they can learn not only how plants grow in pots, but also in the ground. And they will also use the gardens as a seed bank and for cuttings for the nursery. So it's all very much connected to the Growing Works program. And then if we do have the availability of Mr. Sasic or Mr. Chisholm, if they can talk about where they got the figures. And I don't know if you have that available to put up on the screen.
Coulter, go ahead.
Thank you.
Okay. Good morning, or we're just in the afternoon, Chair Parks. So yes, thank you for the opportunity to speak on this. I'll just speak first, and then if it's useful, I can share the details. What we have, we did a concept estimate off the concept drawings that you all saw. We did put in a little, some funding to finish the design and to delineate boundaries between the park managed land and delineate circulation paths, make sure we're meeting Architectural Barriers Act requirements, get irrigation in. It will be a primarily passive park, but there are some details that we speculated on that maybe gates may be needed, and if not, the park host concept could be looked at. But I think a lot of those details would be clarified in a traditional design process, and then we could finish implementing the park. A general statement about the estimate, it's about right. I'll just say that for what I understand. The details not looked at. There is some dry utility easements that may affect some of the planting schemes. You know, the normal kind of details you get through in a design process that we can clarify. Let's see what else.
Did they design it with ADA standards? Kenny Grove is going through a lawsuit with ADA. I have not been able to see this plan, so I am just wondering if that ADA, if we're going for more needs and so forth, is that taken care of? Because I'm thinking that the surfaces have to be different. Does there have to have a bathroom? So I'm just needing to know that information.
Yes, I can. A couple things on it. So that at this design level, at a concept design level, we wouldn't have claimed we've achieved all the Architectural Barriers Act guidelines. I think the next step of a design could make sure we're getting those. The key pieces on there, the DG that was used wasn't a spec gradation, so those will probably have to be redone a little bit. That pricing's in there. And then delineate the other decent size item that's not in there is the public parking as it's delineated from the administrative parking. The administrative parking, they have different requirements for access. The public parking has to connect on an accessible route to the pathways. That's achievable, but it's not in the current design. The current design was the concepts that I did the takeoffs from, was the sketches that were shown. So that I would call that a 10%, using, it's a normal way civil engineer we talk about, that would be a 10-15% design, and we would get all the access stuff configured in the next phase, the 30 to 50% design phase?
So the reason why I ask and I bring this up is the designs look really good and the concept we can price out, but based on the state laws, public parking, if it's ADA, we've had those in my park issues where the cost went a lot higher. And so when I'm seeing this as an estimate, I'm thinking, what is this? This is going to be 2 times, 3 times. You know, and that's where my concern is, because this is general fund dollars going to do this versus we have an enterprise, which I know is normally maintaining the fees. So you're saying it's 51,000, but if we don't know the actual redesign based on those needs, this is like, to me, is not the final cost for the design. So that's where my questions come from.
So yeah, referencing Kinney Grove Park, I believe.
Yes.
So for the audience, we had we took over a park from a lessee 2018 and had it's a hybrid campground and day use park that had a lot of years of piecemeal construction rather than a design, and we had a lawsuit that's kind of in the 30-year payback, 25-year, 30-year payback based on the lack of access. You know, it was universal. It was details. You know, door widths on the shower facility and access to the playground. Things that have been in place for many years, but when the county took it over, there we did get hit with the lawsuit that we are managing through. So that those things can happen. The main thing that you have to do to prevent that is have a design phase before the construction. For a lot of parties, it feels like a lot of the park is constructible in a design build fashion, but you leave yourself vulnerable to the universal access requirements.
In this case, this is like a pocket park. It's not bathrooms, it's not showers, it's not campgrounds. So it's something you can control more in terms of the accessibility issues and the barrier issues. And you feel confident that the money that you are saying, the 280,000, will take care of the design as well as getting the park built with the issues of accessibility taken care of. And again, it's these paths. It's the paths through the garden, and from the cars to the garden. So those are all part of the cost figures.
Are they?
And I would just add to the amount of money for maintenance can be significantly reduced if we have a park host. And I think that is something that we're looking at too, from that kind of synergy that we get from the whole site. If we had someone on site living there, that could also help with security as well as maintenance. And I think that is something we should definitely look at providing in the future. But that right now, it doesn't include the park host, but may well in the future. And I have to say too that this is done in concert with Growing Works, and that is the volunteer program. And we have had lots of volunteers, and not just county, that have assisted already. The Naval Base Ventura was the one that helped us build the labyrinth. We've had lots of volunteers, and I could go on for a while, but I don't want to take too much time with this item. So do we have any other supervisors? Supervisor Ramirez, your hand is still up. Thank you.
Oh, nope, no more questions. I'm ready to make a motion.
Could Mr. Chisholm clarify, is those costs of the parking and so forth included in this estimate?
In a speculative way, the cost of parking, assuming it was something of the 8 spaces in the front of the building without a hardened surface, was what was included.
Sorry, Supervisor LaVere.
Okay, yeah, thank you. I had a few questions. It was mentioned the mini mansions project, and I was curious if we had any conversations with them about a potential partnership in this, as this is clearly something that would benefit their project. And have we had those conversations?
If I may, the Many Mansions Project is, again, you're talking about another nonprofit whose goal is to provide affordable housing. And in this case, it's also affordable housing for a population that needs to have care and treatment. So that's what their goal is. Turning Point's goal is to assist people with mental illness. Rain Shelter's goal is to, house and provide services for people who are, otherwise homeless. And, so each one of those are nonprofits working to take care of a population. This is our county's investment in something that's not just for those on site, but also for the community in general to be able to come and enjoy. Lewis Road is a very popular road. It's taken to the beach and all that. People could stop and enjoy the gardens also. There is a potential for another development in the back. And if that comes to be, and it's not a nonprofit doing it, there's a possibility that they can assist. And where I can see that assistance would be helping to get the use of the reclaimed water up and going for the entire 50-acre site. So there are certain things that we can do if we do get a private developer on that site. But right now, all the entities in there are entities that are providing assistance to vulnerable populations.
Thank you. And
yes, I wouldn't think we would ask Many Mansions to help us build a park.
Now, I guess and again, I think big picture conceptually, I support this project. I see all of the benefits. I think they're numerous. I just want to make sure that we have the details. Just in terms of transparency, I think it's important we talk about some of these. And now, I guess one thing because there was no kind of breakdown of costs and kind of a final design, I guess one of the questions I had was, is this money needed to kind of complete some of that work? Coulter?
Yes, so again, speculating on some of the things, we put in about 70,000 of the 280 was to get a final design. Okay. But it kind of hitting in between the questions, I wasn't trying to be missing. If the parking's chosen to need to be larger, then the costs aren't, if I've assumed incorrectly on some of the parameters, or if there's, you do tend to run at general land management challenges with when you have easements, you may have to alter your design some, so we don't have certainty on some of those things, but it's the nature of the park should be very likely could be molded within scope to still meet the passive park demonstration garden if all parties agree through, remain in agreement through the design process.
And it's that passive designation that gets us out of some of the other requirements that are normal for parks, bathrooms and whatnot.
Well, I mean, the requirements, pocket local parks, a bathroom, the layering is, if you have a park amenity, you must provide access to the amenity free of architectural barriers for universal access. So what that means is, since you have the demonstration garden and pathways, you must have parking, signage, and pathways to connect. There's discussion of picnic tables. Once you put a picnic table, they have to be accessible on the route as well. So there isn't a requirement to have public bathrooms, but if you do, they must meet the requirements. So if it's chosen later, we need a bathroom there, that's going to be a different cost and approach, but as it lies, it's not required to have a bathroom.
And I kind of appreciate Supervisor Long's line of questioning about details, and I just want to make sure we get there. And I get my overall kind of thinking is more money needed. That's part of this to get those details, because I do think it's important. And when we do allocate, close to $300,000 in general fund money plus ongoing costs, that there's, the public was able to see the details where that money's going. And is it too soon to have all those details? Is that kind of why we're doing this now, to get the funding in place where we can start working towards that information?
And I was also wondering if you could share your screen and show the, I'm sorry that the concept cost estimate was not part of the report, but it does exist.
Let me get this going here. I do have it up. Are you seeing it?
Yes.
Yeah, so this is the this was a version I did that the water filtration was taken out, so you can see me live right here, 0 this cost and 0 the design cost here. That gets us to the 280 number. So you're seeing construction drawings for the irrigation and landscape and planting, construction drawings for the parking access and signage, and then acknowledging on my walkthrough out there a few weeks ago, there was some non-compliant elements that would need to be fixed. 98,000. Again, we zeroed that one. And then this is construction costs for the parking, signage, gates, and picnic area 50. Park irrigation system. This, knowing it's native plants, you still need to irrigate, especially for at least the first couple of years, and then this wouldn't be as needed, but you still have to build it. And then some just a little bit of overhead contingency. If we did run into CEQA, if we had anything that triggered CEQA or another sort of land management challenge, that's not included. And then the annual cost, we went kind of for our lower dollar, similar size park. We don't have a park exactly like this, but we don't really have any, that operate much lower. Our other lowest cost operating parks, Waring Park, excluding the skate park, and it's 43,000. So that's kind of where that came from, and then some exclusions. So that's, this is I would call this a Class C design cost estimate. So that's a normal way to do business, whether it's a time to approve it now or do a design phase and approve later. That's obviously up to the board and the public, but we're here to do to help as best we can.
And they have already connected the pipes too, so that it's not going to be an extensive problem in order to get the irrigation out there, because it's already in the ground.
Here, Chisholm, on your list, it shows that insurance is not included or lawsuits, claims cost. So no lighting, that's not in there either. I'm just, if the reason why I ask, if this design from Growingworth, they gave it back to us because it was too much. And I just heard Supervisor Parks talking about them planting more plants in that land. How does that working relationship going to be for the Parks Department working with growing grounds? Do we have liability if they're planting on that property? I just asking because I want to get the full picture of what's going on.
And we did actually have volunteers that planted Santa Rosa Park too. So it is something that we've worked with volunteers in planting in the past.
Yeah, so if we have volunteers planting, we have volunteer forms where they become insured under us. This was just a kind of a brainstorming list as a useful way that when you're doing, let me just state it this way, when you're doing cost estimates for final construction drawings, they're pretty certain. The quantities are certain. Everything's known for 100% sure. And so you, anything that's less than a full and final design, this is a normal way you just disclose what you didn't include. So with parties, you can say, oh, well, we want to cover that or not. The insurance is probably very manageable. The lawsuit or claim cost, that's, the Kenny Grove one, we're having to figure out how to fund that out of our enterprise fund. So that one is just worth disclosing. And then the lighting and future improvements, those just tend to be a disclosure for if someone decided you wanted, let's pick something, covered parking or evening hours and lighting. They weren't part of the original design. If you see my concept statement for the construction, it's there's not a lot, so it becomes useful to just guess on things that people may not, that may, the next group working on it in 10 years when it's built and running may want some things, and it's useful to have record to know what was funded under the 280 there.
Thank you for the clarification. Thank you. I understand that this isn't final.
Okay, are there other questions on this?
No, Supervisor Parks, I'd like to move the recommended action, unless you have a proposal to bring this back with more details.
I think these are the figures that we have. I think $280,000, quite frankly, is very reasonable. I'm on the Santa Monica Mountains Conservancy. We build parks in low-income areas and disadvantaged communities. That is really one of our thrusts on the Santa Monica Mountains Conservancy. And I really see this as, because it's small, because it doesn't have the picnic tables and the bathrooms and all that, we don't have to have the same kind of expenses you usually get with projects like this. But I think this can really be the synergy for the site. And as I say, enjoyed by the people who live there. Right now, just the way, if you just leave it be, it just becomes like, a weed covered lot. And, we can go out there occasionally and take care of the weeds, but why not make it something that can improve the quality of life of individuals who, quite frankly, have a pretty rotten quality of life right now? So I see this as nothing but positive for the people, for the environment. And, it's just something about the county and our respect for those individuals that live there. So I really like the idea, and being able to expand the set of the people who work at Growing Works. I think that also is a huge benefit, as well as giving them the ability to have the, the seeds as the clippings to grow plants in the nursery. So overall, it will be easier to be a profitable nursery. So I just see a lot of positive and appreciate, the detailed look. But as I said, I've been in, elected office, being able to do things where you are providing funds, but to provide funds for something that is actually there on the ground, the books in the library, the road, so much of what we do often you don't really get to see. This to me is something that I have no qualms at spending $280,000 for something this lasting and beneficial. So yeah, if you'd like to make the motion, I certainly would second that.
I will make the motion. I think it's unique and valuable and worth the investment. So I move the recommended action.
Thank you. We have a motion and a second, and could we have the roll call?
Supervisor LeVere.
Yes.
Supervisor Long.
It is a no, based on needing more information.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. Thank you. And thank you, board members. And I know we'll enjoy being out there for the ribbon cutting, and appreciate your support for this, as will others. With that, let's go on to our next agenda item, which is item 32. And this is my request that we appoint Mari Rojas Cortez to fill the vacancy on the community, as our community representative on the local planning council. And with that, I'll go ahead and make the motion. She is a professor at Cal State University, Channel Islands, and I think she'll be a great fit. And Supervisor Huber, did you want to make the second?
Yes, second the motion.
Thank you very much. We have a motion and a second. Could we please have the roll call?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you. Now let us go to item 33, and this is a recommendation of Supervisor Long.
Thank you very much. I am requesting the reappointment of Janice Gardner to the Behavioral Advisory Board. She has done very well, and also for Gordon Kimball for the Agriculture Policy Advisory Committee. Both are reappointments. So I will make that motion to approve.
Huber, second.
We have a motion and a second. Could we please have the roll call on this?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes, she's great.
Chair Parks.
Agreed. With that, it is passed unanimously. And now, Supervisor Huber, you have item 34.
Yes, I would like to recommend Jason Flame for appointment to the Waterworks District Number 1 Citizens Advisory Board. As a resident and small businessman, I think you'll be an excellent addition. I would move approval.
We have a motion
I'll second.
and a second for Supervisor Huber's appointee. Could we please have the roll call?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Yes.
Chair Parks.
Yes, thank you. And I believe that concludes part of our regular agenda. We still have some other public comments we can go to, a correspondence agenda. How about we do the correspondence agenda, and then we'll go from there to public comments. Do we have a...
This is long. I'll receive and file the correspondence on number 40.
Okay, we have a motion for the correspondence agenda. Do we have a second?
Huber, second.
Thank you, Huber. Supervisor Huber. Could we please have the roll call?
Supervisor Levere,
Yes.
Supervisor Long,
Yes.
Supervisor Huber,
Yes.
Supervisor Ramirez,
Supervisor Ramirez. We
Yes.
yes, on the correspondence agenda.
Chair Parks.
And that's a yes for me too. And now we have some time to get to our public comments now. I believe we have some on Zoom, and also we have some on that will be read. So for our Zoom comments, let's see who we have teed up first.
Who is it first?
I'm seeing that we have 5 people who are desirous. Danielle Wisniewski.
Let's see who's first.
Okay, and now if Danielle is not there, we could go to Jake Donaldson.
Supervisor Parks, it looks like possibly Brian Toledano might be first.
I'm
Okay.
here. Can you hear me? Hello? You guys can hear
Yes.
me, right? Great. So my name is Jake Donaldson, and shoot, it just, okay.
Supervisor Parks, how long would you like to give them?
I have 3
3
minutes.
minutes.
Okay. I'm a family physician here in Ventura County. I completed my training at VCMC in 2012, and I'm now a primary care physician in Santa Paula, where I serve as the lead for the Pride Clinic, which serves the county's LGBT community. In addition to my clinic, I work in the HIV/AIDS specialty clinic, and I do nighttime hospitalist work in Santa Paula. I wanted to bring to your attention that 2 weeks ago today, the HCA, or Healthcare Agency, sent out an email stating its plan of putting together something special for our doctors, by which we were flattered. It meant a video to share with you all in celebration of Doctors' Day later this month. That same afternoon, however, the county presented its proposed contract to primary care physician leaders as it works on its integration plan, stating its intention to make us see 20% more patients with fewer support staff and to cut our salaries by 20 to 40% to numbers that are significantly lower than national or even regional standards. This comes in the wake of a round of budget cuts only 2 years ago that has already made it much more difficult for us to care for patients effectively in the county system. And I can name plenty of examples, including the loss of time with our patients, loss of our much loved, in this clinic, the loss of our much loved LGBT therapists, and the loss of a case manager to help our patients navigate the complex healthcare system that we all know we live in. These proposed cuts also come in the middle of a pandemic that has left many of us frontline healthcare workers running ragged. When authorizing pay scales for administrators and executives, I know that there is a strong belief among county leadership that we get what we pay for. While I do not agree with exorbitant salaries for our executives, I do believe that we get what we pay for with respect to county employees in general. If the county truly does desire to follow its own mission of recruiting an exceptional workforce, and that is in the mission statement, to care for a diverse community, especially those facing barriers, also in our mission statement, and what many of us physicians feel passionate about, it's why we're here, then it needs to invest in the resources to do so, including in the primary care clinic system, which is really the front line. I think that's all I have. Thanks for your time.
Thank you very much, Dr. Donaldson. Let us go to.
I just want to add that many of the physicians are currently strongly opposed to the proposal as is right now. So I think if Mr. Powers or Mr. Foley are stating otherwise, I would really encourage you to reach out to the physicians to get their opinion directly.
Thank you, Dr. Donaldson. Your concerns are noted.
Thank you very much. I just want to say thank you for your speaking today. I know that as the Ventura County Medical Center Oversight Chair, we are in discussion, so I appreciate your comments.
And also your service, particularly in these more challenging times. Dr. Todd, I'm assuming, but Brian Toledano?
Yes, I'm here. I am trying to connect the video. Can you guys go ahead and hear me?
We can hear you.
All right, 1 second. Technology is always great.
It's been one of those days for technology for us too. So
right.
If you can hear your video, that would be good. But we can hear you regardless. So if you can't turn it, there you go.
There you go. Were you guys able to see me?
Yes, thank you.
Great. Thank you, Madam Chair, and thank you, members of the board, for meeting with all of us today for public comment. I wanted to briefly touch on how Mr. Mike Powers and the rest of the board has brought up that March marks the 1-year anniversary since COVID-19 became a household thing to discuss. 895 deaths, 78,271 cared for, 1.1 million tests performed. Healthcare providers are the ones who cared for all of those people. They were the ones who helped those 78,000. They were the ones that helped those 1.1 be resilient and become tested and feel safe in the fact that if anything should happen, they were going to be taken care of by some of the best in the medical community. You should have been provided copies of over 20 letters and comments from your county healthcare providers. These same healthcare providers are the ones who helped all of us, including those frontline heroes for the vaccine rollout, as Ms. Gonzalez mentioned a couple hours ago. I saw doctors go out in the field in the ag community. They educated. I saw doctors join the John Flynn vaccination site to dedicate their own free time to help out the community that was underserved and vulnerable. I know this because I drove those same doctors because they needed to carpool. Every day, 24 hours a day, 7 days a week, these people cared for everyone at every moment of their lives. Recently, I became aware of the proposals that the negotiating team from the HCS proposed. It increasingly became apparent that they sought to fix a budget deficit by paying an outside consultant agency large sums of money, but also forcing a reduction in support staff. Further investigation shows that when providing a report back to you, the board, the details are often omitted. Last week, you were told by the CEO that all of your doctors were on board and excited for the transition. I imagine it would surprise you that over 70% of the county physicians from all the ambulatory clinics are opposed to the current plan. Not just opposed to the shameful treatment they're being asked to endure, but more opposed to the disservice they're being asked to do to their patients. The doctors, nurses, and staff are the very same people we expect to care for us in our most desperate times. We call them heroes when it suits us, yet now these same heroes have asked for our help. I'm here because I want to help them. I'm here because I remember all the moments they sacrificed for us when we asked them to. I'm here now to ask you to remember those moments. Remember that the best public benefit lies with a strong, successful healthcare system. I encourage you to start a dialogue with your county doctors, like Supervisor Levere has already done. Thank you for your time and consideration in these matters.
Thank you. Thank you for your comments, and I do appreciate them very much. We also have Danielle Wisniewski.
Hello, can you hear me?
Hello. Yes, thank you.
Hi. Thank you for letting me speak. I just wanted to introduce myself. I'm Danielle Wisniewski. I'm a family doctor at Santa Paula West Clinic, and I did my training in Santa Rosa, California, and I came here about almost 2 years ago to do the Maternal Child Health Fellowship in Santa Paula, which was wonderful. And I decided to stay on at Santa Paula West Clinic coming after my fellowship. I also I had a baby in between all of that. I have about a 6-month-old. And I decided to stay after fellowship because I cared about the community in Santa Paula. I enjoyed working with the patient population, and I really enjoyed working with the staff at the clinic. I also appreciated the opportunity to do full spectrum family medicine and obstetric care and deliver my own patients, which is important to me. I was also able to negotiate a contract that worked for my family and for me, including letting me work part-time, getting to raise my son, which is really important to me. It also carved out time for me to deliver my own patients, and which I also enjoy. And how do I make it work every day? It's not perfect. Imagine seeing a patient who hasn't been seen in a couple years, that you have a 15-minute visit to see them. They come in with their 10 medical problems, and you try to figure out what are the 5 most important. And the only way to do that in a 15-minute visit is to rely on your staff to help you, your pharmacy specialist, your CPSP worker for the OB care, your MA, your LVNs. And it's obviously not perfect. The way I see it is that there could be some improvements to make things run more smoothly and help get more resources for our patients. And when I hear that the idea of the part of the proposal is cutting staff, and we're expected to see more patients on top of that and getting paid less to do all of that, I think, why would I stay? Why would I stay in this job? And this year has taught us more than ever the value of science and good medicine, and that doctors are just people who have our own families, our own mortgages, and our own student debt to pay. And the proposal set out incentivizes us to spend less time with our patients, unfortunately, when we care for the most vulnerable and the sickest population. In reality, in order to do our jobs, we need the resources to improve the health of our patients and provide these communities with more opportunities, at the same time as feeling valued ourselves. Thank you.
Thank you. Thank you for your comments, and appreciate your service for the county on behalf of all our citizens. And now Stuart Bussey.
Yes, can you hear me?
Yes, we can
Hello?
hear you and see you.
Okay. Distinguished members of the board, thank you for the opportunity to speak today. My name is Dr. Stuart Bussey. I'm a board certified family physician of nearly 40 years and president of the Union of American Physicians and Dentists since 2006. That's approximately the same time that our union began organizing the Ventura County doctors. But my admiration for the healthcare system of Ventura started way back in 1978 when I applied for a residency, family practice residency. I wasn't matched there. I went to UC Irvine, but I knew that the Ventura system was very deeply committed to the community that it served. Now, as I became involved in our union, the UAPD, and I helped negotiate dozens of contracts with other counties and public entities, I witnessed collaboration between our public employers and our doctors, which was consistent with our union's mission statement that we nearly 50 years ago in 1972. And here's our statement. I want you to listen to this because I want, the synergy between the employer, the public employer, and the union is involved in this. We physicians and dentists, in order to provide optimum medical care for the people, to ensure quality facilities, and to enable doctors to give of themselves unhindered by extraneous forces for the welfare of their patients, do establish this union. So it's a covenant that we have, performed with various counties across California. We want to do the same thing with Ventura. Now, in the past few years, the UAPD has answered the call for unionization by many physicians in the private world, the corporate sector of medicine, and it's very different. By and large, corporate employers have not shown the same commitment to their communities and to the physicians as have the public and county systems. They have drifted to assembly line production, cost cutting, and a bottom line mentality. Now, we're hoping that Ventura County will continue its longtime commitment to the community as it morphs into a solo public employer. Ventura County's patients and their physicians deserve this. We look forward to working with you towards achieving a just and a fair contract with our members. Thank you very much.
Thank you very much, Doctor, and I appreciate also your good work on behalf of our clients, our patients. With that, I think that's all the, am I seeing one more? Rachel Flores, are you also speaking on this item? Ms. Flores? Yes, I think we can see you. Do you have your mic off and you can go ahead and speak? Okay. We are not hearing you, unfortunately. Okay, so we'll hold on Ms. Flores or Dr. Flores and go on to, I see Kapana Kapadia. Did you want to speak? And if so,
yes,
this is your time.
This is Dr. Kapadia. Kalpana Kapadia is my mother. She's actually feeling ill, so I wanted to speak on her behalf and for myself. So we're here today to demand a call of action for our county. It's our duty to fortify our own house so that we may be a house of refuge in times of unprecedented uncertainty and times of need. Now, in this time to plot and strategize, organize, and mobilize. It's a time to hold our elected officials accountable. You guys represent Ventura County, and this affects each and every one of you and your constituents directly and indirectly. As a proud citizen of Simi Valley since 1992, I know how impactful this city and county can be. I know that in times of need, we as a community have always risen above and beyond our own means to make sure we take care of those around us. It is with that same resolve that I need you to see what is happening directly in your cities and our county. Ventura County Healthcare Agency is taking over our 18 ambulatory care clinics on July 1st, 2021. As you are aware, these clinics are the safety net for our county. For many of our citizens that have lost their job during the pandemic and during these unprecedented times, Ventura County HCA has proposed primary care physicians see up to 14 patients for a 4-hour period. That amounts to less than 5 to 7 minutes per patient. As our county's safety net clinics, a majority of our patients are complex and have quite a few chronic medical conditions. Now imagine seeing your doctor for 5 to 7 minutes and trying to improve your health and receive quality medical care. As a physician, I work for the county because I love my patients and my community. I am here to help those in need to get the most that we all get, which is the same equity and equality in healthcare. I implore you to see the value we add to our patients and this community and your constituents, and not give in to the so-called financial pressures of the HCA that is claiming. We have done everything that the HCA has asked us to do, including saving the HCA millions of dollars over the past 2 years while maintaining the higher standard of quality of care, increasing productivity via seeing more patients, and all the while the clinics have been blamed for the HCA's fiscal irresponsibility from poor billing practices. Most of our doctors are on the verge of burnout, and it's been pushed to the brink with the recent COVID-19 pandemic. And decreasing support, decreasing salary, and increasing work will push away providers who have invested decades into the system, only to have further pay cuts, loss of health benefits, accumulated time off benefits, and fleeting promises of a pension that we may never really see benefits from. We doctors want fiscal responsibility, and we want fiscal responsibility within our healthcare agency, and we'll continue to work hard to take care of our most vulnerable patients, but to increase our workload while being asked to significantly reduce our salary and benefits for those who have put decades of service and commitment to the underserved will impact our workforce, make it harder to recruit and retrain doctors.
Right now, but do thank your mother and very much appreciate your comments, and please let her know we appreciate her good work for our county patients. Our next up is Lucy Garys. Go ahead. And you are muted, so please unmute yourself. There you go.
Hi, do you hear me?
Yes,
do you hear
ahead.
me? Okay, thank you. So the honorable members of Ventura County Board of Supervisors, my remarks, as you imagine, are related to my colleagues' remarks as well. So please allow me to share my background with you. In 2000, I came to this country with a suitcase and hopes. I didn't speak English like many of my patients. I worked while studying, and I had a medical as most of my patients. Now, as a family physician, I am happy to give back to society and the county system, which is so dear to my heart. I serve patients with private HMO, PPO, Medicare, and Gold Coast insurances. Please tell me what can be better proof of high quality care and equality than the diversity of our patients. There is no doubt in my mind that this proposal, I will lose most of my PPO and Medicare patients. This plan threatens the core of excellence of medical care provided in Ventura County. Volume maximizing culture leads to rush visits, wasteful practices, and high rates of clinician burnout. We do have a team of hardworking professionals who dedicated 5, 10, 15, or more years to Ventura County. This is a great chance for Ventura County Healthcare Agency to acknowledge their loyalty and grant them with well-deserved benefits in recognition to their seniority. The doctors do not feel safe now during this transitional period. The primary care providers feel scared and intimidated. The proposal removes the solid ground underneath their feet. Nobody can build a prosperous business on shaky foundation. It might seem like a good idea now to hire all physicians as a new employee to save on benefits, but it may backfire. Research proves that patient satisfaction related directly to relationship with a doctor and low rates of malpractice and lawsuits. You can build this relationship only with a reliable physician and encourage those who have endured their time through working in Ventura County healthcare. The people of Ventura County deserve patient-centered, high-quality care to meet their needs. Thank you.
Thank you, Dr. Gary. And that is exactly what we want, the high patient care and great doctors. Our next speaker is Rachel Flores. Are you able to unmute yourself?
Yes, I'm here.
Go ahead.
Yes, Honorable Chair Parks, Supervisors, and CEO Powers, good afternoon. My name is Rachel Flores. I am with the Union of American Physicians and Dentists. I serve as the chief negotiator for the 100-strong physicians who have organized to join UAPD. Chairwoman Parks, this morning you opened the session recognizing March as Women's Month. The sacrifices, contributions, and footprint that women have left on our society. Along with Women's Month, in March we will also celebrate Doctors' Day on March 30th. we will celebrate Cesar Chavez's birthday on March 31st. A month filled with tributes, celebrations, and appreciation for a diverse group of heroes and dedicated servants. Early on in negotiations, around February 11th, your representative explained to the UAPD team why the county was classifying physicians as non-classified at-will employees. The reason we were told was because of the sensitive nature of their job and the important and critical work they perform. Although not verbatim, it was said, if we believe a physician is not performing their work, it will be easier to terminate the physician under at-will status. This set the tone for the table, creating alarm and disappointment. Since then, the county's position has changed. But the seed of mistrust was planted with that comment. Today, I ask that you take the necessary steps to repair the relationship by honoring the dedicated 100-strong physicians who, throughout the challenges Ventura County has faced, have demonstrated their commitment. A commitment to serve, a commitment to go above and beyond, a commitment to provide the best care, and in the time of pandemic have stepped up to the challenge. They care for the most vulnerable, underserved, and set aside populations. We believe health equity is a human right. What is your commitment to the 100-strong physicians and those they serve? Thank you. Have a great day, and God bless you.
Thank you, Dr. Flores. Our last speaker is Martin Flum.
Yes, hi. This is Sheila Flum. My husband was gonna. Can you hear me?
Yes, we can hear you. Go ahead, Ms.
Okay,
Flum.
great. Yeah, he was going to speak for me because I anticipated that this would be earlier this morning, and I was in the middle of seeing patients, and so fortunately, I'm able to talk myself. Madam Chair and County Supervisors, thank you for hearing our comments today. I've had the pleasure of being a Ventura County family physician at Sierra Vista for over 16 years. Since 2004, when I completed my residency, I, like many of my colleagues, have been absolutely committed to the county mission of providing excellent health care to our most underserved county patients. In this role, I've had the pleasure of building deeply fulfilling relationships with families longitudinally. As family physicians, we have the ability to care for the entire family in their greatest moment of need. This is a privilege I truly cherish, and this is what I really fear is in danger of being taken away by the recent proposals from the healthcare agency. I'd like for you to imagine for a minute that after working 16 years in your current position, you were asked without time to prepare to reapply for your job, and then without even being told what the stipulations of that position would be. And then being told that you could possibly be faced with a 30 to 40% cut in salary, and wonder how are you supposed to support your own family? The current proposals being put forth by the HCA completely undermine and undervalue our contributions to the health of the residents of Ventura County. Perhaps even more importantly, by undervaluing the providers and staff, the message is clear. Underserved patients do not seem to matter as much as wealthier patients who are able to pursue care outside of our county system. I'll tell you that my colleagues, all the people that you've heard speaking today, do not accept this message that is being sent loud and clear by the HCA and their consultants, ECG. If instead, I'm asking you, for the members of the Board of Supervisors, that you want to send our county patients messages that say, your health matters, that we will prioritize the working conditions of the providers and staff that are responsible for providing what has been, if I may say on behalf of my colleagues, excellent care. And yes, we realize that we cannot continue to provide excellent health care in the setting of severe county financial stress. The remedy for this is to properly and adequately incentivize providers and staff to meet quality metrics and volume standards. All of us at Sierra Vista, and I might say Magnolia Clinics, especially would highly encourage you to draw on leadership and experience already within your system from providers like Dr. Stanley Patterson, who have for over 20 years proven themselves exceptional.
Thank you for your comments. That was our limit for each individual speaker, and very much appreciate hearing from our doctors. So appreciate the good work that you do and your desire, which is the same that we have, to ensure quality for our patients. So thank you for providing that, and I look forward to having some very productive negotiations. So thank you for your comments. I know we also have several written comments, so I'm going to turn it over. I believe Martinez will be doing the reading, so let's listen to those. And I also believe we've received these written comments already too.
Thank you. Good afternoon, Chair Parks, board members, and CEO Powers. The first email is from Laura Harmon, and it says, Dear County Board of Supervisors, I have worked for the Ventura County Healthcare Agency both as a contracted physician and per diem provider at the urgent cares in the county system for nearly 20 years. I find caring for the vulnerable population served with these practices very rewarding. I've spent the last 3 years directly evaluating and treating COVID patients in addition to caring for the homeless and immigrants and hardworking residents of our county. Despite this commitment to the community, my position is in jeopardy. Years of experience and loyal service are being rewarded with cuts in salary and benefits that would make it difficult to continue to work for the healthcare agency. Additionally, the staffing cuts make me feel that the quality of care can be provided will be compromised. The HCA has not been communicating their plans with the doctors. Negotiations with the union have felt adversarial. I urge the Board of Supervisors not to approve any HCA plans that are not supported by the physicians union. This email is from Sonia Ariano, and it says, plead that you don't approve the county's proposal to implement cuts. With the severity of cases and the socioeconomic issues that patients have in the county clinics, the proposal will negatively impact the patients, decreasing the quality of care to the most vulnerable. The complexity of cases and socioeconomic problems in the patients vary from private practice to community clinics to county clinics. In private practice, we frequently encounter children with stable families and stable incomes and good socioeconomic situations. This is normally accompanied by patients with few ailments and minor psychological problems. Parents that are committed in all aspects to the well-being of the children and the parents can provide well for the children's necessities. From my experience working in private practice, usually the patient encounters are short and simple. On the other hand, community clinics like Clinics del Camino Real are busier with the patient population, has greater socioeconomic problems. However, since Clínicas del Camino Real is not affiliated with a hospital directly, VCMC, they see much less severity of disease, syndromes, psychological problems compared to the county clinics. The county clinics work very closely with CHLA, and the clinics receive all severe cases that our regional hospital manages, resulting in many of the most difficult cases in the county being followed at our clinics. Our clinics not only see the extremely complex patients, but also the population with the most difficult socioeconomic situations. Approving this proposal will take time away from these patients, forcing our quality of care to be diminished. Thank you very much. I'm sorry, I'm getting at this email. This next email is from Pamela Holbrook, and it says, I'm writing regarding the HCA plan to integrate the ambulatory care clinics as of July 1st, 2021. I am a board-certified family practice physician with 22 years of experience working at Conejo Family Medical Group for the past 19 years. I am dedicated to serving the healthcare needs of our community for primary care, in-hospital care, and currently in our urgent care. Throughout my experience in the clinic and the VCMC, I have worked with numerous patients to achieve better health. During this past year, I have been examining, testing, and treating patients who have symptoms consistent with COVID-19 outside of the clinic building in order to continue patient access to medical care in our community. Unfortunately, HCA's integration plan leaves me uncertain of my future with the agency. There is no transparency of the details of the plan, and all of my information has come through limited information updates from the Union of American Physicians and Dentists, the UAPD. I have been informed HCA is preparing to offer a substandard salary. I will be considered a brand new employee and employment benefits have not yet been disclosed. HCA is further treating to open applications for physician jobs whether or not we have an acceptable contract as of April 1st, 2021. This approach is counterproductive to the teamwork we need to take care of our community. As a physician, patient access and quality of care are my highest priorities. Working in the same location for 19 years I have served, and that is at our 250 word limit. And the next email. This is from Dr. Elizabeth Carlisle Kelly, and it says, Esteemed Board, briefly I trained at the VCMC residency program and I have worked in our system ever since. You need to know that the physicians in our system not only make less money than our colleagues in other county systems, we also do more. Because primary care is so broad spectrum here, we refer to less specialists and take on the burden of caring for more complicated patients ourselves. This saves the system money, but physicians are not necessarily financially rewarded for this. Primary care is a backbone of Ventura County medical system. If you appropriately compensate our primary care doctors, you will help ensure the quality of care and reduce the costs for the system as a whole in the long run. We are all overworked. We need more doctors and more support, not less. With appropriate support, we could be more efficient at meeting healthcare standards that keep our system afloat financially. You will not achieve this by cutting the salaries of the doctors who make the system run. Thank you for your consideration. And this email is from Richard L. Gardner, MD, and it says, to whom it may concern, I have been employed at Magnolia Family Health Clinic, Urgent Care, since September 2009. I have witnessed quality care provided to patient population whose demographics involve a majority of low-income families, workers, etc. I have enjoyed my 10 years and recognize that we provide a valuable service to the community which would only otherwise not receive adequate primary care. I have witnessed other medical groups attempt to resolve excessive overhead situations with severe cuts which lead to the demise of our medical group, Anacapa Group in Camarillo. The result will be that the emergency care will become the default source for primary care with a significant increase in cost. The next email is from Lisa Salinas, and it says, I'm writing to express my concern regarding the recent announcement that beginning July 1st, we will be required to sign new contracts. These new contracts apparently include 20 to 40% pay cut and ramp up the number of patients we are required to see, all while our staffing levels are being cut and the staff that remains is being offered substandard wages. I worked for the Ventura County Healthcare Agency for over 22 years. For the first 10 years of my service to the county, I worked without a raise and delivered babies, including by cesarean section, on my own time without extra reimbursement. I did so because I believe the mission of care of the undeserved, and I am passionate about educating and elevating the community that I serve. I contemplated leaving the system 2 years ago when the county threatened to close the Santa Paula Hospital OB unit. It occurred to me that my first allegiance was to the well-being of my patients, and I felt that I could be best serve the community by moving to a system that recognized that physician satisfaction played a large role in providing the highest quality care. My decision not to leave ultimately came down to the desire to provide continuity of care to many of the patients whose lives I have touched over the years. I am honored to say that over the past couple of years, I have done just that, and that is at the 250 word limit. This email is from Dr. Morag Day Scarency. And it says, hello, I am currently practice a pediatrician for Sierra Vista Family Medical Center in Simi Valley. 4 years ago, I moved to the area from the Central Valley and continue to work in the underserved communities, as has been my passion since my graduation from residency at Children's Hospital Los Angeles in 2011. As a National Health Service Corps scholar and scholarship recipient, I am thrilled to have been given a chance to join the Ventura County family to continue to serve the immigrant families, farm workers, low-income households, and foster youth and families. As a CCS paneled physician, I have been granted the ability and deemed to possess and know-how to care for the most serious of conditions from birth through young adulthood. Working as a pediatrician in FQHC, I have taken care of countless youth and foster group homes, accepted numerous babies from NICU born to parents with drug addiction and homelessness. I have cared for children from immigration camps from other states, written countless letters to immigration attorneys, custody hearings, and schools. I have fought for accommodations for our most needy kids with developmental delays, ADHD, and autism spectrum disorder. I have counseled high-risk teens and reproductive needs, teen safety, and suicide prevention. I have held hands of alien parents, consulted with hospitals while my kids were inpatient, and continued the best care of the most high-risk kids with cancer, bone, marrow transplant, and a number of congenital anomalies. And that is a 250-word count. The next email is from Dr. Renee Hook, and it says, my name is Dr. Renee Hook, and I have humbly served the county for 17 years. I have initially joined HCA as an urgent care physician at the Magnolia Clinic. A few years later, I traveled to care for the homelessness in Ventura, in addition to maintaining a patient panel at the Sierra Vista Family Medical Center in Simi Valley. This is the same clinic where I became acquainted with our current CEO, Mike Powers, for the opening ceremony. I remember relaying an inspirational story to him of a patient I was helping. She was a recovering alcoholic and had in turn begun providing others help in their struggle for sobriety. These moments have made my career both worthwhile and fulfilling. However, during this time, I have also witnessed multiple budget cuts and healthcare systems that affect patients I so dearly love. Lack of support, staff, and proper incentives to retain talented physicians has made county services an extreme challenge. The current negotiations between HCA has shown that I myself now am faced with a future where the past 17 years of service amounts to no security for my well-being. Currently, Ventura County physicians are often in the 10th percentile in terms of salary and benefits. I myself know of several colleagues who have left the system for greener pastures. In the end, the core group of physicians who have maintained their stay do so for the benefit of those patients that they have come to call family, and that is at the 250-word limit. The next email is from Lorena Sarawatari, and it says, the fake coronavirus. You need to open the county, the schools, businesses, and churches to full capacity because there is no COVID-19 virus where it was never isolated nor refined. There is no emergency. We do not need vaccine from the WHO or CDC have already said that COVID-19 is similar to the seasonal influenza. There was and there is no need for any RT-PCR testing. These tests are false positive and they can't test for COVID-19 because there is no COVID-19. You have launched a fear of disinformation campaign to terrorize the people so that they willingly give up their rights and freedoms. You need to stop lying to the people of Ventura County. Now, with the vaccine, you are making people believe that they will be safe from the virus and that you will open the economy, which you would not do. During the press release on Friday, March 5th, Dr. Levin promoted the safety of the Johnson vaccine, fewer side effects, and momentarily, but not in the long term. On February 24th, during the Camarillo press release, Rigo Vargas finally had the decency to state that 820 people in Ventura County died with COVID-19, aka seasonal influenza, not of COVID-19. The supposed pandemic is nothing but an excuse for powerful financial interests and corrupt politicians to precipitate the entire world into a mass unemployment, bankruptcy, extreme poverty, and despair. God will destroy evildoers. Repent your evil deeds and thank God. This next email is from Mark Nesselrode, and it says, County of Ventura Supervisors. Specifically, I am referring to my family being called extremists by Miss Supervisor Parks. We fly our American flag proudly in front of our house to show honor and reverence to those who fought and died for our freedoms while protecting our Constitution. I have also waved the same American flag at many of the Lynn Road overpass rallies. My father-in-law served proudly for this country in World War II. His daughter, my wife, escorted him in a wheelchair on Veterans Day to the rally at Lynn Road overpass under his U.S. Marine cap. I saw tears as he observed patriotism from his fellow Americans. A lot of people thanked him for his service that day. So I again question the language used by a sitting supervisor to characterize the people at Lynn Road rallies. So are you saying that the people that wave the American flag are extremists? Respectfully, Mark Nesselrode. And the next email is from Judy Bruce, and it says, The Medical Mafia's Corona Terrorism, Part 2. The PCR test plays a central role in the medical mafia's corona terrorism. When people see the word cases on the TV screen, they think that our world has now been hijacked by one of the single dreaded event, thousands of infected people. Nothing could be further from the truth. We often hear of active cases. What does that mean? If a person has respiratory symptoms, what's to say that they just have influenza or pneumonia? But instead, we are told these are active cases or COVID, and magically the cases of flu and pneumonia have all but disappeared from the county records for 2020 and into 2021. How could anyone have working brain cells not seriously question this anomaly? Clearly, what we have here is a case-demic. What is the relationship between the spread of testing and the spread of new virus? How do we know what we are experiencing in comparison to what we are assuming we are experiencing? One study in Austria found that an increased testing correlated with no surprised increased cases. Here's how the corona terrorism is deployed, a military term on the people. The medical mafia writes code. They encode virus and give them weaponized video game identity. In this video game, you lose all of your freedoms and you must display gratitude and servitude. Viral code trumps all other forms of politics. Nothing can counter it, especially not science, and the virus is also sweeping metaphor for the spread of misinformation, which means, and that is at the 250-word limit. And the next email is from Aaliyah Matthews, and it says, I am board certified family doctor, and I work for Las Islas Urgent Care in Oxnard. I have been proud to work with the mission-driven staff and the physicians at Las Islas for 4 years. We serve vulnerable, diverse, and medically complicated populations with excellent medical care and respect. I am proud of the many ways in which I have risen to the challenge of meeting COVID-19 pandemic head-on and providing vital services to our patients and community members. I am sad to say that I feel forced to look for other job opportunities, as I am very concerned that the HCA does not value my work and the work of my physician colleagues and staff. The HCA refuses to guarantee our positions after July 1st, has proposed steep cuts in physician salaries and staffing levels, and has refused to disclose what benefits will be offered in the new contracts. The HCA plans to increase patients' visits per day and penalize the physicians who do not meet these goals. The HCA is not being transparent, and the negotiations feel very adversarial. Physicians and staff are at the heart of service the HCA provides to our community. Currently, it feels the HCA views as expendable and enemies. We are in the midst of a public health crisis, and the HCA will have another crisis on its hands if it continues to deal with the doctors and staff in this manner. Doctors will, and then that is at the 250-word limit. And the last email is from Sunny Captain, and it's just a question, says, when can churches reopen? Thank you. And that is all of our public comment for this item.
Thank you for reading those. This will conclude our public comment portion of our meeting.
If I may, Chair Parks?
Yes, please.
Thank you. If I may, in accordance with Council's guidance on being brief, we would like to respond to our excellent physicians who've spoken here this morning. And so I'm going to ask Terry Cho to speak, and then I'll make a few comments because we want to make sure that the doctors know and everyone knows. Our goal, and healthcare agency's goal, is to maintain the stability and the long-term viability of our critical safety net and these wonderful doctors in our system. So with that, I'll turn it over to Dr. Cho. Okay, while we're waiting for Dr. Cho, if I may. Oh.
I'm sorry. I think I just had to be added. I hope you can hear me now.
Yes, definitely.
Hi there. Good afternoon, Chair Parks, members of the board, and CEO Mr. Powers. My name is Teresa Cho. Many of you know I'm a family physician. I also serve as the CEO of the Ventura County Ambulatory Care Clinics. I'd like to provide a few comments about the clinic integration and physician contract discussions. Like many of the doctors in our clinics, I came to VCMC to be trained as a full spectrum family physician. I pictured myself then treating patients with HIV in an urban underserved area or delivering babies in a small remote town. And what has kept me here for 25 years is a camaraderie with well-trained colleagues and our collective sense of mission to serve the most vulnerable patients in our community. The primary care physicians who found their way to our FQHC clinics come with this sense of mission. They are providing full spectrum care right here in Ventura County, and they've continued to do so during a pandemic that has presented us with unprecedented challenges. As the county works toward clinic integration by opening up staff employment under county, I want to clarify that the county is not proposing to make cuts in the number of physicians we hire. We need all of our dedicated clinic physicians to continue providing the care that our community needs, and county is bargaining to keep the same number of physicians that we have in the clinics today. We have proposed a simplified application process for current clinic physicians to become county employees. And while there is a hiring process as required by the county civil service rules for all county hires, the county will try its best to keep it as painless and streamlined as possible so that we don't disrupt patient care. We have proposed a comprehensive compensation and benefits package that is market driven, and we are committed to bargaining with the Clinic Physicians Union to achieve salaries and total compensation that are fair and equitable. We have worked with SEIU to ensure that we will maintain adequate staff to support the physicians. We are working on other needs in the clinics as well, such as developing a task force to continue optimizing the EHR. Also, understanding the importance of family physicians doing obstetrics, we are negotiating this issue. We hope to come to an agreement which pays fairly for family doctors taking OB call. We look forward to ongoing discussions at the union bargaining table, and we are confident that we can work together towards the success of our clinics, our physicians, and the important mission that we serve. Thank you.
Thank you so much, Dr. Cho. And I would just add, we certainly understand this is an uncertain time, and our goal is to bring greater certainty and long-term viability. There are two main factors that are creating uncertainty right now for the system, and one is legal rulings that have really determined that the current structure is no longer viable. And at the same time, improvements have been made in clinic operations, but still there have been losses as recently as this year of roughly 30 million. And so our goal is to greater efficiencies, to bring greater stability to the system, because we want these excellent physicians to have long-term stable employment. And so we're going to transition to a county employment model. And we're negotiating to make sure that we have, and these physicians have, very fair and reasonable compensation and benefit structure that will keep them with our system for many years, because that's good for the physicians, it's good for the employees, and it's really good for our patients who need continuity of care. So we understand, and there's a comment about leadership saying that the doctors are on board. We're not aware of anyone saying that. We would be surprised at that because we understand this is an uncertain time. And that's why we really encourage these wonderful physicians and the UAPD leadership to continue to work with our county and HCA labor team to reach an agreement at the table so we can bring certainty and have really good salaries and bring long-term stability and viability to our critical safety net mission, because they're right, these doctors, our patients they are more complex and more socioeconomic challenges, and that speaks to the importance of sustaining this safety net system on long into the future. Thank you.
Thank you. And also we note the importance of having the great quality physicians we have that can provide the quality care to our patients. And certainly making sure that we are sustainable into the future is an important, if not critical piece of all of this, as is the fact that we are very desirous of continuing the good quality that we have.
Absolutely.
Thank you. Thank you. Well, I appreciate all the public comments that we have. I know we have a 1:30 Air Pollution Control Board meeting, if I'm accurate. So we would go to that before we come back to our hearing on item 38. Our meeting was delayed a little bit in the morning because of IT problems, but I think we'll be getting back into the swing of it. So at this time, let us go to our air pollution meeting, okay? And that involves all the Board of Supervisors. So we should be back here, I would guess, close to 2 p.m., 2:15 to continue with item 38.
Okay, we're ready.
Okay, so we are back from our Air Pollution Control Board meeting on this March 9th meeting of the Board of Supervisors. And instead of going immediately to our hearing, we have a closed session matter we have to deal with first, and then we'll come back and do our hearing. And so hopefully hearing for item 38, I believe it is, will be probably in about a half hour or so. So right now, the Board of Supervisors will be in closed session. Supervisors meeting. We are now going to item 39. This is our 3 p.m. time certain, and this is regarding a conditional use permit regarding a wireless communication facility. And I believe we have Thomas Chaffee and Mindy Fogg who will be presenting.
Good afternoon, Chair Parks and members of the board and CEO Powers. My name is Thomas Chaffee. Let me go ahead and share my screen. Again, my name is Thomas Chaffee, and I'm the case planner on the project before you today. The project is an appeal by the applicant AT&T of the Muscle Shoals Wireless Communication Facility, case number PL 19-0040. Today, I'll be going over the project location, history and description, grounds of appeal, findings and consistency analysis, and recommended actions. The site location is within the community of Muscle Shoals and the Caltrans public right-of-way. The site is currently developed with the existing pole, which will be replaced to accommodate the new wireless communications facility. The zoning for the subject location is COS 10 AC, which is coastal open space. The general plan designation is open space. North of the facility is the 101 freeway, and south of the proposed location is the community of Muscle Shoals. Here's another view of the project site showing the surrounding land uses and proximity to nearby properties. The planning director hearing was held on August 29th, 2019. The planning director approved the project on October 8th, 2019. The project was appealed to the Planning Commission on October 21st, 2019. The Planning Commission considered the item on July 30th, 2020, and was continued to a date uncertain so the applicant and community could discuss alternate site locations. The continued Planning Commission hearing was held on November 19th, 2020, and after deliberation, the Planning Commission was unable to render a decision after a motion and a 2-2 vote. This effectively denied the project on November 19th, 2020, and a timely appeal was filed on November 30th, 2020. The facility would include the replacement of an existing 28-foot 6-inch utility pole with a 34-foot tall utility pole. Attached to the utility pole would be 4 6-foot tall antennas on 8-foot cross arms. 4 remote radio units and 4 tower-mounted amplifiers will also be mounted behind the antennas. The associated equipment cabinets would be located within a 96 square foot lease area. In order to approve the proposed facility, the applicant needs to show a gap in service coverage. The first map shows the existing AT&T coverage in the vicinity, and the second map shows the coverage once the proposed facility is on air. The green on the map indicates good indoor coverage, the yellow indicates good in-vehicle coverage, and the pink shows only coverage when outdoors. Here's a picture of the site plans showing the proposed facility and related pole-mounted equipment. To the left here is the existing Southern California Edison utility pole, and to the right is how the proposed utility pole would look once constructed. This site plan shows the overall layout. Here on the northwest is the ground-mounted equipment area and the proposed landscaping to screen the equipment. 110 feet south is the replacement power pole. The distance was increased to avoid native brush. This is the current picture of the existing utility pole, which will be replaced to accommodate the proposed wireless communication facility. Here is a current picture of the site location where the equipment pad will be located. The equipment location will require the removal of some existing ice plant in the right-of-way. Shown here are photo simulations of the project site looking north. To the left here is the existing Southern California Edison utility pole, and to the right is how the pole will look once constructed. Shown are other photo simulations looking south. To the left is the existing setting where the ground-mounted equipment will be placed, with the SCE utility pole in the background. On the right is the photo simulation when the proposed landscape screening and equipment and utility pole with antennas in the background. I would like to go over the alternate site analysis, which was a primary point of discussion at the Planning Commission hearings. It shows that AT&T had researched 8 alternative sites for the proposed project. These sites include the Verizon co-location to the north. This location can't propagate signal east of Muscle Shoals. The bluff top. Elevation is too high to close the significant gap in coverage. Caltrans Park and Ride. This location can't propagate signal to the west of Muscle Shoals. The Cliff House Inn. The property owner was not interested in a lease with AT&T. The existing oil pier. The State Lands Commission retook ownership and will not entertain a new tenant. And the existing T-Mobile facility. Due to state GO 95 clearance restrictions, this pole is not viable for co-location. The next 2 were added in between the 2 Planning Commission hearings. The existing railroad relay. The small railroad relay is not viable for co-location, and the railroad does not allow cell towers. And the wood utility pole in Caltrans non-right-of-way. Caltrans will not allow a new facility in this area. And then all the property north of the 101 freeway is owned by Caltrans, and they will not allow use of the land due to sensitive habitat. I will now go over the grounds of appeal. Ground of appeal number 1. AT&T has proven a significant gap in coverage exists in the vicinity of the proposed facility, and AT&T's application proposes to close that gap by the best available and least intrusive means. Staff agrees the applicant has demonstrated the existence of a coverage gap and no alternative sites were identified that would meet AT&T's coverage needs. Ground of appeal number 2. The denial is not supported by substantial evidence as required by the Federal Telecommunications Act. In fact, the substantial evidence in the administrative record and original director approval decision supports approval of AT&T's application in this appeal. Again, staff believes the applicant has demonstrated a gap in coverage and no alternative sites were identified. Ground of appeal number 3. AT&T's proposed location and stealth design are consistent with the Ventura County Coastal Ordinance, which recommends use of utility poles in the right-of-way for installation and attachment of wireless telecommunication facilities. Staff has found that the proposed site and stealth design comply with the coastal zoning ordinance requirements. Ground of appeal number 4. The county has already established the old Pacific Coast Highway right-of-way adjacent to Muscle Shoals as an appropriate location for the installation of wireless telecommunications facilities. The county approved a T-Mobile installation on a utility pole with ground-mounted equipment within about 300 feet of the proposed AT&T right-of-way facility. Denial of AT&T's application unreasonably discriminates against AT&T. Staff believes this ground of appeal lacks merit. The T-Mobile facility was approved in 1999 based on the conditions and rules in place at that time. Each application is reviewed individually, and there is no basis for the discrimination argument. Ground of appeal number 5. As evidenced by the alternative site analysis, denial of AT&T's application will effectively prohibit AT&T from providing personal wireless services to the Muscle Shoals area of the county, which violates the Federal Telecommunications Act. Staff agrees no feasible alternative sites were identified that would meet both AT&T's coverage needs and the coastal zoning ordinance. Ground of appeal number 6, failure by the county to approve AT&T's application within a reasonable period of time as defined by federal law, including the FCC shot clock rules, would violate the Federal Telecommunications Act. Staff concurs that under federal and state law, the county must act upon AT&T's application within a reasonable period of time. The FCC shot clock timeframes show this to be 150 days after application completeness. Ground of appeal number 7. A denial would violate AT&T's state law franchise right to place telephone equipment in the public rights of way. Staff believes this ground of appeal lacks merit. Under California state law, the applicant has the right to attempt to place the facility in the right of way, but local agencies retain authority to regulate aspects of the facility. Staff also must ensure compliance with the Coastal Act. Now moving on to findings and consistency analysis. Staff has found that the proposed development is consistent with both the Coastal Area Plan and the Ventura County Coastal Zoning Ordinance, and the proposed project is categorically exempt pursuant to Section 15302, replacement or reconstruction, and Section 15303, new construction or conversion of small structures of the CEQA guidelines. Staff's recommendations are as described in the board letter, including to grant the requested CUP subject to the conditions of approval. I'm available for any questions you may have in relation to the proposed project. In addition, the applicant is available on Zoom to give a presentation. Thank you.
Thank you for the presentation. And since this is a public hearing, we will have, there's a couple of things that we want to ensure, and that the applicant as well as the appellant both get their time. The appellant gets 15 minutes. And then at the end, both the applicant and the appellant also get a rebuttal of 5 minutes, with the applicant going last. We also ask that supervisors disclose if they have had any contact information that they've received directly from applicants or appellants. And so we'll do that at this time. And I have not been contacted or had any contact with either party. Other supervisors?
Madam Chair, nothing beyond the emails that were sent to the board, which are part of the public record.
Thank you.
Same here, Carmen Ramirez.
Thank you, Supervisor Ramirez.
None to report from Supervisor Long.
Supervisor Long, I didn't quite get what was it you said?
Sorry, nothing to report.
Nothing to report. Thank you. And then Supervisor Huber?
Nothing to report.
Okay, so there are no disclosures. I have none either. I also would like to ask the County Council if he wants to make a brief statement about the applicable legal principles and requirements in this case.
Yes, thank you so much, Chair Parks. Jeff Barnes, Ventura County Council's office. Because this is a wireless telecommunications facility, your board should be cognizant of federal law, which was touched upon in the applicant's appeal points. And so kind of in a nutshell, the two general rules that apply under federal law that do constrain the county's ability to deny telecommunications projects such as this one are basically two overarching requirements. One, the applicant needs to show that there's a significant coverage gap in the area that the proposed facility would fill. And then the second requirement that the applicant needs to show is that the proposed facility represents the least intrusive means to fill that significant coverage gap. And so when you're looking at the least intrusive means, that's where our coastal zoning ordinance comes into play. And the way that we have prepared the coastal zoning ordinance, we've attempted to provide a permitting path for applicants to design facilities that will basically present the least intrusive means, such as proposing what's referred to as a stealth facility, and there might be more discussion of this later, and citing the facility in an appropriate location and issues such as that. But again, just to big picture, significant coverage gap and least intrusive means. And then in terms of project denial, under federal law, the county needs to be able to show that substantial evidence was presented that supports a denial decision, either in terms of a lack of coverage gap or the fact that the facility does not present the least intrusive means, based upon non-compliance with the county's basically development standards or other rules that apply to this type of facility. I'd be happy to answer any follow-up questions.
Thank you. So that gives us an idea of what the standards are we can use for approval and denial. I think also we cannot deny a wireless facility based on concerns of health. Is that correct, Mr. Barnes?
Thank you. That's correct. Yeah, that cannot be taken into account. That's preempted by FCC rules. So radio wave health issues cannot be taken into account.
Thank you. I know that is often a concern too. Supervisor Long, you have your hand up.
Yes, I want to know if it said without any modifications. And so if there was concern on the commission meeting about the look of the pole, and I know that there's sometimes a pole like this that looks like a palm tree or a pine tree or something like that. Can any modification be on that?
Yeah, you know what, I would defer to planning. Are you asking in terms of this facility design, whether it can be made kind of less obtrusive?
Yeah. I didn't know if legally we have that right to ask that.
No, yeah, good question. You do, and that's appropriately addressed by staff.
Okay, thank you.
Yes, and that goes toward that least intrusive argument, right? All right, so if there aren't any other questions from our board, we did open this, so now at this point we have both the appellant and the applicant who get 15 minutes. And we'll start with the applicant, and then we'll go to the appellant, then we'll go to the public comments, and then return in that same order for rebuttal. So,
Supervisor Parks?
Yes.
In this instant, the applicant and appellant are the same. It was a denial from the Planning Commission, so the applicant appealed the decision.
Got it. Really good point. So with that, we do have the applicant / appellant, and they will go now, and you have 15 minutes. Is that Mr. Ambrose? Yes. Please go ahead and unmute yourself, and we'll start your clock over again.
Good afternoon, Madam Chair and Supervisors. Again, my name is Jerry Ambrose. I'm here on behalf of AT&T, and I'm, I guess, wearing two hats, appellant and applicant. I have a brief presentation. I'll do my best to not repeat what you've already heard, but I do want to highlight some of the items that came up most frequently at the Planning Commission and during our community meetings. And I'll share my screen. Can you all see that?
Yes.
Okay, thank you. We'll start out discussing more about the goal of the project. The goal, as Thomas said, is to close a significant gap in AT&T's wireless coverage along the coast, generally between La Conchita, the fire station, county fire station down by Seacliff. It's a stretch of area approximately 2.5 miles long. And because of the unique shape where you have the bay on one side and then the highway and La Conchita going north, and the fact that RF or cellular signal cannot go around a corner, the only way to effectively cover this stretch is to place a new wireless facility as far south as possible in the Muscle Shoals Point area. And that's the reason why it's so far south on that turn. That's also the reason that T-Mobile would have built their site there as well. I'm sorry, this is not working. Hold on. There it goes. I think the most common topic of discussion at the Planning Commission and during the community meetings is why we can't locate across the highway on the north side of Highway 1. And there's 3 primary reasons. First, any development that we would propose across the highway would have to be a brand new tower of some kind from the ground up. One of the supervisors mentioned, a palm tree or a pine tree. That's essentially what we would have to propose across the highway. And the county's coastal zoning code does not list that type of development as a preferred design. So that is something that we would not pursue in any event, even if property was available across the highway. We have no leasing opportunities there. The 2 primary landowners, who are Caltrans and Union Pacific. And for the one location that we may possibly have a leasing opportunity, that location will not close the significant gap in coverage. And I'll go through that in more detail. These are excerpts from the county's coastal zoning code. The first item here is siting criteria. Number 1 in the siting criteria is that we, number one is we pursue a preferred location as outlined in Section E. Section E, Sections 2 and 3, preferred locations are flush mounted on an existing structure, pole, or building, or otherwise in the public right-of-way. So we, as applicants, are compelled to try and propose a location and design that are as high up on these siting criteria and preferred location lists as possible. Your code goes further and has an illustration actually of what a flush-mounted wireless facility looks like in the public right-of-way. And as you can see, this is essentially what we are proposing. You have a wood pole, you have a bracket, a wood bracket going across, and antennas hanging off the end of the bracket. So that is essentially what we are proposing. And again, that's the second preferred location within your zoning code. Some more details about property ownership, and Thomas touched on this. The yellow line that generally runs parallel with the highway, that is Union Pacific Railroad. For obvious reasons, we can't build a cell tower next to a railroad track. The large area in white, sort of an eagle, I guess, shape, is Caltrans property. And as Thomas mentioned, Caltrans would not allow us to propose a facility in that area due to environmental, ecological, and archaeological concerns. The only potential leasing opportunity across the highway would be the sliver in, I hope you can see it, it's in blue, to the northwest of the pier. So what we did with that potential opportunity is we had the AT&T engineers ran a propagation analysis comparison to see, if that property owner was interested in leasing to us, could we make it work to close the significant coverage gap? So that analysis is on the left, the image here on the left. And as you can see, location across the highway would provide some coverage to Lock and Cheetah, but essentially stops at Muscle Shoals because of the topography and how high up the site would be on the side of that hill. And you compare that with our proposed site to the right here, obviously there's a dramatic difference, and only the site on the right will close the significant gap. And again, I go back to even if we did have an available property for leasing reasons, we would have to propose a brand new tower, and that is not preferred by your own coastal zoning code. Actually, the first preference within your code is to co-locate on an existing wireless facility. The only potential for that would be the T-Mobile location that was referenced earlier. This is approximately 300 feet northwest of where we are proposing our site. And this T-Mobile facility has been in for over 20 years. And nowadays, if you can see here, there are guy wires. Edison no longer allows antennas to be installed above guy wires. So this location would not be available to us for co-location. It would not even be available to us for a new site because of the guy wires. We can't go above the guy wires. Obviously, below the guy wires is below the sound wall and would defeat the purpose of the site entirely. There was a lot of discussion at the Planning Commission and community meetings about, hey, there's some AT&T cabinets out there, and that's true. AT&T is not only in the wireless business, they are also a traditional telephone company. So they run copper and fiber optic cables in the right-of-way to serve customers. And in this particular case, AT&T is the fiber provider for T-Mobile. So T-Mobile is paying AT&T for that fiber optic connection, but there is no partnership or affiliation with T-Mobile's wireless site and AT&T. There were concerns about impacts to sensitive plants. Again, as Thomas mentioned, we relocated the equipment to an area of essentially ice plant out of the way of the salt brush or any other sensitive plants that are in the area. I thought it'd be good to show a comparison of T-Mobile and AT&T's proposed facility. On the left is T-Mobile's existing equipment, sort of some rusty cabinets with no screening, no landscaping, nothing. And the image on the right is what we are proposing. We're proposing to add landscaping around our equipment so it disappears from the public view. We did offer to also, if this were to be approved, we could build a wall behind the landscaping between the equipment cabinets and the landscaping. We could build a decorative wall to more or less match the wall back here to further screen the equipment from public view. Just quickly, some design changes. We've been at this for 18 months to 2 years, for quite a while. So these are some of the design changes that came from the Planning Commission and community meetings. We've reduced the length of the cross arms from 11 feet to 8 feet wide. 8 feet wide is the minimum necessary for the site to function technically. The antenna cross arm was moved to the center of the pole. When originally approved, it was a standoff arm, so it only went one way off of the pole. The equipment was relocated out of the sensitive plant areas, and the equipment area will be surrounded by new landscaping, and we can propose a wall as well if the county determines that would be appropriate. FirstNet. AT&T is the sole provider of what's called FirstNet, which is a band frequency that was set aside by the federal government a number of years ago to provide sort of a common frequency band that can be shared by all government agencies. Problems in the past, from 9/11 forward, problems where you have federal, state, and local agencies, they had no way to communicate on a single frequency. And so AT&T was awarded this Band 14 license, and AT&T, again, is the only carrier to provide that service. And as you know, the Muscle Shoals area has seen a lot of natural disasters, man-made disasters, mudslides, the Thomas Fire, numerous large-scale traffic accidents. So obviously this Band 14 would be an invaluable tool for any emergency responders for situations like that. In conclusion, the design and location meet the siting criteria of the Coastal Zoning Code. AT&T has proven there is a significant gap in wireless coverage. We are proposing the least intrusive means to close the significant gap. We've evaluated all potential alternatives and designs. We've redesigned the project to the fullest extent possible per input from the Planning Commission and community members. As Thomas mentioned, the county has already established this area as an acceptable location for wireless facilities by means of approving the T-Mobile facility previously. And the project will provide improved service for AT&T customers as well as first responders. And I'm here to answer any questions you may have.
Thank you. Thank you for the presentation. Supervisor Long, you have a question?
Not at that time. Sorry, I didn't lower my hand.
Okay, I do have a question. You showed the Southern California Edison pole, I believe, and I'm wondering if they will be replacing that because it's rather old school. Do you know about that?
No, again, that's T-Mobile's facility. I do not know. It would still have to serve as a guy wire, but I assume they get old at some point and have to be replaced, but I don't know myself.
They seem to be making an attempt to update their infrastructure. So, but we don't have a report on any whether it's one way or the other, then whether they will be. Okay, I'm not seeing other supervisors who have questions. So at this time, then we will go to our public comments. comments with 3 minutes for the speakers. And with that, I have, I believe, 5 individuals. And I'll start with Steve Kohler, followed by Daniel Reddick. And Mr. Kohler, I believe, is on the telephone. And if you could unmute yourself, and then we can hear your testimony.
Supervisor Parks, he may have to *6 if he's dialing in.
Yes, Mr. Kohler, if you can hear us, if you could hit *6, you'll be unmuted and you can begin your testimony. 3 minutes. And you know what? I think what we can do is come back to, did we get off? Okay, go ahead, Mr. Kohler.
Yes, hello. My name is Steve Kohler, and my family has lived here for 55 years in Muscle Shoals area and in Muscle Shoals. And I honestly had not planned to speak, so this is really off the cuff. But I would like to say that over those many years, I have seen many electronic and intrusive devices put into this community without any community input. And I, for one, am glad, I guess, to have this input. And I would just like to say that I don't want anything looking like this proposed tower in front of my house. That's it.
And Mr. Kohler, could I ask you, you do see this as being something in front of your house?
Absolutely, right in front of my house, yep.
Okay, thank you for your testimony. And next we have Daniel Reddick, followed by Nereida Harmon. And so we'll go now to, is Mr. Reddick no longer on? Oh yes, Mr. Reddick, if you could unmute yourself, you too will have 3 minutes.
Do you have me now?
Yes, we can. Go ahead.
Okay. Could you reset me there? I'm on a 3-minute tight time.
Yeah, we'll give you back your 6 seconds. Please go forward.
Yeah, I believe I got this down. Thank you.
You may proceed. Unless you're
okay.
frozen.
Ventura County Board of Supervisors, good afternoon and thank you for your leadership. I'm Dan Reddick. I'm a resident and homeowner in Muscle Shoals. I am in opposition to the proposed AT&T cell tower. I trust that you've received my letter dated March 5th and have had time to study it, especially the exhibits and the pictures. I'm opposed to this project due to the following: visual impact. A cell tower is an industrial installation that is not consistent with our neighborhood. I hope you've reviewed Exhibit 1 of my letter that shows that one small cell tower in our community, the T-Mobile. I asked, would you want this outside your front door? Note, AT&T has stated numerous times and once again today that they have no involvement with this existing installation, yet their boxes are there. AT&T Cellular and AT&T Fiber are the same company. AT&T has been aware of this problem for over a year, and if AT&T were a good neighbor, wouldn't they have investigated, been shocked by what they saw, how horrible the installation was, how dangerous it was, and corrected it with their co-located partner, AT&T. If this new tower is approved, you are allowing a known bad actor, AT&T, to spread their industrial filth in our neighborhood. It's a new installation. AT&T will be moving an existing pole, then installing a new pole. AT&T is not using existing infrastructure as stated in the documents prepared for this project, including the staff report. Alternate locations. There are many other alternate locations available for the cell tower. Verizon, Sprint, and many other cell tower providers have cell towers along the coast in areas that do not impact the sensitive coastal assets or local neighborhoods. Again, I hope you have had time to study the information I provided in Exhibit 2 that clearly, without question, confirms there are other viable locations. AT&T is trying to create a perception that locating the tower in Muscle Shoals is their only option. This is categorically false, as Sprint, utilizing the bluff behind Muscle Shoals and Verizon utilizing the Freya Beach Point, which was not included in the AT&T alternative analysis. Others are clearly able to shoot their singles past Muscle Shoals without impacting any neighborhood. Do the Verizon and Sprint have smarter engineers, better equipment, or both than AT&T? I'm sure, but I guarantee you they are not polluting our local residential neighborhoods. Air and noise pollution. In the event of an extended outage, AT&T will be forced to utilize a trailer-mounted gas or diesel power generator to power this installation. Again, this is not consistent with a neighborhood. I hope you reviewed Exhibit 1 pictures for how that looks. Visual impact is not consistent with the Coastal Commission Policy 4.1.7-3. Coastal impact. The Muscle Shoals community is not an industrial park. Is this to be allowed to be the second of 10 to come? Ventura County has classified many parts of Muscle Shoals as environmentally sensitive habitat. We have requested maps and information such as what is the environmentally sensitive habitat buffer zone for this project from AT&T and never received it. One mistake has already been made in Muscle Shoals community to allow the first cell tower to be built. Please, I thank you. Do not let this happen again.
Thank you for your testimony. Three minutes, please proceed.
Hello? Who are you talking to right now?
I was referring to Mr. Dennis Longwell, and it is his turn if he would like to proceed.
Okay, I'm ready now. Thank you. I had the same confusion Ann did. I'm ready to start when you are.
Please proceed.
My name is Dennis Longwell. I live with my wife Jeanette at 6628 Old Pacific Coast Highway in the community of Muscle Shoals. We thank the Board of Supervisors for hearing our concerns regarding this cell tower project. The proposed project is to be placed on a residential street at the gateway of our community. The staff report uses the term stealth tower, but there's nothing stealth about it. An existing inconspicuous wooden pole would be replaced with a new, taller one of larger diameter. This pole would support cross arms, antennas, radio units, and amplifiers hanging over environmentally sensitive habitat and our bike path. In addition to the negative visual and environmental impact and the lack of diligence by AT&T in finding alternative sites, we would like to point out a future hidden implication of allowing AT&T this permit. Co-location is the practice that allows another carrier to place additional ground and aerial equipment at the site of an existing tower. I refer you to Exhibit 3 on our agenda today, which is the Planning Director's staff report dated 8/29/2019. In that report is Exhibit 4, which states the conditions of approval for the AT&T wireless communication facility. Item 21 of these conditions is titled Future Co-location of Wireless Communications Facilities, which is found on page 13 of 14. If you're using the document finder, it's page 34 under Exhibit 3. This section begins with an acknowledgement that the number of communication facilities should be reduced to, quote, minimize the potential environmental impacts associated with such facilities. It goes on to state as a requirement that, quote, the permittees shall make the facility and site available to other telecommunications carriers, unquote. And under item C, quote, the permittee shall make its facilities and site available for co-location. Further down under documentation, quote, the permittee shall demonstrate that the tower is engineered in a manner that can accommodate supplementary antennas to co-locate at least one additional telecommunications carrier. So conditional approval of this project allows for future placement of equipment by another carrier if they apply for permission. In fact, we were advised by planning staff that upon submission of a compliant application, permission for co-location would be granted, most likely in an over-the-counter submittal without a hearing or the degree of oversight and community involvement required of the original applicant. It's quite possible that in the future, our community would be looking at a much greater visual impact with 8 cross arms, 8 6-foot antennas, 8 remote radio units. We ask the Board of Supervisors To realize the total and long-term impact of this project in our community, please deny this appeal by AT&T to reverse the County Planning Commission's decision. Thank you.
Thank you, Mr. Longwell, for your testimony. Ms. Pam Warden, it is your turn now.
Yes, you can hear me, I'm presuming.
Yes.
You can hear me? Okay, good.
Yes.
I've lived in Muscle Shoals next door to Steve for only 50 years. And that ugly box that they're proposing to put some kind of block around is right in front of my house. And so I would be looking at that. Now, I have seen these boxes other places, and the Planning Commission actually talked about this, that they make noise, and it's a constant noise. So not only, as Dan said, we lose our power here about 5 or 6 times a year, every year. And they will bring in these portable generators and they will make more noise. But the box itself makes noise constantly. Something that Dennis has referenced, so Dan, is the fact that we have asked for a biological resources report because we have egret there in that ice plant. It's living there along with other wildlife, skunks, etc., that are there. And yet nobody's talking about that. Now, maybe they don't have a right to live anymore, but it seems like we're talking about wildlife having some kind of habitat, but yet AT&T, with total disregard for our community, has never produced this biological resource report that we've asked for. And we know we have these plants and animals right there. I see them every day. And yet there's no total disregard. I wish you would reconsider this and think of our community. We are a local, small community that tries to keep our community active. Dan goes around and picks up trash. Other people weed. And yet we're going to have this another box there. I think we have 3 ugly boxes already maintained by AT&T at this point. And now we're going to add another one. And then how many more past that? Please reconsider. If you wouldn't want this in your community, why allow it in our community? Thank you very much.
Thank you very much, Ms. Warden. Next speaker, and I believe our last public speaker, is Nerida Harmon. Ms. Harmon, please go ahead with your testimony.
Yes, good afternoon, Chairperson and Supervisors. I go by Ray Harmon. If possible, I would like to ask you for a little over 3 minutes to speak, since I'm representing about 40 members of our community. Is that a possibility?
We'll give you a few more seconds. Please go ahead.
Okay, I live a few steps away from the proposed project site on Old Pacific Coast Highway, and I appealed the project to the Planning Commission after it was approved by the director. First, I would like to also bring up biological resources. The project location is right next to, if not within, environmentally sensitive habitat area, or ESHA. Per policy straight out of the county's coastal area plan, impacts on ESHA and ESHA buffer zones should be minimized. We requested a short bioassessment, even 1 page long, from the applicant and information regarding ESHA buffers from county staff many months ago, and we never received any of this information. The area is very important habitat for many animals we see here every single day, as others mentioned. The applicant's PowerPoint for today states that the proposed equipment will be located in an ice plant area about 100 foot west of the pole location with no impacts to sensitive plants. However, it fails to mention that the proposed 96 square foot, 6 foot tall equipment will be located just 4 feet away from the salt bush, which is ESHA. And it's possible that the exact location where the equipment is proposed is ESHA as well, or at the very least an ESHA buffer zone. Our second concern is with the visual impact that this would cause. The 101, Old Pacific Coast Highway, and the bike path are all public viewing locations. One of the policies that should be enforced by the county states that development shall be visually compatible with the character of the surrounding area and to restore and enhance visually degraded areas. We were disappointed when one of the planning commissioners noted that we already have a pole with antennas down the road, so why were we complaining? We are trying to do exactly what this policy states by enhancing the side of the road, which currently has rusted old equipment cabinets. So if these telecom facilities continue to be allowed right in front of our homes, we'll start to see a cumulative impact. So for this reason, this project is not exempt from CEQA as stated in the staff report. The applicant provided a very weak alternative site analysis, which was updated 2 or 3 times in the last year, but is still lacking comprehensive information. I tried to reach out to AT&T's agent from the very start about a year ago so that we could have a collaborative approach, and they did not respond to any of my messages. Only after the Planning Commission forced them to work with the community, then they hesitantly reached out and very slightly modified their project. I do want to note that after the planning director approved the project in 2019, immediately the next couple of days, AT&T was out here trenching right next to the subject pole, and this was done during the project's appeal period before they even had their permit. Our community respectfully urges that your board denies the proposed CUP. It's very clearly not in compliance with the coastal area plan or the coastal zoning ordinance, and it is not CEQA exempt. Thank you very much for your time.
Thank you for your testimony. I believe that concludes the public comment on this. And now we have 5-minute rebuttal from
Supervisor Parks.
Yes.
I have 2 public comments to read.
Okay, thank you. Please
Thank you.
The first email is from the Bruners, and it says, as a residential beach community, we feel there are much more responsible locations for the industrial equipment. Why hasn't AT&T relocated it to a more intelligent location out of Muscle Shoals? Why hasn't AT&T maintained the existing, very corroded equipment in our community? Please note the danger signs on the current equipment located here. The new AT&T pole is 82 linear feet from my residence, right next to the California Bike Pedestrian Trail and directly above 2 handicap parking spaces. RF rays can bounce off of the sound wall 25 linear feet from their proposed tower location. Please deny the AT&T conditional use permit for this project. Thank you, Robert and Jane Bruner. The next email is from Rick and Nancy Otto, and it says, our family opposes a site AT&T is wanting to put of such a disgusting tower and equipment in our community. It feels these huge companies want to push their own agenda without considering what is best for all of the families that live in the area. As seen on photos presented in Daniel Reddick and existing utility poles and equipment, they are an extreme hazard to the children that live here. There are many kids who play in the neighborhood, and God forbid one of them is cut by a rusty utility box or even worse, die from an injury sustained from having this installed here. You know how kids are interested in everything in their playing field and skateboarding area, and their inquiring minds will definitely entice them to check out what and why there's something in their playground. What is the cost of having it here on the wrong side of the freeway versus having it where it should be, on the mountain side of the freeway? I would assume that it would be a lot less than a lawsuit for the injury to our children by AT&T equipment. There's also a lot of environmental issues from animals that live in the feed here to the plants that are just as sacred as the ones across the street. Even more so since the amount on this side is way more condensed than that on the other side. Not only will the tower and box destroy, and then that's at the 250 word limit, and they also included a photo in their email.
Thank you very much. What I would suggest is that we hear the 5-minute rebuttal and then go to questions of staff or others. Is that okay with supervisors who want to ask questions? Okay, good. Let's complete then the testimony and go to Mr. Ambrose for your 5-minute rebuttal.
Thank you again. I'll just respond in order, the way that they were presented. Well, first, I guess I want to say that, as I mentioned in my presentation, we are compelled as applicants by virtue of how the county's coastal zoning code is written, that we should look to attach equipment antennas to utility poles in the public right-of-way. And as I mentioned before, that is one of the highest priority or preferred locations that we should pursue, and that's what we've done in this particular case. There was a mention about Faria Point. AT&T does actually have a site at Faria Point. AT&T has a site at Rincon Point as well, and also has a site at Rincon Hill above. And none of those are capable of fulfilling or filling or closing the significant gap in service. There was a reference to Sprint. A Sprint is actually on the island, and the intent of that Sprint project, which I actually worked on several years ago, was to accomplish the same thing that we're trying to accomplish here, and that is to cover both sides of Muscle Shoals by propagating signal both north and east. Let's see, there was a question about a generator. There is no generator proposed with this project. There are no air conditioning units proposed. Air conditioning units, if you've seen other typical cell sites with the small buildings, they have air conditioning units, and those do make noise. We are using outdoor cabinets, so there will be no air conditioning, and there is no generator proposed. There was a mention of AT&T and T-Mobile being in partnership or some kind of an affiliation. I'll just repeat again, AT&T is the fiber provider, the landline fiber provider for the T-Mobile facility. AT&T is not in partnership or affiliation on the wireless side for use of that pole. And I believe I've covered everything, and I'm here to answer any more questions you may have.
Okay, thank you for that. And so let us now go to our questions by the Board of Supervisors. It may be questions to staff or the applicant. We'll see how that all goes. And Supervisor Levere, I believe you had your hand up.
Great, thank you, Madam Chair. My first question is for staff. I want to confirm what kind of setbacks we're looking at. What are the rules we're looking at in terms of the setback from the wireless facility to the nearest dwelling unit?
The setback is 50 feet from the nearest dwelling unit, and that is for ground-mounted equipment. So the distance from the building across the street to the pole location is 54 feet, 11 inches.
So it's not from the property line, it's from the structure itself, and it's to the equipment, not the arms on the pole?
That is correct. It's from the nearest dwelling unit, and it is for ground-mounted facilities.
Okay. I guess, and thank you for that, Mr. Chafee. What my first concern, just listening to the testimony today, was that there seems to be an acknowledgement that new towers are not preferred designs in the coastal zone, but it appears to me that what they're proposing is exactly that. I mean, they're taking down an existing infrastructure and putting in a much larger pole. Am I incorrect?
No, you are correct. They are replacing the Southern California Edison utility pole with a little bit taller pole. When we were going through the coastal zoning ordinance, the Coastal Commission actually used that as existing infrastructure. So they considered that stealth design. And even though it is being replaced, they consider that existing infrastructure.
Well, I would beg to differ with that. And one of the areas that I really want to focus my attention on is this alternative site analysis. I know there's a section in this coastal zoning ordinance. I just want to get it right. Section 8175.5.20.10.j. And it spells out kind of what the rules are and for this type of analysis. And I want to read from two of the sections because I think they're particularly appropriate to the discussion we're having today. And number 2 says an analysis of alternative sites and facility configurations, including potential co-location and locations outside of the coastal zone that would provide coverage of the subject area as demonstrated on a series of alternative propagation diagrams. So that's something that an alternative site analysis shall include in terms of documentation. And then section 4 is another requirement, and that says this analysis, there must be demonstrated efforts to secure alternative sites or co-locate the proposed facility on an existing facility, including copies of correspondence sent to other landowners, carriers, or wireless communications facility owners requesting a site lease or co-location on their facilities. If alternative sites or co-location are not feasible, the applicant shall demonstrate to the satisfaction of the planning division that technical, physical, or legal obstacles render alternative sites or co-location infeasible. And it goes on to mention that a lack of ownership leases or permits for alternate sites shall not suffice as a valid consideration regarding the feasibility of alternate sites unless the applicant demonstrates that substantial efforts were made to obtain ownership, leases, or permits for alternate sites. So it really lays forth a requirement of both substantial effort and documentation. And I really want to start going through some of these different alternative sites that were analyzed, because I just didn't find in my reading of this those substantial efforts and documentation, which are required by the Coastal Zoning Ordinance. And I want to start with the Verizon co-location. I believe that was number one. And it's my understanding, and maybe AT&T can correct me if I'm wrong, but their analysis is that this location, the signal cannot propagate east of the Muscle Shoals Bend in the 101 there. Is that correct?
Yeah, and just for clarification, the alternate site analysis is for non-preferred locations, and this location is a preferred location. So the applicant did go above and beyond in providing these alternate site analyses, even though it is a preferred location in the coastal zone. But questions about the individual sites and how they propagate, that would be better answered by the applicant.
And we can do that now if you'd like.
Okay.
Mr. Ambrose, would you like to respond?
Yes, I'm sorry, I was listening. I believe that the question was about the Verizon project that's to the west of La Conchita.
Correct.
That's correct. That a site there would not propagate past Muscle Shoals. If you recall in my presentation, we showed a propagation of a site that's very close to Muscle Shoals on that side of the road. And even from there, it doesn't make it past Muscle Shoals due to the topography. Where the old oil piers used to be down in that area, that completely gets shadowed from anything to the west.
Was that propagation diagram included in the record?
There was not a propagation diagram. But again, I'm sorry, as Thomas mentioned, the project that we are proposing is a preferred location. So normally we wouldn't provide that for sites because we're not proposing a site that is not a preferred location. So we are not trying to justify a lower tier design or location. I hope that makes sense.
I guess, I mean, I just went through a lot of these alternative sites and I just didn't find a lot of documentation supporting that this was the least intrusive means. Judging from our coastal zoning ordinance, and that standard, showing that the proposed facility is the least intrusive means. I really wanted to see some evidence regarding these alternative sites, which I wanted to see propagation diagrams or other documentation. For instance, like the Caltrans non-right-of-way, that seemed to be a really appropriate potential location. I'm sorry, the park and ride. And again, it was claimed that there was no signal or that there was a propagation problem, but again, no propagation diagrams were provided. Again, Faria Point, the bluff top, I seemed, in judging from the record, I didn't see the efforts and the documentation really to support this analysis. But staff, you're telling me that that's not required?
Yes, that is accurate, Supervisor Levere. Since it is a preferred location in the coastal zone, the alternate site analysis is not required with submittal.
Okay.
Supervisor Levere, you bring up some good points. Appreciate that.
Just going through my notes. Then I want to ask staff about going. There has to be compliance with the local coastal plan to make the findings that we're being asked to make. Correct?
Yeah, that is correct.
And one of the things, looking at the local coastal plan in section 4.17, the wireless communications facility should be sited and designed to minimize alteration of natural landforms and to blend with the surrounding area in a manner that is consistent with community character, the natural environment, and an existing development. It was staff's interpretation that this proposed facility complies with that requirement in the local coastal plan.
Yes, that is staff's interpretation. And when this all went through in 2015, that was one of the things that the Coastal Commission specifically made an out for. We're using these existing utility poles for wireless communication facilities, as opposed to placing new, larger facilities outside of the right-of-way in the coastal zone.
And what about the next one, number 2? It says that the wireless communication facilities, I'm sorry, going back, this goes back to the question I made earlier. You mentioned existing facilities. This isn't an existing facilities, correct? So it seems to me that they wouldn't comply with that.
Yeah, and this was something that the Coastal Commission was adamant about. They considered this an existing facility because that pole is existing in the right-of-way. And another thing going through the deliberations with them, Southern California Edison has a right to remove and replace that pole as need be. So that was kind of their way of saying this is existing infrastructure. This is what we want in the coastal zone. So that is what we masked the ordinance after. And that is why the picture is actually included in the definition of stealth flush mounted design.
Okay, thank you for that. And then the next point, or the next section of that local coastal plan, the visual resources, it talks about the wireless communication facilities being sited and designed to protect views from public viewing areas to the ocean or to scenic resources. And I think, those are beautiful hillsides right there. I think obviously would be considered scenic resources. And, 40 or 42 foot pole with 8 foot arms would seem to be impacting a view of the scenic resources there. Was that considered?
Yes, when we reviewed this, we reviewed everything we could to adhere to both the adopted coastal zoning ordinance and the coastal plan. So yeah, that was all reviewed. We looked at everything, and this is considered, and that is why when they adopted the coastal plan, they considered this a stealth design to protect those viewpoints.
Okay. And then lastly, I know we talked about this alternative site analysis, and the point was made that because it's a preferred location, it wasn't required. But then looking at the Planning Commission, their motion required this analysis. How does that come into play here then?
They requested alternate, to go out and do it again, alternate site analysis, and AT&T agreed at that time that they were going to do due diligence and go out there again and include additional alternate sites, even though it was not required.
Okay, so even though it was part of the motion, it wasn't, I guess that wasn't a legally sound requirement?
This is Jeff Barnes, County Counsel. I just, maybe a point of clarification in the alternative site analysis section, Supervisor Levere, that you cited, staff has accurately said that if it's a non-preferred site, then alternate site analysis is required. If it's a preferred site, and maybe I'll just read the sentence, if staff in the county may require the applicant to do an analysis. It says an alternative site analysis also may be required as needed to determine that the facility is sited in a manner that is most protective of coastal resources. And so to your point earlier, coastal resources does include scenic views from public viewing locations. So my interpretation of that is that the Planning Commission direction was consistent with this provision of the coastal zoning ordinance, and that the county can, but it doesn't have to require alternative site analysis.
Yeah, I appreciate that, Mr. Barnes, because that was my understanding too, reading that section of the coastal zoning ordinance where it said, these analyses may be required when we're looking at protecting coastal resources. And that's why I thought that the Planning Commission direction was legally sound. And again, that goes back to all of the deficiencies that I found going through a lot of this alternative site analysis. That really caused me concern, and it really, I'll have a lot of pause being able to make the necessary findings to approve this, given what I found to be a lack of both substantial effort and documentation in the alternative site analysis. Because my reading of that was that the motion by the Planning Commission was something that we were legally able to have AT&T do. And so I appreciate that input, Mr. Barnes. I believe that is it. Thank you, Madam Chair.
Thank you. Thank you for your comments and good questions too. So we have, I believe Supervisor Long and Supervisor Ramirez both had some questions. Is that right? I'm not seeing Supervisor Long right now. So Supervisor Ramirez.
I'm here.
Oh, you are here. Okay.
Yeah, I'm here. Thank you. It was to staff or the appellant. I understand this stealth flat enhancement look, but on many of the sites for cell towers, it talks about the design of a monopine or monopalm. So it at least looks somewhat appealing to some type of tree. Is that something that is requested or required? I know we have those in certain locations and they look better than just metal. And I do hear the concern of the community in saying that this is right in front of their door. So I wanted to ask if that was looked into.
Yes, Supervisor Long, we do look into that. Caltrans and the right-of-way do not allow these stealth wireless communications facilities. So in the public right-of-way, they're limited to using the infrastructure that Caltrans has in place. So putting a fake, any kind of tree, fake anything actually in the Caltrans right-of-way was not an option for AT&T.
And this pole is in the Caltrans right-of-way?
Yes, that is accurate.
Okay, thank you.
Thank you. Supervisor Ramirez, do you have questions?
Yes, and I want to thank Supervisor Leviers for really digging in here. I guess one of the things that concerns me is that some of the areas that were looked at were, the phrases not allowed, won't entertain, etc. And I understand when the facility won't propagate the signal. We do need to have signal for all sorts of reasons, including public safety. But I probably would need more clarification on, for example, it seems like oil piers seems to me, no expert here, would be a really good site. It'd be out of the way and good signal propagation, but state lands it just seems sort of like casual. It won't entertain anything, though they have no specific plan to take the pier down. So I think I would agree. I don't know how I'm going to vote at this moment, but I would tend to want more documentation of some of these places where it's not a signal problem, to make sure we had something in writing saying, no, that it's absolutely not allowed or it's against the law, etc. But let me ask Mr. Barnes about this. What I thought I heard you say was, it seemed like you were saying we didn't have a lot of choices here in terms of denying or allowing the application or the appeal. Can you just review that with us again?
Yeah, I'm sorry. You paused out for a second, but it sounds like your question was asking me what the potential grounds of denial here are.
Yes, or yeah, can we deny this?
You can deny it. If you're going to deny, your board needs to identify a specific provision in the coastal zoning ordinances, applicable development standards or permit processing requirements that you believe have not been complied with. and that type of non-compliance should really link up with the. It sounds like where this is going is with the, is this the least intrusive means of filling a coverage gap? It doesn't sound like there's much dispute. There's a coverage gap to be filled. So then the question under federal law is this the least intrusive means? And so that's where the alternative sites analysis factors in that you've been discussing. And so your board would need to identify, what you think was deficient in that regard in terms of our own rules, and specify that for the record in terms of making a denial. Another option would be to send it back and request that additional information be provided for you to make a decision at a continued hearing. So that's something else to keep in mind.
Thank you.
Thank you. And it does seem to me that there are other opportunities to make this less intrusive. And I would also like to see, particularly in such a scenic area, that we have due diligence on the part of the applicant and see if we can come up with something better. With that, I'm going to go ahead and close the public hearing, and then we can turn it over to discussion. And I guess I started the discussion already, and look to other comments and or a motion.
I'd go, Madam Chair. I don't mind making a motion if now's the appropriate time.
That works for me.
Okay. Yeah, I would move to deny this appeal, citing to Coastal Zone Ordinance Section 8175.5.20.10.J, which is the alternative site analysis, sections 1 through 4. As I said in my comments and questions to staff, I find a real lack of effort and documentation to truly explore alternative sites which might be less intrusive. I can speak for myself. I know I would not want this right outside my front door. And I believe that really with more due diligence, an additional site could be found given just the various potential sites all up and down the North Coast. And so that would be my motion based on that Coastal Zone Ordinance section. And given that, I think additionally, that'd be the first prong of my motion, was to deny it based on that Coastal Zone Ordinance section. And then secondly, because of that, I do not feel like we can find the necessary findings under section 8181-3.5, sections A through E, which have to do with the standards complying with the local coastal plan.
I'll second that.
We have a motion and a second. And I think another good point that was raised was that this is not the worst case scenario because of the fact that we do look to co-location. So allowing for this allows for, as was stated by one of the testimony from one of the residents, is it could add more to it and be even more of a visible light. So I think, and I have seen in the past where by rejecting, you end up with a better project because there is, as I was saying, more diligence to come up with a better alternative. So we have a motion, a second. Unless there are any other comments from supervisors, let's go ahead and have a roll call.
And Supervisor Parks, to be clear, the motion is to deny the appeal and the findings.
That is correct for the reasons stated.
Right, correct, okay. Supervisor Levere?
Yes.
Supervisor Long?
Thank you. Yes, I do support Supervisor Levere as this is in his district.
Supervisor Huber?
Yes.
Supervisor Ramirez?
Yes.
Chair Parks?
Yes. And that is denied, and as I understand, we'll have an opportunity, hopefully, to see.
Supposed to be denied.
with that then, that concludes the item 39. And we will go back to item 38, which I believe we didn't have public comments for. This is also a hearing on a much anticipated landscaping ordinance that our staff has been working on, and I'm looking forward to the presentation. I believe Abigail Convery is going to be doing the presentation. And so with that, I'm opening the public hearing and we can get our staff report.
Hi, let me get going here. So,
I like your background.
Thank you. I picked it specially for this hearing. There we go. Yes. And I am going to share. Just a moment.
There we go. We have it now.
All right. And working off of these. Okay. Good afternoon, Chair Parks, Mr. Powers, and members of the board. My name is Abigail Combray, and I'm the planning biologist for the Long Range Planning section, and also the case planner for this proposed landscaping amendment to the non-coastal zoning ordinance. It just came to our attention that within your board letter for this item, references to 8106-8.2.3 D should be changed to 8106-8.2.3 E, and we'll go ahead and submit a revision memo to the clerk for this. And I just wanted to touch base with you all. Since you're running behind on the schedule, did you want a full presentation on this item? It runs about 10 minutes. I can cut it down to 5 to 6, or I can just skip to the recommendations.
I will ask my fellow supervisors. I think it's a really excellent ordinance that you've put together. I appreciate the opportunity. Do any supervisors want the full 10 minutes, or would you like just the recommendations? Can we start?
I thought it was a great staff report, very thorough. I got a lot of information out of it, so I would be okay moving straight to the recommendation. Thank you, Ms. Convery.
Bob Huber, I'd be fine with this, going straight to the recommendations.
Agree.
Agreed. Okay, let's go ahead and then do that. And don't mean to discount at all the incredible work that went behind this and the many hours and months and all. So
okay, no problem. Let me, if I could do this a better way, but you're going to get the quick version of it. I have so many animations for you. Okay. There we go. All right. So planning staff asks that your board take the recommended actions shown on this slide in page 1 of your board letter for this project. And then I was just going to say if you all have any questions associated with it.
I certainly wanted to compliment staff for putting this together. I think this is so needed. I really appreciate something that I really wanted to pursue, particularly with the pollinator type of plants, because how important that is. And we're seeing a loss of bees, and even the bumblebee now is being looked at as a possible rare species. You wouldn't expect that. And obviously we have the tremendous potential for population collapse with the western monarchs, and I saw a couple of photos, and I know you put that forward, but I'm wondering, in the push for pollinator friendly landscaping, if we could have an emphasis towards the monarch butterfly, towards the planting of native milkweed. I know you have in there not to plant the tropical milkweed, which has the pests that can impact the monarch butterflies and all. But I'm wondering about if there is a way that we can, in this time, this year, I mean, we want to be able to step up. I know the Santa Monica Mountains Conservancy stepped up with $250,000 worth of grants for those who can come up with programs to help the monarch. Do you see where we might be able to insert an emphasis in that pollinator friendly? It's not just that, but also planting trees that are specific to keep this species from becoming extinct.
Yeah, I know that we do have standards, or I should say we do have a standard in there that says it encourages the planting of host plants that provide, larval habitat, and that is an encouragement. I know that as far as the milkweed is concerned, it's really associated with more of the inland sites. We find that for the overwintering population, we really want to, at least within 3 miles of the coast, near these roosts, plant the nectar plants that will help sustain them during the overwintering, and then plant the milkweed further inland in the county so that they can actually feed and breed and then create the next generation. So that, that's a little fine-tuned for this, I think,
right,
ordinance, but go ahead, yeah.
It may be something that I can come back with later, because as a county, well, this is an ordinance, when someone's doing landscaping, the county itself has its parks and its golf courses, and maybe that would be a place where we can get more quick action on trying to address this concern. And I just, last note on the monarch, because this is really a passion of mine, is that not only does the tropical milkweed have this pest that can, kill off the monarch butterflies, but it also blooms more, right, throughout the year. So the monarchs will be more interested in that and no longer do their migration, which is such an important part too. So there's a couple of reasons why we want to make sure that people don't plant the tropical, as beautiful as it is, or if they do, that they cut it back during the overwintering times or during the rest of the year, so the monarchs will continue to migrate. But thank you for that.
Yeah, no, and you're so right, because honestly, it's really so sad to see if you've been to a monarch roost, it's pretty magical, it's amazing. And to think that we're watching that sort of go away, like disappear in front of our eyes, and people's children won't be able to see that. So I agree with you that this takes action. And I also know that the Water Protection District, with a lot of their areas, I know that they're working on some restoration sites, not only for the roosts, but also for some of that breeding habitat inland. So, yeah.
And it's just for the public. We had 1.4 million at the count of monarch butterflies about 2 decades ago. Last year, or 2019, they had 30,000 they counted. And then this November, they counted 2,000. So you just see that tremendous drop. So that's why we need to have this emphasis. And like I said, I think I'll come forward with a board letter on what our county can do on our own facilities. But I really appreciate the good work on this. Supervisor Ramirez, you had some comments too?
Yes, actually, I've had the privilege of visiting the Monarch Sanctuary in Mexico, and right outside Mexico City, and it's unbelievable. I don't know how it is now, but it is actually, butterflies can be loud when there's thousands of them flapping their wings, and it's I know we're not just talking about the monarch, but the monarch is very important to many of the people that are immigrants to our community, because they are from Michoacan, and the monarch represents the ancestors in their next life. So beyond that, it's just so important for the pollinators to be, and the insect world to be saved. I think a lot of us never realized what a dramatic negative effect would be if we lose our insect population and our pollinators. So I think this is great. My husband and I planted a native garden just in our little yard in Oxnard, and we see a tremendous variety of native bees, hummingbirds, other birds. So it's a great thing to do.
Yeah, and that migration that goes from Canada all the way to Mexico. So that's all along that coast is the one that's the Western monarch. If there are no other comments, go ahead. We have an opportunity for a motion on this, and
I'll make the motion.
Thank you.
Adopt.
I'll go ahead and second that then. And could we please have the roll call?
Supervisor Levere.
Yes.
Supervisor Long.
Yes.
Supervisor Huber.
Yes.
Supervisor Ramirez.
Yes.
Chair Parks.
Yes. Thank you, Abby. Great job. Thank you, Mr. Ward, and your staff. Just really appreciate it. Glad to see it happen. All right. With that, that concludes our 3 p.m. And then I think we'll go back then, and we have the opportunity for public comment and board comment and CEO comment, which I'll try not to forget. And so with that, I know we have some people who are on the line who wish to speak for public comments, and then we also have a dozen or so to read into the record, as I recall. And so with that, with our public comments,
Supervisor,
Parks, I think we did the public comments.
That was okay, and that was a lot with the doctors. Is that
right?
Right. Okay, got it. So then that makes it a little quicker. We'll go to board comments then, and we'll again go by district. Supervisor Levere, would you like to go?
Yeah, great. Thank you, Madam Chair. I'd like to ask that we close today's meeting in honor of the list of individuals that I submitted to the clerk. And I especially want to call out one individual, Mrs. Sue Ellison, who passed away at the end of February. Her and her husband were two of the most generous and philanthropic people I've ever come across. Really committed to causes including veterans, youth and education, and faith-based organizations. They gave so much back to this community. And Mr. Ray Ellison passed away a little more than 5 years ago, but Mrs. Ellison passed away at the end of February, and I know they'll be sorely missed in Ventura. And so I want to send my deepest condolences to all of their children and grandchildren and great-grandchildren. Thank you.
Thank you. And then Supervisor Long.
Good evening, almost. Thank you very much. Along with the state and federal local COVID meetings that we're on our weekly basis, I'm at the pleasure of co-chairing the RDP 21 and having the virtual base visits with Jean Fisher, and appreciate Supervisor Levere being on there as well, as we really focus on our base and making it stronger. We had a great presentation with the Port of Hueneme and the integral part that they're working on with innovation in STEM with FathomWorks and our EDC collaborative and so forth. So I would like to say thank you to everyone who is working on those projects to make sure that our base is solid, functioned here. So the Rear Admiral came out and took a visit of our FathomWorks program, is really excited about what we're doing with our community and the educational industries as well. Also did a presentation on our county for the Santa Paula Rotary Club, and they were very thankful for all that we are doing for COVID-19 and also our healthcare facilities at the Santa Paula Hospital and the new location we're looking at for the Harvest for a more robust medical center area.
Along with that, appreciate CEO's office and our different departments on looking at the fees and penalty waivers for our businesses, all that you're doing for the vaccines and testing facilities. As we know, this is not going to go away, and our schools and the kids' sports, how they have to do more testing to make sure every week. And so that's just going to add more complexity. And so appreciate everyone getting in on that. And then hopefully I would like to ask that Michael Walker also update us on any lawsuits and businesses that we have. I'd like to have that on our agenda next week. I don't believe we have any outstanding, but if we do, I want to make sure that we get updated on those. And then again, I'd like to adjourn in memory of those that I'm submitting on the list. I don't know if everyone had heard, but we had a Navy sailor killed that was one of our very own in San Diego, Aaron Michael Fish, and want to say our condolences to his family as he served for our country. The crash occurred in a convoy that was just not something anyone would want. And so talk to Captain Salm, and he sends his regards to the family as well. And then also Mary J. Miller, the mother of our Chief of Staff, Brian Miller, who passed away for COVID. And thank you to their family for all that they do as well. So thank you for the opportunity, and stay safe, everyone. Thank you.
Thank you, Supervisor. Supervisor Huber.
Hi, thank you, Madam Chair. I feel like we are cautiously turning a corner on the pandemic, and while we continue our health protocols, I think we need to look ahead to dealing with the emotional impacts of this trying time, especially the impact on our children who may not have had a supportive, safe, and stable environment at home. I'm confident our county family will be poised to help these young people to survive and hopefully to thrive. In closing, I'd like to adjourn in memory of the residents cited on the list I sent to the clerk of the board. Thank you very much.
Thank you, Supervisor Huber. And that reminds me too that March is National Social Work Month. And our social workers for the county and otherwise are out there working to assist our children, not only behavioral health, but there are also concerns, for example, about violence and other impacts to children. And so I want to thank our social workers. Thousands of children and family and school social workers across our country provide assistance to protect children and improve the social and psychological functioning of children and their families. We appreciate our, right now, the theme for Social Work Month is peer support. And that really embodies the need to recognize the extraordinary contributions of the profession of our society. We have the Social Worker Society has been so strong in being able to be there for families, for children, and working with the different partners that we have throughout the county. And I just want to take a moment to recognize our social workers in our community who really share a commitment and dedication and advocacy that really improves lives every day. It's one of the tougher jobs, and they often are not recognized for the great work that they do, but it is a very tough job, and they go to the homes, they work with the children, they work with families and try to keep them together. So I want to thank our social workers for the county. I also thank Michelle Guzman, our government relations manager, who helped us to put together a resolution that we are going to be presenting to our social workers too. And then again, I wanted to thank Lori Peters. We unfortunately, she had to leave early and we had some technology issues, but it was great to also recognize Women in History Month too. And then all our supervisors, most of our supervisors were able to meet the governor and to hear from him firsthand about the state's COVID response, and to also really get our points across and how important it is to our county to get those vaccines, and the great job that we're doing in the sense that when we get them, they go in the arms. There's no sitting around in storage. We are one of the best, I think, in the state in being able to administer. And so I look forward to being able to just really grow the number of vaccines that we get so that we can increase the number of people who get them, and would love to see that continue to grow and get us that herd immunity that we're talking about as soon as possible. With that, I would also like to just ask that we close in honor of a few individuals. We have Jeffrey Philip Craig. I'd like to recognize. He was a Scoutmaster, Eagle Advancement Chair for our Ventura County Council. And then also Charles Ladd, who was with the U.S. Army in World War II. We're losing those wonderful World War II vets that we love. Also, Matthew McHenry. He was a youth coordinator in the California Department of Corrections, and he was dedicated to rehabilitating troubled youth. He attended Westlake High School and was a warrior, Westlake warrior, and was very proud to know that his team ranked #1, his baseball team ranked #1 in the nation by USA Today. And then also I wanted to recognize William Howard Powell. He was an officer of the United States Air Force. He served as both the chair and the CEO of the nonprofit Dancing with Our Future Stars, a program that brings free dance and physical education to Title I schools in Ventura County. And very importantly, Mr. Powell also served as president of the board of Casa Pacifica and just did such tremendous work for them. And I know he will be sorely missed. He was a mentor to many minority teams in Oxnard, California at the Boys and Girls Club. And then just finally also wanted to mention Dick Rosica, who was a planning commissioner from Thousand Oaks. And with that, another wonderful woman that we have lost, Deborah Schultz, who made over 1,000 quilts, which she lovingly donated, and wanted to make sure that we recognize her too. Supervisor Ramirez, you are next.
Just very quickly, I really appreciate all of the comments of my colleagues and honor the memory of the people who passed, and I've submitted a list. And I wanted to especially recognize someone I didn't know had passed away in January, and that's attorney Kevin McBary, who was just a wonderful colleague, lawyer, cared about justice, cared about helping people get better, and I was sad to hear that he had passed away. And the only thing I'll say here at the end is that we've had a long day. Some of us have hardly gotten up from the chair, and that's not healthy, from 8:30 to 5:09. But we were putting in the work to help our county continue doing the work of keeping things going. So I just want to emphasize we cannot let our guard down. Things do look brighter. We see, as Dr. Levin said, a spotlight at the end of the tunnel. But if we're not careful, we'll prolong the suffering here, the physical suffering and the economic suffering. So wear your mask, wash your hands, don't gather unless you've gotten the go-ahead, and let's continue to stay safe. Thank you.
Yes, and I love the thought that we are now weeks away instead of talking about many months, where it's just a matter of weeks. We'll be able to open our schools, get people vaccinated. It's nice to see that spotlight. And now I will go to our CEO, Michael Powers, the closer.
Thank you, Chair Parks and board members. I appreciate the time, and I want to reinforce something that someone you mentioned, Chair Parks, Bill Powell. I got to know Bill as the president of Casa Pacifica, and he took over at a time when they were in transition, facing financial challenges, and he wanted to meet and just sit down with our team, with his team, and be very open. And what an amazing person! Very incredibly successful, CEO in private industry. But once he retired, he fully dedicated himself to children in need, foster kids, low-income children. It's all he was about. Cause Pacifica, Dancing with the Future Stars, he and his wife Jewel. Their whole life was just generosity and giving to others and caring about kids in need. So he will be sorely missed, both as his impact in our community, the charitable impact is enormous and will live on for many decades. And he was a great friend too, so I'll always carry him in my heart. You mentioned social workers, and it's so important to highlight them because they're still going out, they're essential workers into the community, as you said, Chair Parks, into homes that are in need and doing amazing work. And you mentioned Michelle Guzman, who helped with that. She's actually on our vaccine task force. What we'll do next time at our next presentation, I'll give you just one slide of the people on the task force, because we're pulling the best people around to help, to put on this project, because it is your board's priority and it's our community's priority. And again, as I started the morning, when you go to these vaccine sites, as I said when the governor was here, with all apologies to Disneyland, those vaccine sites are the happiest place on earth right now, because the people are getting the vaccines and they're getting treated great by county staff. So thanks, everyone.
Yeah, I feel like the seniors go in with their walkers and come out doing cartwheels.
Right, it just seems like it.
It is wonderful to see. All right, with that, I'll ask our county council, do you anticipate any announcements from our closed session?
There may be one, yes.
Okay, so if we have an announcement, we will come back and adjourn from open session. Otherwise, we will go ahead and adjourn from closed session. Thank you all for your diligence and good work.